I'm waiting for confirmation from Joe that we're actually fired up and ready to go here. Okay, we're live now. So I'd like to thank everybody for coming today and joining us online. There might be others that will join us throughout the day. So at this time, I would like to convene the regular tribal council meeting of Wednesday, January 27th, 2021. And it's 10:04 a.m. Secretary, could you perform the roll call, please?
John Gentry,
Here.
Gail Hatcher, here.
So at this time,
Roberta Frost, here.
I'd like to convene.
Clay Dumont,
Here.
Willa Palace,
Here.
Ellsworth Lang,
Here.
Jeannie McNair,
Here.
Rose Treetop. Okay, Brandy Hatcher is excused. Jesse Hikakta will be in this afternoon.
Great. Yeah, we heard, I didn't hear the response from member Treetop, but I know she's on. I could see her there.
Oh, okay.
So,
I'm here.
thank
Okay.
you.
Sorry, Rose.
So we have a quorum established. Member Treetop, before we get to the agenda, would you provide an invocation for us this morning, please?
Can you hear me?
Yes, we can. Thank you.
Thank you, Father, for today. Father, we thank you for your blessings and meeting all of our needs daily. And I ask you to bless all of our council members today and all of the families that are represented. Father, meet all the needs, Father, according to your will. Father, we thank you for waking us up to a new day, and thank you for protecting us and keeping us safe and healing our families as we go through the day to do all that we need to do for our people. Father, I thank you for giving us wisdom and knowledge and showing us what direction, Father, that you want us to go for you to help our people when they have needs that need to be met. Give us the direction and give us the knowledge and wisdom to be able to follow the footsteps of our ancestors and those that have gone before us. Father, bless those that have lost loved ones and comfort them and heal them, Father, in a timely manner. Father, we just thank you and praise you and just give you all the praise, all the honor and the glory today in the name of Jesus. Amen.
Thank you, Rose.
Amen.
Yeah, we appreciate the prayers for those that have lost loved ones. It just seems happens so frequently that we lost our elder and good friend and community member, Butch Kroom. And also Treasurer Hatcher lost her sister, Wendy. And those are the two that I'm aware of, but there may be others. But I would like to have a moment of silence for those two and the others that we recently lost, and just encourage folks to continue praying for them and encouraging them, and when you have an opportunity. So if you could please join me in that moment of silence, I would appreciate it. Thank you. Thanks, everyone. Yeah. It's just happening way too often, huh? Such a close community, but all the best to the family. First up, we have the agenda. I know other couple matters that I would like to add to the agenda. There was a letter of support just under the chairman's report. Support for Deb Haaland or Halen. I'm not sure how to pronounce her name.
I did place that on the agenda under the at-large members report. Do we want to move it?
Oh, I see. I responded to the email before I noticed that. Okay, that's great. That's fine. So no need to put it there. And I know Member Palace is prepared to lead us through that. So that's great. The other thing is I was following through with kind of the ugly nickel ad, that's anti-tribal, and I did have some things to report on that. So I want to add that to my agenda, my contact with the Herald News regarding that nickel ad. And also, I did get a call or text message from Alex Schwartz about the recent BOR guidance, and I know we opted to provide information out to our members. Right, he's interested in writing an article and wants some input, so I thought we would talk about that too. And so we can put that under my report. And we wanted to follow through on this Community Action Council appointment. Dr. Hill, I don't know if we could have a little bit of discussion about that. And, you know, I don't know if you're prepared to consider that today or give you some more time. I guess we could put that on right while you're with us on the Homoski implementation presentation. So we can add that right after that. And Secretary resent some of the emails to provide some background on that. So if we can add that, I would appreciate it. And are there any other needed additions or corrections, changes?
We have the CARES Act General Welfare Fund Program Report that I forgot to add. We need to add that
Okay.
in the afternoon someplace.
And it looks like we have a time commitment, or through the afternoon, we have time commitments.
Until after 3.
Yeah, until after 3. So I think that might be better to, you know, put notice out to folks that are going to do that to come on somewhere around 3:30. Do you think that would work?
Are we, what number are we going to add it?
If it's 3:30, we could put that. So I'm not sure how long for the item number 7. It's probably not going to take a lot of time. Is that correct?
I don't think so.
Okay. So and I was thinking that should we just plan on 4 p.m. perhaps? Oh, okay. Tribal attendance promising practices. I'm not sure.
So do we just
do you
want to put
recommend?
it after Laurel's
Okay.
presentation?
Okay. Let's put it there.
Okay.
Thank you, Secretary. All right. So that would be number 8, and that would bump the rest down accordingly. Okay. Anything else, folks?
I did send out a email this morning, and I don't know which of the council had a chance to read it, but we had other parts of the structure that we were talking about on Friday, and whether or not we made a decision, or I wasn't clear on that because I've been getting questions from managers.
Mm-hmm. That's some of the employee type assistance
Mhm.
matters, and yeah, I saw the emails, and it would be good to have appropriate discussion on that. Should we put on that on agenda, or is it more of a work session related item? I know we probably need to take some action, correct,
If
Secretary?
we're doing it by a work session, we need to do it this week. Would be helpful, I think, for direction for staff.
Okay.
Chairman,
So-
I would at least have a small discussion on it on the meeting for tribal members who are watching, because part of the issue is that there is a breakdown in communication, you know, between council staff and the tribal members who are seeking to get services from these programs.
Mhm. Okay, so should we just do that right after the CARES? Or
That's fine. I have no preference. I just got questions.
okay, let's plan on that then, and yeah, so we'll do that kind of simultaneously or right along, since it's related. So, okay, with anything else, folks? If not, I'd entertain a motion to approve the agenda as discussed. Okay, Member Palace picks that motion. The second by Member Lang. All those in favor, say aye.
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 I,
Aye.
Aye.
Okay, those opposed, the same. Hearing no opposition, and with my space in the word all of a sudden.
abstention.
Yeah, abstention, the motion carries. So thanks, folks. I can't even claim it's a Monday. It's a Wednesday. So, okay. Dr. Larrabee, thanks for joining us. I guess we'll look to you now for the monthly report.
Thank you, Chairman Gentry, and officers and members of the Tribal Council. It's a privilege again this morning to start this day with you and to present our December reports. I want to start by thanking the Council for all the approvals that we've had since the year began and the support that we've enjoyed from you and the whole Tribal Council members since the year started. Thank you very much. This morning, I have somebody important in the meeting with us, Dr. Katie Martins, who just resumed work with us in a new portfolio as an interim CMO at the Wellness Center. She's here with us this morning, and I thought maybe I should just begin by introducing her to the council and to the tribal community. Katie Martins, are you there?
I am.
You're welcome to the tribal council meeting today.
Thank you. Thank you. Good morning, everyone. It's great to see you here. Some of you I have met before, and some I haven't had the pleasure to meet yet. Yeah, I'm really excited to be joining the leadership team of our clinic in this role, and we'll continue seeing patients as a provider in clinic, but looking forward to the future and thinking about how to, help really promote the health of the community in this kind of role. So thanks for the opportunity. I'm really excited and pleased to be working for and with you guys.
Oh, thank you, Katie. Well, welcome on behalf of the Tribal Council, our people. Glad to have you there. Looking forward to getting to know you more, and glad you're here with us. So thank you.
So, Chairman,
Yes.
could we have Katie describe what her position is? Because those viewing probably don't know what a CMO stands for.
Yes. That would be very helpful. Thank you, Secretary.
I'd be happy to. Yeah, thanks. As you guys know, right now I work as a primary care provider in the clinic. I spend about 2 days a week there, and I'm trained as an internal medicine physician, which means I mostly do complex adult medicine care. In this new role, I will continue to see patients, but on the other days of the week, I kind of step into a leadership role where I work directly with AJ, who is the lead primary care provider and sort of in the kind of a medical director type role to help guide sort of bigger picture things that happen outside of our clinics. So I will be working with AJ both on the implementation of the day-to-day stuff, but the bigger part of my role is thinking about vision and direction for our programs, integrating our clinic with dental and behavioral health and pharmacy in a more in a little bit more official, programmatic way, and then looking over, our quality metrics and making sure we're really doing the kind of care we need to be doing. Right now, sort of my biggest priority in this role is honestly just trying to make sure that we're filling all of our positions with qualified and great people who want to work for the Klamath Tribe, so in our medical side of the clinic. And in this way kind of offloads some of those future direction pieces to someone like myself who has a little bit more time on the other days to look over that stuff. So if it makes sense, I kind of think of myself as like the outside the clinic director, and AJ is the inside the clinic director. And we work very, very closely, but this way it gives a little bit more time for thinking ahead about what's coming down the line, where we need to be in a year, where we need to be in 5 years in terms of staffing programs and integration of our services.
Great. Well, that's really helpful, because there certainly is a need to make sure that we're providing more holistic care for our folks. I was going to ask, as part of your responsibility to coordinate with external health providers also? Is that a part of
Yes.
that?
Yeah, so as you guys may know, I work kind of in contract with OHSU as well. And so some of this has to do with both growing our referral networks and our programs and improving some of the relationships that we have between the networks, both in Klamath County, but also outside of us. I feel really passionate about making sure our patients get really good care and get treated really well every place that they go. And so part of on the top of my list is, you know, working closely with Sky Lakes around what happens when our patients spend time in their facilities, and also thinking about the greater referral network that provides care for our folks.
Yes, Secretary?
I have a question about like patient access. Are we looking at, because right now we're pretty limited. We don't have walk-in care. So if a tribal member calls up, if they don't have an appointment, sometimes they're not afforded the opportunity to come in on that same day. What are we looking at? And I know you just started, so this is probably not a fair question to you, but what are we looking at going forward? And when are we going to expand what we currently have available to tribal members?
Yeah, I will answer the best that I can with the knowledge I have. But in general, you know, as you know, we do have same-day access in walk-in clinic, which has just been limited in recent months because of the need to schedule for COVID, because of staffing and the need to be able to run a separate clean side of our clinic and a dirty side of our clinic, you know, dirty in terms of infection control. Mm-hmm. And so right now our schedules are set up so that providers do have same-day slots. So that if someone calls in, we try to fit them in, you know, sort of essentially spread the walk-in clinic out over the providers. But with the need, you're right, often those slots are filled. And so it's not so that someone can just walk up like they used to be able to and get on a list. And a lot of that has to do with just infection control. We don't want to have 10 people waiting in the lobby. You know, we don't want to do that kind of stuff. So there is a phase sort of reopening plan that has to do with, and Dr. Olerbe, you'll have to correct me because on some of the logistics I need to look at again, but looks at sort of where the staffing is at, where the infections are at in the county to kind of begin to expand us back out. Because as some of you may know, before this, like for example, I was doing home visits and with Dr. Brown, and that was like a big part of our practice that we really enjoyed and extended access quite a bit. Because we'd like drive out to Beatty and see 5 Beatty patients, or drive out, you know, to places where people have a hard time getting to clinic, and those sorts of things we haven't been able to do as readily because of the concern for spreading COVID into those homes or other things. So the exact timeline is still a little bit in the works because it has a lot to do with the statistics of how things are going with COVID in our community. But I'm hoping that with all the vaccinating and the careful precautions that we're taking, that we'll be able to widen that back out, you know, in the next couple of months.
Thank you. I saw Vice Chair Hatcher, you had your hand up earlier.
Yes, just a quick question for clarification. Dr. Martin, are you interim? I'm assuming you're interim CMO?
Yes, so the reason that we kind of settled on this designation for now is that per the way that the CMO position is written, there is a indicator to be like a certain number of years out of training. And I am 6 months short of being that many years out of training. And so when Dr. O and I decided that it would be an interim position until that time is up, at which time, you know, Dr. O and whoever needs to be involved can evaluate and decide whether it makes sense for me to continue to fill the role.
Okay, thank you.
Yes. Any other questions? Katie, well, it's great to have you in that position, and thanks for your service to our people, and sounds like you hit the ground running, and really appreciate what you bring.
We are very excited to have Dr. Martin with us again in this position. I'm looking forward to better days for the Wellness Center. Thank you, Martin, for accepting the offer and what you have done thus far in the last 1 week. We are so happy and proud to have you in our midst. Thank you very much. And to Secretary's question, with the vaccination and all that's going on right now, we're hoping that on or before the end of March, we'll have all our facilities open again for walk-in services. But that again will depend on what Martin's mentioned in terms of staff availability. But if by middle of March, we all have a vaccination from the mass vaccination, then before the end of March, every staff would have been immunized against COVID, and we can have our services back the way they used to be before COVID. That's why I'm beginning this morning by talking about the vaccination and the vaccine approval in December. This was a major landmark in the history of vaccination globally because of the speed of approval and realization of this dream. So in December, we had 2 vaccines that were approved through the EUA, the Moderna vaccine and the Pfizer vaccine. But we in the tribes opted for the Moderna vaccine because of its logistic benefits. And we got our first 200 doses of vaccine on the 22nd of December and commenced vaccination the very next day because of the need to start very quickly. And we also commenced vaccinating our tribal elders on the 30th of December, 2020. Till date, vaccination has been ongoing, and as we all know, we are planning for 2 major mass vaccinations on the 2nd and the 9th of February this year. We're hoping that will give us a chance to vaccinate over 1,000 tribal members and also most of our staff population, thereby building up the herd immunity of the communities and ensuring that COVID spread is minimized in our community. However, as we vaccinate the tribe and the staff, we still continue with our prevention practices. The vaccination does not offer 100% protection against COVID. However, it also takes about 6 weeks from the first dose of vaccination to be fully immunized. And so we have continued our prevention practices, face masks, washing of hands, social distancing, avoiding gatherings. But in addition, in December, we were able to activate the Kokomo app, which have helped us to monitor our staff on a daily basis. And we also have kiosks, temperature kiosks in all our entrances to our tribal health offices. These 2 have helped us to minimize significantly in-office exposure to COVID, as well as also protect our staffs from being COVID infected. In December, as part of our tradition, we were able to, for the first time, host our all-staff meeting virtually. We couldn't have a physical meeting, but we thought that it was important that we had this meeting. 1, to give staff a chance to relax, to meet ourselves virtually, and also to learn from very seasoned individuals from the tribe. So we had 2 major presentations from Dr. Gallagher and Simbea, and these were well received by staffs who participated in the meeting. And we had over 121 staffs in that meeting, which was for about 2 to 3 hours. And also in the meeting, we were able to recognize some of our staff members who have worked with us for the past 10 to 15 years, 10 to 20 years, and offer them with a certificate of long service awards.
Wow.
In December, we welcomed 2 new staffs. One is Jill, who has been a staff with us, but she was promoted to the level of a supervisor, and also a new temporary staff who joined us to support the SCAL projects. Despite the COVID, Wellness Center continued to provide services to our tribal members through telehealth and scheduled care, and also minimum walk-in services. Vaccination continued, COVID testing continued, and also we were able to partner with Skylake and other healthcare workers within the county to preserve our scarce resources through a meeting that was held on 1st of December in 2020. And that meeting was actually coordinated by Dr. Martin, who is here this morning. We also finalized all preparations and trainings to have our own tribal contact tracers. And this was a major achievement for us in December. And they have resumed work this January, and the feedback from the tribal members have been very interesting, actually, and very encouraging. Because of COVID also, we've been trying to work on what we call the HealthStream app, tool to help us have online trainings for our staff members to keep them on the cutting edge of science despite the COVID and the travel restrictions. Although we had lower number of patients seen in December, we tested more people for COVID in December. And also we had more positivity rate in December of 11.5% as against 7.6% that we had in November. December was actually one of our most busy months. And also we had the highest number of cases and also even staff isolation and quarantine in the month of December. At the Youth and Family Guidance Centers, work also continues, but again, through telehealth and remote services. However, some of our workers were innovative enough to pay visits to our staff, to our clients, even in their homes, to ensure that they maintain connections with these individuals and ensure that they receive their services. But several of our support groups were put in abeyance during the month of December because of COVID issues. Our 2 homelessness PSC ended on the 31st of December. One was domiciled here in Climate Fall, and the second was in Chiloquin, and they ended in December 31st. YFGC also, using a fund from Oregon Behavioral Health Cares Grant, purchased 2 14-passenger 4x4 vehicles and also a mobile counseling unit, which will be used to provide community-based services all through our environment. We have several ongoing grants at the YFGC, and some of them are mentioned above. Other departments also continue providing very innovative and very interesting services to our tribal members. For instance, the pharmacy filled over 8,000 prescriptions in December, and this was about 25% increase over November figures. And this was also very innovative in the sense that most of these prescriptions were delivered to our tribal members in their homes with a partnership with the transport units. And this was well received by our tribal members. IST, the information and system technology have also worked so hard to ensure that people continue to work from anywhere they are, remotely or from their homes. And there have been several migrations to new servers and new providers since the November, December last year. We are still working on the final floor plan for the Citadel New Way, and to minimize access from people who use our facility without permission, we were able to put in a temporary fence at Citadel New Way, and this has safeguarded the building from vandalization by individuals who are not allowed to be there. The Kada building, we're able to finish the asbestos survey, and right now the asbestos are being removed. And when that is done, we will then finalize the issues of demolition and discuss what to do with the land after that process. The purchase and referred care also were able to process and pay over 190 patients' claims during the month of December, bringing the total number of claims processed in the year to 4,638. We also successful in engaging a commissioned corps officer as our clinical supervisor. She'll be joining us in February this year. We had 1 internal hire, 1 external hire, 3 terminations, 3 employee grievances, 17 employee performance evaluations, and others in December. Financially, we also had a very beautiful month in December. We had 3 of our budgets approved by the budget committee: the juvenile crime budget, the emergency preparedness budget, and then the communicable disease response budget. They were all approved. The CARES fund was extended to December 2021 and signed into law by the then President Trump. We also had an additional $1 billion for tribal entities, which will be distributed using the standard distribution channels. And these are primarily for COVID distribution and for testing and other related activities. Also in health, we were able to receive the 1.6 million CARES fund towards the end of December, and also 188,000 for investigation and immunization. The 1.6 million has been earmarked to fund for all the COVID activities of last year and part of this year as well.
Excuse me, Doctor, just for clarification, the Klamath tribes didn't receive $1 billion. Just for our members listening in, the amounts that you have identified there, the 210,000 for vaccine distribution and 790 million. I mean, those are the total numbers.
For all the tribal entities.
Yes. So,
Thank you, sir. It's not for tribal council, no. It's not for Klamath tribes. It's for all the tribal entities. We have a small percentage of the amount of resources for the tribe.
thank you.
Thank you, sir. After my presentation, the CFO will be giving us a presentation on third quarter financial statements. In December, our challenges are still about the same. First is human resource issues that Dr. Martin have already mentioned. We have a number of vacant positions, staff burnout syndromes, which we try to manage with the all-staff meeting and also some training that we had in December. Staff overload and multiple assignments, as many staff are doing 2-3 persons assignment at the same time in order to allow work to continue. And then the lost leave hours that we mentioned last year, to which also the chairman of the HSC sent a letter to the tribal council. We also have some IT challenges. We have over 80 staff who are currently working remotely, and this is affecting our bandwidth and speed of performance. We had a number of issues recently because of drop calls by the upgrade of our systems here in tribal health systems. And also in December, we had a number of our staff who were COVID infected, and even our suppliers were also infected or quarantined, and this minimized their involvement in provision of services to our tribal people. And the migration to Hunter's internet didn't move as quickly as we planned because of COVID again, because some of our suppliers were COVID impacted.
And Doctor, just so council members, if you have questions, I can't see everybody on the video when we're on the screen here. So feel free to voice any, if you have a question, so we could be recognized. So
I guess
yes, Gary.
my question,
I was just going to,
go ahead, Clay.
you go ahead.
Well, I was going to ask, since we're ramping up the vaccinations, how long do we expect to still have remote work going on?
I'm hoping that my belief is that by March, every staff will be in the office by March ending. So I'm looking at first vaccination for many staff, 2nd and 9th of February, second vaccination, 2nd and 9th of March, and then 2 weeks after that, that will be about the 20th of March. So by 31st of March, every staff would have been vaccinated and immunized. However, any staff who does not want to get vaccinated will sign a waiver form, and we will not be accountable for if that person is exposed to COVID or not.
Okay. And with that, that reminds me that I did send an email requesting, information on whether or not you guys were doing a waiver, so we could share that with the rest of our entities. Did you receive that, or?
I got the mail, and Misty is working on it. Katie, do you have any information on that right now? Or I will get back to you after this meeting.
Yeah. Roberta, we have the waiver Misty's been drafting. We've been just looking at it like last night. And there's
Okay.
both a waiver, the waiver that's just a declination because people prefer not to take it, which of course is their choice. And
Mhm.
then the other is one that people can't take it for medical reasons. And so those we felt like deserved a distinction. For some folks, they're unable to take it, and I don't want them to feel penalized because, whatever reason. So we'll try to get those sorted and sent out pretty quickly.
Okay, thank you very much.
Yeah.
Thank you, Katie.
Member Dumont. Yeah.
Yes, Chairman, I had a couple of questions actually for Dr. O. I know in the presentation you're doing, Dr. O, you said we had received 200 doses, but I know from other communications we've had with the Wellness Center that we've actually gotten more than that at various times. Just for folks listening in, I know that there's also a lot of concern because of the news. The national news is reporting vaccine shortages. And so I was hoping maybe you could speak to any concerns that you might have about having enough vaccines for the 2nd and the 9th.
Thank you, sir, for that question. The 200 doses I mentioned was for December. That was all that we had in December. But since January, we've made a case for more vaccination. So we received 200 doses on weekly basis. And we are trying to ramp that up to 300 to 500 on weekly basis based on use. And although there is a fear of vaccination shortages, we are talking with the states. Yesterday, we had an exchange of mail with the state on how they can ensure that we have the vaccine that we need for our mass vaccination. And the director told us that by the end of yesterday, she gives us a feedback because they're waiting for also authorization from CDC and those who were accountable for that process. But from all indication, we think and we believe that the 2nd and 9th will still hold as planned, except something happened between now and tomorrow.
Secretary, did you?
I just wanted to thank Dr. Alerby and the staff and team at Tribal Health because they've been very, very supportive for the other entities. They're providing testing for the casino employees, among other things. And anytime we ask anything of them, they've been delivering. And I just wanted to express that out loud when they're here on the call.
Yeah, thank you. Member Dumont, something else?
Yeah, the secretary's one step ahead of me here. My next question was about the testing capacity. I spoke with the casino general manager this morning, and he indicated that you've been working with him to get the testing lined up. I of course have concerns about the willingness to vaccinate in our various entities and buildings on the part of employees. I particularly worry that if we have too large a number that aren't willing to vaccinate, that an infected person could really, devastate a staff. And it could even be to the point where, for example, at the casino, we would have so many employees go down that we'd have to close up. And that would, of course, impact not just the casino, but it would impact all 5,600 members. As far as the ability to bring in revenue. So I wanted to ask about testing capacity. If it indeed is the case that we're unable to have high rates of willingness for vaccination, what is our testing capacity as far as all the employees at the various?
I'll give an initial comment and then Katie can continue from where I stopped. We have agreed with the casino to test every staff that's tomorrow, the 28th of January, and we will do that tomorrow. We will also tomorrow vaccinate those who are willing to be vaccinated after the testing, those who are negative for COVID and who want to be vaccinated will be vaccinated at the same time. We also had a mail from Travel Center, and they have been built into the program at the same time. We are not. It would be good not to vaccinate every travel center and casino on the same day. So those who accept the vaccination on tomorrow will be vaccinated tomorrow. We're hoping that the remaining people will be vaccinated either on the 2nd or on the 9th as we do the mass vaccination. Although there were significant hesitances before the vaccine arrived, we have noticed that the level of resistance is going down gradually as people get the vaccine and they share their personal experiences with the vaccine. And so people begin to have more confidence in the vaccine because it is both safe and effective. Our testing capacity is still very high, but we are also planning to have testing just twice, walk-in testing in the clinic just twice every week, Monday, Wednesday, and Friday, to open up Tuesday and Thursday for vaccination activities. Katie, any more comments on that?
Yeah, Member Dumont, it's a great question. And we actually wrestled with this all weekend, trying to decide, if we start mass vaccinating every entity, then are we able to continue to do that as do we have the test to do it? Do we have the staff to do it? And I'll make a couple of comments. I think a lot of our testing guidelines are driven by COVID being new and tests being scarce in the United States to begin with. And so at the moment, we have a lot of tests, and the guidelines kind of haven't been revised to be used in the way that we think of, right? Like intuitively, it kind of makes sense. Like I would test everybody, and it doesn't catch everyone because it has a pretty, significant false negative rate, but it will catch somebody, and that's a good thing, right? But at some point, there becomes a question of like, well, can we do testing? When do you stop? Do you test every day? Do you test once a week? Do you test once a month? And medical staff wise, that would be really difficult for us. But the vaccine hesitancy piece is very key, like you said. So the advice we've given is for this particular moment, we have the staff and the test. Let's do it. And then if it comes up again, we'll have to reassess how many tests we have and how much staff we have, because we're not in an area where there's a ton of guidelines to help us decide, is this a good practice to do in terms of evidence. But it makes intuitive sense to me that it would be helpful if you could do it. And for vaccine hesitancy, I tend to agree with Dr. O. So I think it's not inappropriate that people feel some hesitancy. It's a new vaccine. There's a lot of history and other things that go behind it. And I thought really hard about it. So I just tell people that I got it, but I thought hard about it too. And I have seen, like what Dr. O has said, that as people get vaccinated and they see people do okay, it tends to increase the sense that it's probably going to be all right. And so I am expecting us to probably have a surge of interest about 1 or 2 weeks after we do our mass vaccination campaign, because people will then have known all these people that got it and be like, well, I guess it's all right, which I think is a really fair approach. So I try hard not to shame people for that, because we are asking them to do something that's outside of the realm of years and years of data collection, but we think it is helpful. So what do we do if casino members don't want to be vaccinated, but they want to go to work? I mean, we are saying you still have to do all of the things. You still have to social distance, you still have to wear masks, you still have to, none of that stops for, the foreseeable future, even if you are vaccinated, because we need to see case counts go down and have a little bit more information about, what happens when you're vaccinated. We think you don't get it, but we're not positive that you couldn't spread it on accident. And so that we've tried to communicate really clearly with Joseph over at the casino, because we really do want to emphasize it doesn't change the behavioral habits, test or no test. And so this is more like a testing the way we're going to test tomorrow is more like an extra layer of potential safety that's not perfect, but is probably better than nothing. I hope that answers the question. In terms of capacity, I think it will almost be like a day-to-day thing. How many tests do we have? Do we have any?
Dr. Martin, I did have a question.
Yeah, that helps a lot.
Since you brought up the hesitancy and we vaccinated a number of folks, has anything arisen, any concerns or really significant adverse reactions? I do know that folks can experience some symptoms, which basically indicate the vaccine's working. But I'm just wondering if there's been any problems that have been reported as a result of the vaccinations we've administered so far.
To my knowledge, we have not had any of the side effects that are like listed as kind of adverse events, such as a big allergic reaction requiring a medication or anything like that. We definitely have had people who've run fevers. We've had people with body aches who needed to sit out of work because they felt crummy. And, some people have gotten some swollen lymph nodes or a little rash around the site. But we haven't had any like reportable events in terms of like, we believe this was for this person a dangerous vaccine, which is a good thing. And in clinic, when I see patients, I would say probably about 70% of my patients want to get the vaccine. Cold calling people is a little bit, if they haven't called us to be on the list, there might be a little hesitancy already. And so they have been trying to call, the elders through the list, even if they haven't called us, just to make sure that they know we have it and we would like to vaccinate them. But I'm really transparent with people. You might feel really crummy for a few days. You might actually feel fine. And I just tell people it's, probably better than being on a ventilator, and they usually agree. But it is for real, for some people, a work exclusion. So that's why we don't vaccinate everybody on the same day.
Okay. And since I have you on, I did want to take the opportunity to clarify or, get the information out on how folks can put a request in to receive the vaccine. And we know there's a bit of prioritization there. So if you can, I just communicate that out to folks that may be listening in, you know, what the process is to get in line for the vaccine and what, you know, given the number of vaccines, what is taking priority that shapes when they can actually get the vaccine.
Sure. So right now, I apologize. I'm kind of wandering around my house trying to plug my phone or my computer in. Can you hold for just a moment while I move to?
Sure.
Let me get myself situated here. The short answer is that if people are interested, they should just call the clinic, and we're putting them on a list. And we have been prioritizing, sick folks and elders, and that there is our vaccine coordinator and our scheduling staff sort of have a list that they're going through and trying to get those people scheduled. But our mass vaccination campaign includes all tribal members. And so you do not need to be an elder or have a lot of, you know, other reasons to get the vaccine to be included in getting those on the 2nd and the 9th. So we're encouraging that if you're interested, get on the list, call us, and then we'll call and schedule you based on the prioritization that we have set. But we're honestly just trying to get as
Sounds like we may have.
I think we have lost you, Katie. So to be part of the vaccination process, just call the clinic and then they'll put you on the list. However, if you're less than 18 years, you don't need to call because we're not vaccinating people who are less than 18 years. And if you're pregnant, we may need to have some talk with you before you can be vaccinated. If you had COVID in the last 90 days, you may not need to call, but we can vaccinate you after 90 days. These are just the 3 exclusions that we have right now, but any other person can call and be put into the list. Katie, welcome back.
Yes, I apologize. The saga of being remote. That's right. Just call. Our vaccine coordinators can get you on the list if you are eligible. And we really encourage people to do that as well as their family members so that we can just see if they're also eligible to be vaccinated.
Great, thank you. Appreciate taking extra time. Member Palace?
Good morning, Dr. O'Larrabee and Dr. Martin. I just had a question because I know some of the feedback we've gotten from our community is that when tribal members are calling and they're told they're on a waiting list behind 100 or so people, that sounds alarming to them. So would you explain kind of how fast we are actually going through that many of people? So, I mean, I guess how long the wait actually is if you're so far behind on the waiting list, if that makes sense. Thank you.
It definitely does. There's nothing more alarming than being number 100 on a waiting list, but it is not a long wait. So we're vaccinating every day in our clinic, scheduling vaccination. So I think gosh, I don't have the exact number, but I bet we're vaccinating, 10 to 30 people a day in our clinic. And then we're also doing these mass vaccination events, which have capacity for, on one of them up to 1,000 people. And so scheduling.
You're hanging again. Okay, so Member Powers, let me just say that everybody who is in our list will be vaccinated either on the 2nd or on the 9th. The longest they will wait is the 9th of February. Everybody in the list will be vaccinated by the 9th.
Thank you.
And I have Dr. Hill here, who just had his vaccination a few days ago. Dr. Hill, you want to share your experience with the tribe, please, for 1 minute before we continue?
Sure. Yeah, I got my vaccination a week ago Tuesday. It was outstanding work. I mean, I walked into the clinic, registered, waited probably 5 minutes at the most. Went back and got my vaccination. It was pretty painless. I hardly knew it was getting done. I had Lena take a picture of me when I got the vaccination. I haven't gotten it back from Lena. She needs to email me that, but I want to share that just to show, that you know, as a physician and as health advisory committee chair, that I got the vaccine. And we found, I'm working with the Association of American Indian Physicians, and we're trying to get all of us to get our pictures taken. We want to get our vaccinations done to share, you know, with our communities and so on. But I had a little bit of arm soreness for one day, and the day after that, I was out cross country skiing with minimal discomfort. So I feel great for having gotten the vaccination. I'm looking forward to my next one.
Thanks, Doctor.
Thank you, sir.
Yes, Vice Chair?
Yeah, just a quick question regarding spouses of tribal members that are non-tribal. Is the process for them to set up an appointment the same as a tribal member? And I know there are quite a few tribal members with non-tribal spouses that really don't know. How are we getting that word?
So to my knowledge, they are being scheduled in the same way. So what has happened, we're having people call in and then, you know, verifying their connection with us and then putting them into the schedule, mostly for these mass vaccination campaigns, but also in our clinic. So I even saw patients yesterday where, like, they came in as a couple, we vaccinated one and then the other. And so I would tell people that if your partner is not a tribal member, still call and we'll put you both on the list.
Chairman, we have a question from a watcher that wants to know, after having COVID-19, should one get vaccinated still?
It depends on the timing. So if you had COVID-19 within the last 3 months, then we're not suggesting that you need to be vaccinated right now. If it has been longer than 3 months, then we still want you to come in and get vaccinated. We believe that you probably have some, you know, you should have immunity from the disease, even if you probably had it longer than 3 months ago. But for the sake of safety, we're still going to vaccinate people outside that window.
Okay, thank you.
Well, thank you, Doctor. I guess you can move us through. I'm not sure if we got all the way through the PowerPoint.
Thank you very much for that beautiful discussion. And I'm glad that we're able to clear the airways. We are asking all tribal members to please maximize the 2nd and the 9th of February to get vaccinated. It is safer to be vaccinated than not to be vaccinated. The vaccines are safe and they are very effective. I want to share briefly on our ideas for 2021, what we'll be looking at in 2021 as our major projects. One is our strategic plan, the one that we had expired by December last year. And so we're hoping to develop a new one on or before June this year. We'll work through the process and we'll get back to you to see if we have permission to engage a consultant who can help us work through this process. And if by March we have our AO in place, that will make also a lot easier for us. We're also planning to ensure that this 2425 fund distribution is sent out to those that need this fund before March this year. We have had several obstacles from FEMA and others while we're trying to get the list of those who were affected. We're hoping that we'll be able to finalize it before March this year. We are currently working on our 2021 budget in health, and with the CFO, we are hoping that we'll get this finalized and presented to the council by February this year. We are hoping that by June this year, at least 70% of tribal members who need vaccination would have been fully vaccinated by June this year. And that's why we're having this initial mass vaccination. If this goes well, which we believe it will go well, as Dr. Martin said, we may have other mass vaccinations as well to encourage more people to get vaccinated. The CADA building, we're hoping that we will finish everything about it by April this year. We had our public health modernization on 18th and 19th of this month. So actually the week of the 18th, we had our survey here and it went very well. So we're hoping for the report before the end of March. The SCALS project is still ongoing and we're having excellent feedback from the SCALS project. We're hoping that this will be finalized by March 2021. We also believe that this year, because of COVID last year, most of our staff did not have any trainings at all. And so we're hoping to have trainings for every staff this year, both virtual And if possible, before the end of the year, if travels are allowed, people can also have on-site trainings. So we've asked all our directors and supervisors to identify relevant trainings that will help them do their job effectively. And this will be documented in our budget for the year. We need an isolation and quarantine facility. And I want to thank the Tribal Council for the meeting that we had earlier this week, or last week actually, on this. And our team will be visiting Medford this week. And we hope that before June, we should be able to have solved this for the tribe once and for all. We couldn't do our patient satisfaction survey last year because of COVID, but this year has been programmed for February this year. We're hoping that by February, we'll be able to execute this survey and also be able to rate our different departments on their performance vis-a-vis clients' quality satisfaction, client services in 2020. We are making some few modifications to our organizational charts and following the approval of a policy for once a year modification on the chart. We are hoping that we'll present this to the Tribal Council in March this year when we have our budget finalized as well. There will be some few changes and that we'll share with the Tribal Council in March. Our CMO have already resumed work and have been part of this meeting this morning. So we are glad. Our target was actually February, but she came in quite earlier. So we're happy to have her in our midst this day. We're also working on our annual report. This is not in the one you received. This was just added last night. And we're hoping that we'll have our annual report ready to be presented to you on or before May 2021. These are our key 2021 projects. More will be added as the year evolves.
So I was going to ask council members, are there any questions or comments about any of the items listed?
On the 242 fire fund distribution, could you go over again what the difficulties are with that?
I got a mail from FEMA through Joseph Tibe and their team when they were asking for the list of those who were impacted by the fire, and that was difficult to get, one. Number two, we had a question that they hope that we are not double paying people. And we tried to understand what that meant. They said those who have received funding from FEMA should not receive from us. But we tried to explore that further. I think Lena is here. Lena can explain that further. We tried to explore that further. If, for instance, somebody lost their homes and FEMA gave them $20,000 or $30,000, can we still give them extra $10,000 because 2030 cannot repair their home that were lost? And so these are the issues that we're trying to sort out at this point in time, to be able to ensure that we do not have difficulties after we have been able to disperse the fund. Lena, please.
Yeah, Dr. O is correct. We can't get the list. So far, Zach and Joe Tibai have not been able to get the list of the exact homeowners that had their whole home destroyed. So we're trying to get that list so we can reach out to them to get them the funds. And then the contacts from FEMA had posed some questions to us about not giving them funds because they were giving them a max of $35,000 to replace their home. So we're trying to confirm with them that's not enough to replace a home, $35,000. So, and these were all donated funds by the community. And so therefore, I think that biggest difficult Joe and Zach have expressed is getting the actual names of the 8 or 9 homes that were lost so we can get majority of the funds distributed. The second, there was over 100 people on the FEMA list as well that had pieces of property or other things damaged. So getting a streamlined process to identify and verify who those people are. So that's the difficulty right now, Berta, is just getting the names that we can contact and get them the funds.
Okay. And then also with that, I know part of the approval was for to reimburse for the hotel stays. So has that been accomplished?
Yeah, we're working on that, making sure we have all the invoices to get both the casino and the travel center paid.
Okay.
Anything. Yeah.
See the
Chairman,
yes, number 9.
I just wanted to thank Lana and Dr. O for that clarification, because I do know that there was folks that were wondering why is it taking so long, but there's apparently a lot of red tape that FEMA has involved for the 242 funds on the GoFundMe. So that was great for listeners. And then also one of the listeners really wanted to give thanks to Klamath Tribal Health and Family Services for all their help. So hats off to you guys again. There's a lot of listeners that are out there that have expressed gratitude and thanks, as well as a lot of members that keep letting tribal council members know that they've been impacted, and the tribes has done a really good job. Specifically, they mentioned Klamath Tribal Health and Family Services, the computers. It's really nice to get that confirmation from our members. We do know that there's waiting lists for a lot of the things out there. The departments are going through the list, trying to distribute that stuff. So please be patient. And just wanted to thank everyone that's in the meeting today for all their help.
Great, thanks. Member Dumont?
Yeah, Dr. O, I wanted to follow up on a question that I asked you during your last report to just be sure that I understand. And I'm looking at table 17 on page 10 of your report, where it's talking about pharmacy quality metrics. And specifically, there's a footnote there, or an end note, that says % of days patients had prescribed meds on hand to take as directed. And then the numbers hover right around 77%. So when I asked you last time, does that mean that 23% of the time folks don't have their meds on hand? I think you answered by saying, well, if they were to get those prescriptions filled elsewhere and not at our pharmacy, that might be the source of those numbers. And also, I think maybe if, for example, if I don't call to have my prescription filled at the point that at least the computers think I should, that might contribute to that number. But anyway, I really wanted you to ease my mind so that I don't believe that, right, we've got huge numbers of people who don't have access to their.
Thank you, sir. We tried to answer that question, I and the director of pharmacy last month, and the answer is still the same. Globally, a 70-75% rating is very, very high, very, very high. And number two, as I told you, sir, some people collect their prescriptions from Rite Aid and other centers, and we do not have access to that information. And so our goal is to ensure that we stay beyond the 70% matrix, because with that, almost everybody has their medications, and we're sure that they're taking their medications. Thank you, sir. I wanted to share, where is this? There's a few changes and additions to the reports you have right now on the table segments. I just want to go down to the table segments. On the finances, thank you, Judge Lopez, for helping me find this out. I didn't catch it early enough. The total in page 15 was 600 and something thousand, but that was wrong. The true figure is 752,750.67. So I made that change, and I thought I should share it with all of us. And I will share this final version with you after this presentation. The 600 and something thousand was wrong. The true figure is 752,000.
So I thought I saw Vice Chair Hatcher. Did you raise your hand?
Yes, I did. I just wanted to, on the pharmacy numbers, if we have patients that are getting their medication elsewhere, such as Rite Aid, I believe, or last I knew, we had a contract with Rite Aid for patients to get medication when necessary. So wouldn't we be able to get some numbers from them as to how many of our tribal members are going there?
I asked Commander Timothy about that. He said that we do not have that access to that information. Nikowa, you're online. What does HIPAA say?
There, it depends. HIPAA, if it's within, like business organizational, we should be able to get some of that data. So I think we might just have to request the information, more specifically of what we're actually getting. I just backtrack a little bit on, member Dumont's question. Medication adherence nationally is around 80%. So our number of people adhering to medication is around the national average. And it also depends on how many times a day a patient's taken their prescription. If they're taking it 1 time a day, their adherence is going to be a lot higher, closer to 80-90%. If you're taking a medication 4 times a day, it can go down even to 30 to 50%, depending on how you rate the medication adherence. So I just wanted to make sure I put that data out there too. We can get more information from Commander Langford on that, but I think we just might clarify with Tim what kind of information council wants, and we can definitely, at a minimum, request that information, all compliant with HIPAA. HIPAA shouldn't be a concern because it's a business transaction. We're coordinating care and we're trying to find out how we can ultimately increase our patients' medication adherence. So I think it would be good data for us to try to obtain.
Vice Chair?
Yeah, I was just going to say the same thing that Nakoa just said. In addition to that, also, I would think that PRC would have some type of indication because we do pay for those medications. So we should be able to access some of that information.
And I
Yeah,
see
I
Tim,
was- I
Tim's on the
received a
phone.
text saying that someone had questions about pharmacy. Does anyone can answer a question?
Oh, Tim, I didn't know you were here. Please, is the question on table 17 again, the medication position ratio? How can we have access to information with maybe Rite Aid and other pharmacies that our tribal members receive medication from, so we can have the true figure for reporting on a monthly basis?
I think this question came up last month and I emailed about it. The only way we can get that information from other pharmacies is by having a release of information signed by basically any person using other pharmacies. And those releases expire every year. And you actually would have to know who's filling medications at other pharmacies. And we have no way of knowing who's filling other medicines at other pharmacies. There's no universal health information where I can know who's filling what at other pharmacies. So.
Tim, this is Koa.
Yes.
You're correct on the release of information for maybe outside pharmacies that we don't have operations with, but we have specific operations with Rite Aid. So
Correct.
under HIPAA, we would be covered. So we could obtain that data from Rite Aid because it is within our healthcare operations.
Correct.
Okay, I just wanted to clarify that for
Yeah,
council.
correct. We do have a business agreement with Rite Aid.
Correct.
But these are chronic meds. So we're reporting on those because they're quality metrics and part of our QA, and chronic medications for hypertension, cholesterol, and diabetes are a big way to prevent, like a heart attack and that type of thing. And so we monitor those in hopes of trying to figure out, identify people that maybe are not good at requesting their refills on a regular basis. But we can't force people to actually request their refills and take them every single day. And so when we identify people that don't, we try to re-educate them. We try to sign them up for a medication synchronization refill program. We try to address whatever needs, but still there are people that just don't take meds as consistently. We even do compliance bubble packing. We do med boxes. There's a lot of interventions we do to try to help people take these regular medications. But again, realistically, in clinical studies with these medicines, the quality metrics say 80% and above is considered like doing well in clinical studies. In the outpatient setting, we're close, but we're not as good as we'd like to be. So we just keep on trying to make interventions with individual people to try to help them take their regular medications to prevent those heart attacks and strokes.
So with this that you're reporting, it's not necessarily pharmacy not being able to provide those medications. It may be patient compliance So,
This is really a patient compliance. We don't like to use the word compliance because it has a negative connotation. I like to use the word adherence because it doesn't have that bad of a connotation yet.
well, as somebody
but
with
really,
somebody in my household that is a non-compliant patient, I know what you're trying to tell us.
and so, I mean, we do a lot of interventions to try to help people call in and get the refills and to take their medications regularly. We give them med boxes. We put them on a call list if they're willing to accept a call each month to kind of check to see what they're doing. We try to re-educate about why it's important to take the medications, but you can't force people to take medications. It's their life choice, and we need to respect that and honor that, and use what tools we do have to help: education, reminders, things like that. But we can't force people.
I have a question and a comment. My question was, if you go to Rite Aid to get your prescription filled, how many days of medication do you get? And that's also was a comment from one of our listeners. Was their understanding was they only give you 3 days worth of medication, so that kind of skews some things there as well. Is that
Yes,
correct?
so the goal of Rite Aid is to provide pharmacy services when our pharmacy is not open. So our agreement with them is that they will fill 3 days or whatever's required until our pharmacy is open. So if it's a 4-day weekend, like a Christmas weekend or something like that, they would, and it's, you know, the night before, they would even do 5 days because they want to make sure the person gets enough medications to get them to when the tribal health pharmacy is open. That being said, if there's an acute care, they have permission to fill like a 5-day antibiotic course, the whole antibiotic course, because it's a real pain for our tribal members to get 3 days and then have to come up to the pharmacy for 2 days. But the goal of that is to provide, bridge the gap for when our pharmacies close. It's not to provide chronic pharmacy services, long-term pharmacy services.
Thank you.
Thank you.
Okay, I appreciate that. Is there additional information we want to go through, Doctor?
I think that would be the end of my presentation. Just the few additions I added to the report I submitted to you, sir. I added the annual reports to the table, and that's all. So I will be sharing this final version with Secretary after this meeting. Thank you for your time, sir.
Great, thank you. So for compliance matter, we need to pass a motion to receive the report. Is that the correct phrase or wording, Secretary? Okay.
Chairman, there's another question.
Yes.
The question is, if we have insurance, can we get our meds filled somewhere other than the Klamath Tribe or than the tribe's pharmacy? Excuse me.
This is Tim, if I can answer it. It's a decision between the patient and their provider where to fill medications. Often, if a person has their own insurance, they can take it to any pharmacy and get them filled as long as their provider's happy with them going to that pharmacy and coordinating it that way. The risk is that often insurances don't cover certain medications. And so there's a cost risk to those people that go to other pharmacies. Where at our pharmacy, if the insurance doesn't cover it, then the tribe covers the cost.
Thanks. So if there's nothing more, I'd entertain a motion to approve receipt of the HDM or Klamath Tribal Health and Family Services report. Somebody like to make that motion? I don't see any hands. Okay, Secretary makes that motion. Is there a second?
I'll second, Chairman.
Okay, Member Lang, okay. Secretary, if you could please conduct a vote.
Gail Hatcher,
E,
Clay Dumont,
E.
Willa Palace, Willa Palace. Okay, I will skip Willa and come back. Ellsworth Lang,
Yes.
Jeannie McNair,
Yes.
Rose Treetop,
Yes.
I vote yes.
Secretary, I vote yes. I'm sorry, I can't get myself off mute.
Okay. Thank you. So with your abstention, Chairman, it'll be 7-0-1.
Okay, great. The motion carries. Thank you, Doctor and Tim and everyone for coming on.
Thank you, Chairman, sir. I just got a mail from the States right now. We are receiving 500 doses by the 31st of this month, and another 500 doses by the 7th of February. So we have enough vaccine for our mass outreach.
That's
Thank you.
awesome.
Dr. Martin and Nicoa and Lana, thank you folks for joining us today. And Rebecca, I see you're on there too. Jerry's there too. So thanks folks for joining. Okay, I guess it's up to, oh yeah, next up, so I was dismissing Lana. So we need to hear from you, Lana. Thank you for providing that financial report for us.
You're welcome. Can I share my screen? Can you see the 2020 third quarter?
Yes.
Okay, so I just put this up there. I won't take a whole bunch of time. I know Dr. Hill has a report to give next with Dr. O. This is just one section of the report I usually give. And it's quite late anyway, so I won't take up a lot of your time. Next month in February, when we present all of the budgets for tribal health, I will give you an annual financial operating plan for the year like I do each year. And it will give you the 2020 unaudited financial results, which will encompass all revenue and expenditures and kind of an estimate on all of our funds and the balances in those for the end of the year, as well as a projected forecasted budget for each department, along with our grants and other items. So I just kind of wanted to show this. This is what I gave Dr. O. I told him preliminary based on just the revenues. I took a quick glance. We're still catching up and reconciling a lot of the year-end stuff. But third-party revenues was about 3 million more in 2020 than it was in 2019. So that's a very positive indicator for our financial health in 2020. As you guys know, we also received a lot of extra funds from, the CARES Act and various IHS AFA amendments to our contract for extra revenue as well. So in order to kind of get a full picture, I think financially, we were not, although we were impacted operationally significant, we were not impacted financially because of all the extra help we got. And because we were so focused on COVID and we had to basically close down most of the year after March to essential services only, you can see the impact on the overall budget. A lot of projects weren't done. So overall, like I said, I won't take up a lot of your time reading down, but you can skim down through each department and see that the actual expenditures total 10,457,408 compared to our budgeted expenditures that were 14,863,067. So we were under budget by 4,405,659, or about 30% overall. So I just, next month, it'll be a more comprehensive. Like I said, this is pretty outdated information. I was gone most of December, part of January. So I do plan to have all the budgets to present to you guys next month at the end of February. and with a comprehensive annual financial plan for you guys to approve.
Thank you, Lana.
Chairman, you're muted.
Yeah, I was printing something and I muted, I forgot. So Dr. Hill, thanks for joining us today. Thank you to Lana for your report. And I guess it's a combination of Dr. Hill and Dr. Larrabee to lead us through this other item. So whoever wants to begin, appreciate it. Thank you.
Dr. Hill, sir.
Okay, thank you, Dr. Larrabee. This is a project that was the culmination of efforts throughout the Health Advisory Committee, and I want to talk a little bit about the genesis and how we got the name and so on. So first of all, Dr. Larrabee came to us with an idea of what was titled the Health Ambassadors Initiative. And it's something that he's used successfully in other communities, which would employ community members to various efforts to improve the health of the overall community, primarily health education and so on. So after our discussion, Councilwoman Hakakta sat in on the first meeting on this, was to really change it and make it a community-wide program. So we want to go from individual health improvement, which we're doing through the clinic, to community-wide health improvement. And those of you who know me, this is something that's been very important to me throughout my career. So we took the Health Ambassadors Initiative proposal that Dr. Larrabee had written up, and collectively we worked on it. So Melva Fry worked very hard also to help edit it along with me, and also Darlene Melendres and Bonapool and Sandy Mosler also contributed in discussion of this, and this is kind of the fruition of it. And a couple of staff members then took our ideas and put them all together into this proposal. So hopefully you've had a chance to take a look at it. I want to comment just briefly on the title, but I'll talk about a little bit about that later. The Homoski project, the wording came from Dr. Joseph Dupree, who you're going to hear from later, regarding language, and also Taylor Tupper. And it's a traditional Klamath phrase, and I'll come to that a little bit later, but it expresses the idea that we want this to be inspirational. We want this to be a community-wide effort that will include health, not just of individuals. You know, everybody knows smoking is bad for you, eating well is good for you. Everybody knows these things, drinking is bad for you, and so on. But what we really want to do is have community-wide efforts that will make this part of the entire community's effort to become healthy, not just as individuals, but as an overall community. And I'll talk a little bit about that. So I'm going to read some of this, and I won't read the whole proposal, but I think people who haven't had a chance to read it or when I rehear some of the words, it'll help kind of give an idea about what it is we're trying to do. So I'm just going to go through it. So I'm going to start on the second paragraph of this introduction. And this is, I think, where my thoughts have been for many, many years, and where I think that we need to understand why we need to understand how we got into the predicament we have in having poor health in Native communities before we can solve it. And so the understanding is important. So with regard to our tribe, we say prior to the colonization, the peoples of the Klamath tribes lived healthy, self-sustaining lives that include time-tested social, cultural, and spiritual beliefs and life ways. However, the beginning of colonization just prior to the Treaty of 1864 and the reservation era marked the beginning of irreversible damage to our culture in ways that had sustained us from time immemorial. Epidemics of 1920, tuberculosis, and other diseases had greater detrimental impact on tribal communities as the immune systems of our ancestors were introduced to these diseases for the first time. Later, the outlawing of indigenous practices and the theft of tribal homelands by the Termination Act of 1954 stripped our tribes of our healthy, self-sustaining sources, and a rapid decline in health followed. Until the Termination Act of 1954, the United States government granted the Klamath tribes minimal health care to allow the Klamath, Modoc, and Yahuskan people to access healthcare services. This access was completely lost at the time of termination. After more than 30 years of cultural preservation, avocation, and struggle, the restoration to recognize tribal status in 1986 re-obligated the US government to provide services to our health. The tribes have since taken local control of our services through Public Law 93-638, which has given us the capability and the responsibility of providing health services to our people, a responsibility that we carry and uphold. So that provides us some context about how we got in our situation and what we can do about it. So to go on a little further, the traumatic collective experiences, war, disease, colonization, reservation area, and termination have led to detrimental health. Many unhealthy practices, behaviors, and lifestyles, such as alcohol, commercial tobacco, and violence, were forced upon our people. Unfortunately, as our tribes have been subjected to these practices while simultaneously restricted from healthy ancestral knowledge and practices for so long and so intensely, many of the new unhealthy practices have seeped deeply into our community. The people of the Klamath tribes have the potential and the ability to be in good health again, but several factors are working against us to enjoy the best of health. Now, those of you who were around back in '86 and afterwards, after restoration, know that I was also involved in the development of our health program back then as a volunteer and a consultant. And some of you may remember that we had a phrase that we also got from the elders here, which was Mobandish Hoshlan Tombluk. And it meant to be in good health again. And we had that on our stationery, and it formed a basis for the way we wanted to go, because my belief, and having worked in Indian health for 30 years, is that we have traditionally been a healthy people. For millennia, we were healthy people. And so we're not trying to do anything new here. We're trying to return to good health, to return to our natural way of being. And that really is the basis of this project. To put it in kind of more colloquial terms, and this is what we talked about in health advisory, is that, as you know, I was an ER doc for 30 years and worked in emergency departments for 30 years and took care of a lot of patients. So what we've done so far, kind of in a large sense to me, is through the clinic and through everything that we're doing in health and everything that council does to support health, is akin to stopping the bleeding on a trauma patient. Somebody comes in, a car accident, a gunshot wound, you know, we in the ER, we stop the bleeding. We stop the bleeding, we stabilize the patient, and then we send them upstairs for definitive treatment, you know, repair the lacerated liver, repair the gunshot wound. Somebody comes in with a heart attack and cardiac arrest, we take care of that. We revive them, we get them stable, and we send them upstairs to get taken care of further. So to me, if we look at it from a large kind of community standpoint, you know, we're basically stopping the bleeding, and I think we're doing a good job of it. You heard the presentation about everything we're doing in health, and we've stopped the bleeding, but we really need definitive care, and we need to go further than that. For example, if you think about the gunshot wound, you know, we take care of them in the ER, we get them upstairs, they do the surgery, but really has to happen to prevent that is gun control in the community, you know, less crime in the community, things that are going to prevent that from happening. And this is the way that we kind of envision the Hōmāski project to go, is to look at the larger picture and to kind of get above the day-to-day activities of trying to fix somebody's cholesterol, fix somebody's diabetes, fix somebody's alcohol problems, fix somebody's depression. And we want to get to a healthy community. And we believe that's possible because we did it for thousands of years. And so I want us to do it again. And that's kind of how we kind of took this project and morphed it with the Health Advisory Committee. So I don't want to go through the statistics. We all know them. A lot of diabetes, a lot of heart problems, a lot of early deaths, addiction, alcohol, and so on. We don't need to talk about it because we're here to solve those problems, not dwell on them. But I do want to go into a little more history again to give some context to this. So the high morbidity and mortality rates documented for Native Americans are fairly new to us. And by new, I mean 100 years after a millennia of being healthy, and correlate to changes created by colonization. As morbidity and mortality rates have increased, our family and community structures have been drastically altered. Diet changes, work, and activity have decreased. These changes are cemented in historic trauma that ravaged identity and may have created a generational breakdown of genetic expression. For instance, our diets are no longer consist of our traditional foods, but instead an unhealthy diet that was introduced to us. As part of this unhealthy diet, colonization also introduced Native American communities to non-traditional use of tobacco, alcohol, and other drugs that were used to manipulate and harm our communities. The introduction of these substances has taken an especially harmful toll on our people. Native Americans have some of the highest rates of alcoholism in the United States, as our people were only introduced recently to this substance compared to European colonizers. And traumatic experiences are a significant factor for alcoholism. We see, regardless of race or ethnicity, that substances are misused many times over, however wrongly, to cope with trauma, and that those experience alcoholism are very likely to have had traumatic experiences. So it's disheartening to us as health professionals, we are not surprised to see that along with high rates of collective and individual trauma, we also see high rates of substance misuse, poor diet, low physical activity, and substance misuse are lifestyle changes that properly guided can be corrected and help avert the unacceptable excess morbidity and mortality among our people. To build a healthy society, these scourges must be addressed, including the need to enforce and expand our tobacco policy and build a smoke-free campus, with the exception of traditional tobacco and other activities. So that's the background I want to give. So overall, this next picture, the graphics was difficult to get right, but basically the idea is healthy pre-colonization, unhealthy post-colonization, and right now we want to go towards rebuilding the health for our individuals and our communities overall. So a lot has been done. Like I said, we have a clinic, and I think they do an outstanding job, and they're doing a better job every day. We have a fitness center at the Tribal Health and Family Services, Tribal Council, and Tribal Administration is working to develop and equip the fitness center. There's gyms. There's also strong movement within the tribe itself to return to traditional practices, hiking, quest, mindfulness and ceremony, traditional food gathering and preparation, cultural lessons on water, use of and teaching of traditional language. What we think this really demonstrates very strongly is that there is a strong desire to have a healthy communities. This is why we do these things. We do these so we can develop healthy communities overall and avoid us from getting into the mess that we're in. So the Homoski Project will build on these programs and activities and the culture really to help ensure that Klamath tribes build healthier communities through changes in the ways we live and how we think about health. The Homoski and Klamath tribes will encourage participation at the agency level by creating buy-in from the top down, that's all you folks, and from the bottom up, which is all of our community. The Klamath Tribes Administration and Tribal Health and Family Services will work to amend policies which might prevent participation and empower employees who have participated in health programs and activities to do so once again. The Homoski will seek to involve the tribal leaders and members throughout the area, tap into existing resources such as Tribal Council, Health Advisory Committee, CHRs, Benefits Committees, Education Committee, Planning Department, Youth Initiative, Youth Council, and all of our clinical programs. And what I want to say about that is, from my perspective, all of these are health activities. The Youth Council is a health activity. You know, purchasing the land up on Upper Williamson was a health activity. That's how I view things, because it strengthens our community and makes us all stronger. So the project is to augment our current programs and activities to ensure that Klamath tribes build healthy communities through long-term sustainable life changes. We don't see this as a project that we're going to do for a year or 2 years. We want this to become part of what we do all the time for health, and it's hopefully put things together. So we want to look at our policies and see what we can do to improve participation in our activities. To do this in Klamath Falls and Chiloquin, so that we include all of our communities as best we can. And as I said, look at the resources we have within even the benefits committee, health and education, planning, everything to me, everything we do, and including everything council does, is to improve the health of our people and improve our community overall, not just individuals, not just stop the bleeding, but make a difference in how we go long-term for health. So I want to get to the Homoski. When we had kind of settled on kind of how we wanted to do this and the approach we wanted to take within health advisory, I was looking for a phrase like Mobandish Hoshlan Tamluk that what we had used back in the 80s and 90s, in fact. And so I was actually talking to the gentleman you're going to hear from early, young Dr. Joseph Dupree, and he brought up the Homoski, and it's been used before, and maybe some of you remember it, but it's been used before in our community. And I just have here that literally it means that way be, but really more colloquial, it's be that way, and it's meant to be encouraging, And I talked to Taylor Tupper. Taylor had been involved before in using this phrase, and I asked her where it came from, and she said it came from her elders and it came from her dad, and they used to say that when somebody did something good. Somebody does something good, you help somebody across the street, or you pick up their groceries and you say Homoski. That means, be that way. That's a good way to be. And so we thought that this would be a good title for this project, because that's what we want people to do. We want them to make good choices. If somebody has a apple instead of a donut, you want to say Homoski. If somebody helps somebody else, you want to say Homoski. So we thought that would be good, because it's not just teaching that we want to do. It's not just education. Like I said, everybody knows these things. We want this to be inspirational. And that's why we chose this name. And I really want to credit both Joe Dupree and Taylor for bringing that to us. And I saw Roberta shaking her head. So shaking her head, yes. So you've heard this before too. So that's really why we chose it. And we think it's a good title. And we think it would help get people on board. So we have a lot of objectives. This is still to be developed. And we're looking forward to hoping to develop it. So we have some objectives which you can read through. I don't need to go through all of them. But enroll tribal members in the Homoski Project leadership. So we want tribal people to be leading this. We don't want this just to be coming from the health program. We want this to be a community-wide effort to improve health of our entire communities, because it can't be done just by health. It can't be done just through the KTHFS. It really needs to be a community-wide effort. So as you go through these are just some of the things that we talked about, some of the things that we can do. But I think number 3 is really important. Health is really body, mind, and spirit. And we want this inclusive definition of health to empower the Homoski Project participants to think more broadly about health. As a physician, I take care of people with diseases or problems, but we all know, and especially as Native people, we know that health is not the absence of disease. Health is living in a good way, the way we were intended to live. So that little graphic down below, this is something I've been drawing on the board for 25 years at least, when I give talks on Indian health, and we revise it a little bit for this, but basically it's the same concept. We have lived healthy, and that was our original way of being, was to live healthy. Something happened that caused us to be unhealthy, and not just colonization, but the results of colonization. Poor nutrition and inactivity, trauma and mental health issues, westernization of our practices. These are things that took us from a healthy people to really, I'm sorry to say it, unhealthy people. You just look at the numbers. You look at how much disease and trauma we have in our community. And so again, for me, to understand the way to get back to good health is to understand what led us to poor health, and then look at ways in modern life that we can correct some of these problems in community health education, promotion, mobilization, community orientation, but also a mental reprogramming. We want the Klamath, Modoc, and Houston people to understand that we have a right to good health. We were created to be in good health. And so that to me is a very important part of this. So initiatives, there's lots of initiatives we could potentially do. And these are just some thoughts, some ideas. Park and walk, eat fruits and vegetables. But again, nobody needs to be told that eating fruits and vegetables are good for you. People need to be motivated to change their own behavior. and do things that way. And so again, we think this Homoski project has the potential to do that. So provide education, people's homes, places of work, recreational facilities, and you can see the kinds of things that we can do with this. So we don't know how we're going to go about this exactly, but I would like to see us have community-wide campaigns, you know, not just a brochure at the clinic that says you should stop smoking and here's the 7 reasons why. Here's what a healthy diet is. But community-wide campaigns, if we're going to do a stop smoking campaign, let's do a whole stop smoking campaign. Let's not just have a tobacco cessation program within the clinic. We can do this and make it part of our community culture. That's what I would see us hopefully being able to do. So print media, posters, presentations, electronic media, community events, cultural revival events, all kind of pointing towards improving the health of our overall community. So Dr. Larrabee, you know, with his Health Ambassadors Initiative kind of came up with this structure about how we'd like to start going about it. And so it would be a committee of people, maybe a committee of committees. But as you can see, we have a list here where we would want to have a project leader. This could be an employee. We could hire them potentially. We could have them be a consultant, but it would hopefully be somebody from this community that really has a strong belief and understanding about how we want to become healthy again, and a cultural understanding and a really deep understanding of the community. But we also want other people, because again, I believe that everything we do is about health. That's just how that's how I see things, and that's how I understand health to be. Again, not an absence of disease. So patients' benefits, elders committee representative, youth council representative, health education representative, tribal council liaison, and other people who may be able to contribute to this committee, because we would want this committee to decide on what our priorities are going to be, how we're going to go about it. If we want to have a community-wide campaign, and we would need then to be able to rely on various people within our administrative structure or within our health structure to be able to help execute that. And of course, rely heavily on behavioral health people to help execute these projects. So that's the idea, and it's very ambitious. And I think it's very important. I think it's very doable. But I can see this as being something, like I said, not a project to do for a year or two, but something that becomes part of the fabric of our health environment here. We can develop all sorts of output indicators. Anybody who's written grants or read grants knows you have to have output indicators, and we would definitely want to track that and see if what we were doing is working or helping or not. So we don't know how this is going to come out, but I think it's an exciting project, to me at least, that we could potentially do. We just took a number, $150,000 to get started, to be able to pay for meetings, to be able to pay for print media, posters. I mean, I can see billboards going up as you come in and out of Klamath Falls about the Homoski project, or, you know, healthy eating, or whatever kind of campaign we decide on, and possibly paying somebody to take on the leadership of this thing, someone from our community to take on the leadership of it, not me particularly, but somebody from our community. I don't want to take on this as well, but I think somebody from our community, and I would certainly participate in this, but I don't want to lead it up. So hopefully, you know, with demonstrated success, we would then be able to get grants, donations, private endowments, you know, other folks to help pay for this. But I think it's kind of an interesting project. It's something that I've seen for a long time. That's why we came up with Mobandish Hoshlantabla, you know, many years ago, was to get us to be back in good health, and not just absence of disease, and not just diabetes under control, not just hypertension under control, but, you know, making a difference in people's lives and health. So I just want to read the conclusion, and then I'm certainly, you know, open for questions or discussion. So the conclusion is, overall, the devastating traumatic experiences of colonization, reservation area, and termination has contributed to the dire health conditions of our tribal community now faces. However, with consistent and passionate coordination, teamwork, and alignment to cultural and spiritual practices, which I think would be a critical part of this project. The Homoski Project will stimulate the emergence of greater community health consciousness among the tribal community and lead to a healthier Klamath Nation, which is our ultimate goal, I think, for all of us. So that's the project. And this was a culmination of a lot of discussion within Health Advisory, half a dozen rewrites, at least, to kind of come up with this. So with that, I'll just kind of leave it to Dr. Larrabee if you want to have any other kind of thoughts or comments on this.
Just want to thank you, Dr. Hill, for an amazing presentation. I think you covered every aspect of the presentation. Thank you, sir.
Makes me want to just clap my hands. You know, just it's a vision, I think, of many of our people for that holistic health that you're talking about. I'm sorry about getting emotional, but it just feels so good to have a focus on this. And yeah, it just, to me, it really resonates with me, you know, and I know some of the other council members and others in our community about the wholeness, the holistic health needs, you know. Well, we know it encompasses all those things that you talked about. And so I'm excited about it. You know, this should not only shape our vision and feelings and what we do for the future, but I see it pulls all of our entities together to be focused on holistic health. So I'm really excited about it. I did think of some things through the way that I thought might be, you know, might want to be considered, you know, because I think over the list of the negative things that have happened, we have a loss of opportunity to hunt like we used to fish like we used to gather like we used to. And it's just becoming more increasingly difficult. And I've had experiences. I'm just so thankful that my father taught me to hunt, and we've been trying to get out there and hunt all these years, even as difficult as it's been. But I know some of our young people just kind of gave up on it, you know, hunting in the way that we used to, make drives and so forth, because the animals aren't there like they once were. And so to follow through with that, you know, just that loss of opportunity to exercise our subsistence activities, which is physical, spiritual, mental, helps us obtain those traditional foods, that loss of opportunity. So that leads to me that there's an importance to have somebody that helps assist in managing the natural resources that we have access to. Because we could be more progressive with the Forest Service and actually promoting restoration of wild plum patches that we gathered at, as an example, or other traditional foods and medicines. And so that's something that we've talked about, but I think that is part of this too, you know, working with that, and obviously recovering our lands back, like you mentioned, the Rocky Ford area. I think that's the thought and thinking that a lot of our folks, well, that's why we want to have those things, because of everything that, you know, basically is summarized here. And I appreciate that. So those are my thoughts, and I didn't need to get emotional, but, you know, I think that's been, we attempted through our strategic action plans to try to look at things holistically, but I just like the way that this has been considered and captured. And, you know, I would just say, I really support it myself. And all along the way too, I do know, and I know there's a translation of Homoski, but I always remember our elder that passed years ago, Clarice Lotches, that, you know, she just said, I can't remember if it was in a language class, but she just said, Homoski, just do it. Just do it. I mean, that's kind of, it was a real proactive kind of way. And we can interpret things in context, but that's basically what she said. Just do it. It's a good thing. Just do it. And that's what I think about this. It's a good thing. Just do it. So appreciate that, Doctor, and all the work that's gone into this. Yeah, Member Lang.
Yeah, Chairman. I appreciate you know, the way that you looked at this, and you know, getting emotional. These are things that I get emotional about as well. And, you know, and listening to the presentation from Dr. Hill, I want to thank you and the group that put this together. You know, what we're talking about here is culture, and a broken culture, and we've lost our way. listening to my grandparents and my dad and uncle, and the things that they taught me were a lot of the same things that Don is talking about. And the things, even, tobacco and some of the things that we used to use for spiritual reasons and cultural reasons are now not the reasons we use them anymore. And, we used to eat, and we would eat well at times, and sometimes we didn't. And we would have, and when I say we, I know my family, back listening to stories in the 1800s, early 1900s, they had large feasts. But with those feasts, it also involved a lot of tribal work and gathering. And that has to do with the health portion of it, and not thinking about it being healthy, but you had to work hard to harvest those animals and process them. And it's how we got our supplies to live through the winter. And a lot of us still do this. And our culture is so broken, it's become where we are today. And getting back to the desired culture, there's a lot of barriers that are out there that Don even talked about, of not being able to just walk outside and harvest the animals or the fruits and the berries, because those patches are gone. And like Don said, the wild plums and the roots are just not there, or they are there, but you have to travel a long ways to get them. And that's a barrier for a lot of our tribal people, because they don't have the transportation. And we talk about transportation, and we do have gatherings where the tribes programs will take elders and tribal members out to practice what we used to do every single day. And I'm in large support of this, and I think one of the things is it's going to be through repetition and positive reinforcement. And that's, culture doesn't change overnight. I mean, it's taken us 100 years, or actually probably a couple hundred years, to get where we are today, to have in my opinion, and I'm not putting anyone down, beating up on ourselves, of the broken culture that's not desired. We are not living in our desired culture. We're living in we have folks we have folks that are listening that are non-tribal, but my grandpa would say these are not our ways, these are the white ways. And that's where we are. We were forced into this, and how do we get out of it? We have to first of all recognize that this isn't the desired culture. This isn't the way we used to live. This isn't how we used to treat each other. When elders would get up and speak, everyone would shut up and listen, because that's where all the wisdom came from. And that's how our younger generation would grow up to also be wise, and honoring your elders and dishonoring your family, and doing things that weren't the ways that the tribes actually had. So I'm gonna listen to the other tribal council members, but just say that I do think that this is moving in the right direction. And it's time to put up or shut up for me and change my ways. And I'm really excited to hear the fitness center. I used to hit the gym a lot, and didn't do a lot of cardio, but lifted a lot of weights, and I felt healthier, and I'm much heavier now. But I was also eating different at that time too, because I had health on my mind. And I think, a lot of our elders, unfortunately, they get into a situation, and I think of my family specifically, of not being able to exercise because they've let themselves get into bad health. And they actually, it was a catch-22. They needed to eat better and exercise more to be healthy, but they couldn't exercise because they were broken. Their bodies were broken from years of abuse and lack of a better health. So thank you guys very much, and thank you for listening to me.
Vice Chair, I saw your hand up.
Yeah, I just wanted to say, I think this is a really good idea too. It's been a long time coming for something like this to happen. I did have a question though as to, has administration been a part of your discussions so far, or is that something that is yet to happen?
Dr. Larrabee?
Thank you, sir. This was just a concept that we developed and then passed on to the HAC. And we thought that maybe after today's presentation, if approved, then we can start the mobilization. We're yet to reach out to tribal council, tribal admin.
Okay, I was just asking that because I want to make sure that, like I said, the whole concept, the whole idea is fine, but I want to be sure that admin knows that there's a piece for them and that they're able to do this, whether it is one of their programs or staff or whatever. So I hate to pass something and then put them in a spot where they can't for whatever reason. So that's my main reason for asking that question.
Great, thank you.
Thank you. And thanks for that. I mean, this really was a kind of a concept type of thing, you know, and my idea, we'll make this work however we can make it work, you know, and I understand that everybody, I mean, when we just kind of put this list together, sure, we're going to have, you know, patient benefits on there. Well, we didn't talk to them. We didn't ask them, you know, but we thought that that would be good. You know, I'm sure youth council will be on board and so on, but, you know, I understand that, you know, and like Don said, I think natural resources, you know, it would be a great addition to this. So I think it could be developed. You know, the only way we can do it is start, but we wanted to kind of first present the concept, and we did put people's names in or titles in here, you know, without asking them. But it's our concept, it's our idea about how we want this to go, if we can, but we'll make it work however we can.
Thanks, Dr. Secretary Frost.
Yeah, I was on board when Dr. Larrabee first brought this forward, his concept with the health ambassadors, and I'm really happy to see the way that HAC has made it a cultural project, you know, added a tribal, I won't say a tribal twist, but looking at it through tribal eyes. I think that's wonderful. I did share the same concern as the vice chair about, you know, stating that somebody's going to be able to do something without first asking, you know, whether they have the capacity. And I think that's important, but I don't think that they would balk at doing anything. I think they'll be fully on board as long as they're asked. I do have, and I don't know whether I voiced this before, whether it was in the health ambassadors and then that layout, but I do think that people react better to incentive than saying you can't do something, or I see a couple of things in here that particularly the youth, the smoke-free campus and the youth council event food policy, that is more of a you can't, instead of giving them a healthy alternative that will make them choose to do what's healthier for them, instead of trying to enforce a rule that they may, you know, rebel against. That's the way I work. I don't know whether anybody else does, but I know that's the way I work. And then there was one portion in here where it talked about where I thought this was targeted towards staff, because it talks about amending policies, but I think it's really a tribal wide, you know, type of project that you want, not necessarily a staff project, but more of you were doing this as a tribe. So I would want to, although encourage staff, because they will be, you know, a huge part of this. We want a healthy staff as well, to target it more towards the tribe and have the staff participate as well. So those are my comments, but good job.
Yeah, thank you, Roberta. And I agree completely. That's one reason we chose the name is because we want it to be encouraging. You know, like I said, taking the apple instead of the donut, Homaski, you know that. So I agree. We want things to be inspirational. I know that we don't change people's behavior by telling them what they should do. It doesn't work. you know, so they may not smoke at work because it's a smoke-free campus, but they might go home and smoke, you know, or they'll drive off campus and smoke. So a policy like that, it only goes so far. You know, it's encouraging and it's a positive thing to do, and it kind of shows the values of the community. But you're right, you know, policies and that kind of thing don't work. That's why I do want to make this encouraging. I want to make it positive. Because in the end, people change their behavior because they want to change their behavior, not because somebody tells them to change their behavior. And that's, to me, at least would be the spirit of this. You know, a lot of this kind of got, you know, again, you've written proposals, I'm sure. You put all these things in there and you take some things out and you put some more stuff in there, and it kind of ends up to be, you know, something. But in the end, your philosophy, I'm 100% in agreement with. It needs to be positive, and it needs to help people make decisions that are good for them and good for their community, and not be told what to do. Totally agree.
I'm not sure if you called on me, Chairman, but
Yes.
I'll jump in. I just wanted to say, I agree with Berta on what she said, but I'd also like to add that I feel that it's important that we do have healthy staff as well, and that they're able to do what they can as part of this initiative. I just want to be sure, though, that we have a good, healthy balance in that we don't forget what our duties and responsibilities are to our patients and clients and membership too. I don't want things to go so awry that we're concerned about myself at this moment, and I need to go exercise, and I'll take care of my patients, memberships, and clients later. So I'd like to see a good balance in that.
Thank you, Chairwoman. This will not affect our services to our clients in no way. That's why we are looking for a project director who will be a committee-based individual who will run this process. The climate tribal health practices and programs will continue unabated. And we have a lot of belief and respect to our clients. And currently we have these 30 minutes every day that people can free to walk around and then stay healthy or use the gym. That will continue. But beyond that, this will be purely a community-based service provision. It will not be, I'm not sure that the HAC will even allow us to be the one that will champion this process. We only support from the side, but we're going to have a team that will manage the process. Thank you for that great question and comment.
Willa?
Okay. Hi, Dr. Hill. I really like the concept. I'm excited to see something. I think it's way past due for us to really define, what we think a healthy tribe looks like. I know the pandemic has really brought out, a lot of the things our people are dealing with, and the things that we can see automatically are isolation and not feeling included. A lot of people talk about how they don't feel like they're a part of our tribe. And I think that's something that we need to work on. Even us, as tribal council, sometimes we feel like we're, not, fitting in or whatever, or, coming back. As someone who's moved back to the community after living away for a couple of years, it's, it does feel, like it's hard to fit in. So I can't imagine tribal members, especially new tribal members, that don't have that. And a lot of the things we hear tribal members talk about is like the hoarding of knowledge, people that do know these things, that do know how to gather traditional foods or do know language or traditions. It seems like there's not a real motivation to share that with tribal members and to pass that knowledge down. People will say, well, my family has always been traditional. We've always done this, but they are, we're not sharing that with our other families that don't have that. And a lot of our families lost that because of these federal policies and because of colonization. One thing I don't see in this document is what we're going to do to address lateral oppression. I think that has increased significantly since the pandemic has started. It's, you can go exercise and feel good and come back and someone gaslights you. That's not going to make you feel any better, so I see a lot of that happening. It goes from the top down and from the bottom up. It's going on in our communities because our people are suffering and our people are, when we're talking about mind, body, spirit, that this is a spiritual talk we're talking about, and we don't have a lot of spiritual leaders that have revealed themselves to our people to say, if this is, you're dealing with these kind of struggles, this is who you go talk to, because sometimes we need that instead of calling the clinic and, getting put on medication or whatever. You might just want to go talk to someone or go, pray with someone or do whatever that person needs. So I think, when we're talking about spiritual stuff, it's such a bigger conversation. And, I'm by far not a spiritual leader or a cultural leader, but I, think that, as a responsibility as elected leaders, that we have a responsibility to make sure that our people have access to those types of things that they're wanting. And that includes us too, as a tribal council. We have to have a healthy leadership as well as a healthy staff and a healthy tribe. So I think we just need to really consider, the lateral repression. I don't know what the answer is to that. I wish I did. I think we've all participated in it at some point or another. And it's hard to really define, what that even looks like sometimes. But I think that, when we talk about, that bringing back a healthy tribe, that's what we need to look like, where we're a community and our people can talk to each other. And it's kind of like just being kind to each other, that being really intentional about how we treat our people and how our supervisors are treating their staff. And, it's got to be inclusive of not just the entire tribe, but our business arm as well, too, making sure our, business, entities are being included in this and how we're, just being real intentional about how we're treating each other and encouraging each other to live that healthy lifestyle and become, more of a tribe again. And I think that we've made a lot of strides. We've definitely grown so much since restoration, but we still have a long ways to go. And it might not even be something we see in our lifetimes, but I hope that our kids and grandkids, and that's what it's supposed to be about, is, what we can leave for our future generations. So I hope that we can build something, and I'm really excited. I fully support the ideal. So I'm thankful. Thank you, Dr. Hill, for presenting that.
Yeah. Well, thanks so much for those thoughts, because again, this to me is health. It's not the absence of disease. It's treating each other well. Treating each other well is a way to be healthy. When you're mean to somebody, that puts meanness in your heart, and then it makes you unhealthy. When you're nice to somebody, you feel good about yourself, and it puts goodness in your heart, and you become more healthy. I mean, all this interacts. I just want to tell one very quick little teeny story. I was having trouble with my internet, and I had to contact some people. So I went down to the travel center. It was like 11 o'clock at night. It was during COVID. It was icy outside, but there was a non-Indian gentleman in the back where where we used to have computer access, those little chairs back in the back with the truckers lounge area. So I used to go use the Wi-Fi there. So I went down there actually to use the Wi-Fi. It's like 11 o'clock at night or something. So I went down there to use the Wi-Fi, and this white gentleman, he was a biker. He was riding a motorcycle, and he had stopped there at the travel center because it was icy, and he was trying to make it up to, I think, Yakima or somewhere up in there. And he was afraid that he was going to fall. So he stopped at the travel center. There was no place else for him to stop. White man, right? Biker, looked like a big old biker, probably, my age or so, maybe a little younger, probably maybe late 50s or early 60s. Anyway, he was so thankful that the young gentlemen there were letting him stay. He was saying, do you think it'd be okay if I charge my phone? I said, I'm sure they won't mind. He goes, they keep walking by here. And he goes, I'm afraid they're going to make me leave. I said, no, they're not going to. But to me, and these young guys, they know what it's like to have a hard time, right? Our tribal members all know what it's like to be stuck somewhere, have a hard time, something. But he was so impressed about the hearts of these young men who weren't saying, you need to leave, you need to get out of here. He just let him. I said, they'll let you stay all night. I think that's what is in the hearts of most of our tribal members. But we have so much damage out here, and you're exactly right. That's kind of part of what needs to be addressed to become healthy again. But I think it's in the hearts of our people. Even though we can be mean to each other, I think there's something good in our hearts.
I think I see you shaking your head that you're calling on me, Chairman. I also am very grateful for this work, and I want to thank you, Dr. Hill, and the Health Advisory Committee, Dr. O, and all of your staff. You know, this is a wonderful document. I really enjoyed the holistic approach that's all throughout it. And I also want to echo what Secretary Frost said, you know, that how the original concept from the health ambassadors got sort of reworked with the input of the committee. And ironically, right, I think that's part of what we don't do well, because we're so many of us are so injured, that part of our lack of health is our inability to work well together. And, you know, that's one of the more frustrating aspects of this job that I've had, is to see, often it gets called silos, right? Folks don't necessarily collaborate well. And so I just wanted to point out how happy I am to see the working between the committee and the health staff, and hope that we can continue to increase that as this becomes more and more holistic. So thank you. And one more maybe example of that, I'm sure you know that at one point we had some greenhouses, and we were really going to do some work to produce healthy food in the community. And ironically, that really sort of fell apart over a lack of health, you know, or what I would think of as a lack of health. Folks who just aren't able to work well across different perspectives. And so it's affects us in a lot of ways. Willa calls it lateral oppression. You know, I see it as the consequences of a whole lot of trauma. And, you know, it can only get better through this program. So thank you.
Chairman, there's one question that I'd like to read from one of our listeners. It says, will there be a gym available in Klamath Falls at a later date as well, or only in Chiloquin?
As far as
Chairman, you're breaking up. Can't hardly hear you, but I would say maybe something that could be worked out, because there are multiple gyms in Klamath Falls, would be, you know, assistance with joining those. I don't know. You know, that would be near, you know, something that would be easily attained, rather than building a gym right at this point. I'm not saying that wouldn't happen, but that would be an idea.
I dial in after the break on my phone.
Rose?
I'd like to thank everybody that worked on this this paper, and what Dr. Hill is talking about. You know, a lot of that, what he's talking about, happened in 1986 with a lot of people that were working on restoration. And that's where a lot of the things that are at the office behind the reception desk, that's where that came from, because we wanted to be recognized again, to be able to make our people healthy again, because they lost so much. And I thank everybody for their work and all the words from Tribal Council, because if we don't work together, and if we don't try to make our people healthy again, you know, we're losing them daily. You know, with this COVID thing and with all the shutdowns, a lot of people are feeling isolated. A lot of people are having mental issues because they can't go out and talk to people and tell them, you know, I'm feeling this way or I'm feeling that way. They just sit at home and cry. And that's a sad thing. And when you're depressed, you know, that's how you become ill. You know, you just your body starts feeling all of these things, and pretty soon you watch TV and all you see on TV is, you know, you take a pill for this, flu season's coming up, pneumonia season's coming up, diabetes, heart problems, and pretty soon people start feeling all of these symptoms, and television is a good thing, but my brother Gilbert works in the pharmacy and he said, see, that's what they're doing. They're telling you that you're going to be sick. You better gear up for flu season. You better watch out for pneumonia. And it's true, you know, if we listen to that stuff and we eat it, and a lot of our elders eat it every day, and pretty soon they're going to be sick. So I really like what this paper is talking about. And I like the health committee for their work and everybody that helped work on this, and Dr. O and all of our health staff. I got sick and I was in hospital for 3 days, 2 or 3 days. And it's a heart thing. They say it's a heart thing. So I gotta change my eating habits. I gotta take some new medications. They took medicines away from me and put me on some new medicines that's gonna help me. And the new medicine's giving me a headache every day. And they say, well, that's gonna go away. But I gotta change my eating habits. I gotta walk more. And they tell you you gotta change your eating habits, but they don't tell you how. They don't tell you what you should eat. So I started going on Google to find out how you can eat better if they say you have a heart problem. So they say the Mediterranean diet is the best foods to eat if you're having high cholesterol. And so I've been looking into that. But what our older tribal members don't know is you can go on to Google and look for this information. They don't know how to use the internet. But when you look at the Mediterranean diet, you know, there's a lot of things on there that I've never eaten. And so for me to go on that diet, you know, I'm going to have to change a lot of things that I've eaten in the past and start learning how to eat new things. And everything I've eaten in the past, you know, is all fried foods, hardly any vegetables. But this is something that we need to get our elders and our older community members interested in. And I'm really glad, you know, you read on from all of the other nations, the other tribes, they have celebration 2 or 3 times a year, eating their traditional foods. We need to get back into that. You know, sure, everybody goes out and does their meat, does their fish, collects their berries, but they keep it to themselves. They don't share it with anybody else. And that's what we need to do to teach them, you know, this is going to be good for you. And I'm really excited for this program. And I want to thank Gail, because my daughter used to go with her son, and she used to take them out to gather. And my granddaughter brought back some wild celery. And I said, what is this? She says, wild celery. I said, where'd you get it? She said, we gathered it. And I said, you did? She said, yes. And so I kept it. It was in a baggie, and she shared it with me. And for a long time, I put that wild celery in my food. It was delicious. And I'm going to have to find out where she got it so I can go gather it myself. But, you know, I really appreciate everybody today. And Jeannie, you listen to this too. You know, you're important to us. No matter what people don't tell you, you know, you matter, and we love you. And you get yourself healthy. And there's a lot of our tribal members out there who need extra attention, who need to be told, I love you, and you are special. And Dr. Hill, I love you too, for everything that you've done for us. I knew you would be an asset to us. And all of the tribal council, you know, you work so hard and you're dedicated. You're here every day, and I can't be there when you need extra help, but I'm here at home. So always give me a call if you need it. But thank you everybody for today, and you guys have a blessed week, and that's all I have to say.
Well, Rose, I want to I want to say just 3 words to you. For all your efforts to take care of yourself is Omaski.
That's good.
Thank you.
Now, Chairman, I did send out an email with the body of a resolution. Now, I don't know if council's ready, you know, I would, for myself, I'd prefer that this group of HAC and Dr. Larrabee and any of the other health staff have a work session with administrative staff to make sure everybody's on board and everybody knows what they would, you know, what they would need to provide for this to be a success. But that's just me.
Chairman and Secretary, I would agree with that. And I also would want to make sure we're inclusive of Tribal Court, because Tribal Court is doing a lot of the work, you know, that we need to help with this healing process.
Thank you, Will. I'm not being very inclusive, am I?
The word of the day, inclusive.
Can folks see? I didn't realize I had to dial in on my phone. I'm going to just dial in after lunch on my phone again in case I have audio issues, but really appreciate this. And yeah, I'm thinking as far as process, you know, we have some time to work on a resolution and maybe work cooperatively on that. And that work session, I think, is really helpful. I'm hearing pretty universal or unanimous support for moving forward with this. And so I'm thinking that a work session and then coming back at the next council with a resolution that's properly worded that, you know, really sets things in motion. And maybe some, there was some discussion about how things were listed and so forth. So maybe we could work on all that together and cooperatively in a work session. But that's pretty exciting. You know, I'm great to hear this. So I think that's what we'll do. We'll set up a work session and then we'll be prepared for the next tribal council meeting to move forward with the resolution. Does that sound agreeable to everyone? Okay, great. So, and Doctor, the other matter, they're through Cascade Health Alliance. Yes.
Dr. Martin had her hand raised.
Well, I'm sorry, Doctor, go ahead.
I'm sorry, I just briefly want to say that like as a Native person working for a tribe, not my own, like I'm a Cherokee tribal member and my family is in Oklahoma, this conversation is good medicine to my soul. I feel a little choked up. So it's, I want to do anything I can do to help push this forward, because to me, this is like my dream in medicine, is that everything we do is medicine. And I think that I've been so honored to work for you guys over the last year and watch you lead in this community in the ways you're describing, by love for your people. Like, we put our elders first, we protect our sick people, we look out for our babies and our pregnant people in ways that other places I work do not do. And that has made me feel like a lot of pride to work for you and a lot of pride to be Native. And so I just want to thank you for including me or letting me like sneak on to the rest of this call, but is good medicine for my soul at a time that's been hard. It's been a hard year. So thank you.
Oh, thank you, Doctor. That's encouraging. Okay, well, let's, if we can, there's information, we sent the email out. Cascade Health Alliance has an opportunity. They're seeking community advisory council member. You know, they would really appreciate tribal input and support on that. And the information, I think, was emailed out, but that's the general matter here. And it does, I think, in the information talk about some of the responsibilities of the board members, and I'm not sure how often they meet, but we were thinking that, of course, Dr. Hill, your name came up as a potential opportunity and seemed like a good individual to recommend for the position if you're available. And so, not knowing how much information you have or your perspectives on this, I mean, we could address this, maybe formally down the road, but I don't know if you're prepared to commit to that. I know they're looking to hear a name a name for us to recommend for that position.
Thank you, Chairman. I do have the email here, and I would be honored if council would consider me for this.
Okay. Well, I'd like to do that by motion. If just to formalize it, then we can inform the Cascade Health Alliance by motion that we approved you to represent the tribes as a community health community health advisory council. So if folks are in agreement with that, or even if one's in agreement, I'd entertain a motion to do that. Okay, I see member Hatcher, and second by member Lang. So we have a first and a second for that motion. Secretary, whenever you're ready, please conduct the vote.
Gail Hatcher,
E.
Clay Dumont,
E.
Willa Palace,
I vote yes.
Ellsworth Lang,
Yes.
Jeannie McNair,
Yes.
Rose Treetop,
Yes.
and I vote yes as well. Chairman, with your abstention, the vote is 701.
Great. So the motion carries. And Dr. Hill, thank you again for all that you do. You know, not only for us, but Indian country in general. You know, just I know you've been a valuable person for Indian country and the Klamath tribes. Just thank you for your willingness to do all the work that you do to help us. We really appreciate it. Thank you.
Thank you.
Okay. With that, we'll recess for lunch. We have 1 p.m. So it gives us a bit of a time, not a full hour, but so let's recess and come back at 1 o'clock for the project introduction by Zio Fiber Optic. So thanks everybody. Have a good lunch, and we'll be back on soon. Thank you. Thank you, Doctor.
Love
Thank
you,
you. Bye,
Rose.
everybody.
well.
Are they? Yeah, okay, thank you.
Chairman's coming on now.
Folks can hear me now?
Yes, we can, Chairman.
Okay, I just got on my phone. I said have problems. I'm not sure. I couldn't actually. I was waiting for somebody to let me in, according to my side of the computer. I'm not sure what happened. Kind of locked up or something. So I apologize for getting a late start here. I know Joe's got us going live now, so we're ready to resume the meeting. And first up, I do know we have some. We're going to have a presentation on the Zayo fiber optic project. Introductory presentation. I don't know if there are folks from the project that are here, Perry, or is that something you're going to lead us through? Looks like we have somebody from the project here, correct?
We've got several people, Don. First
Okay.
off, I'd like to say thank you very much to you and council for allowing us to present this project for your consideration today. And it's the Zayo fiber optic project. Les has been working very intensively on this project. So at this time, I'm going to turn it over to Les to start an introduction.
Thank you, Perry. Good afternoon, Chairman, Vice Chair Lady, and Council. Yes, today we have Zayo Group LLC. They're going to give you a presentation of the Zayo fiber optics line from Primeville to Reno. They're going to present a slideshow here for you, and we have a couple of agencies on BLM, Todd Forbes, Forest Service, Penny Borgie, and ODOT, Tobin Botman. So at this time, I think I'll just turn it over to Robert Macaluso from Zayo, and we can do a round of introductions and start.
Thank you, Les. Hello, and thank you for inviting Zayo here today to present to you. Today, I'm going to share with you our project that traverses Klamath ancestral land. This is something we have a lot of experience with. Most recently, we worked with the Gila River Indian community in Arizona. We had a great working relationship with them. They added 2 monitors to our project, and we actually discovered a ball court that was around 1,000 years old. We did not expect to run into that, and it was exciting for everybody involved to find it. This project strengthened our relationship with their telecommunications company, and we are both customers of each other today. We would like to have the same great relationship with you. And as I go through the presentation, I would appreciate it if everyone could hold their questions until the end.
Great.
So who is Zayo? Zayo is a business-to-business company. We do not sell residential services. However, providers of residential services do purchase connectivity from us. So our network connects Western Europe to the Far East in most of the major cities in the United States and Canada. This project is a 660-mile project connecting Umatilla to Reno. The project is it started in 2017 and is expected to complete in 2022. The project is all underground construction, mostly in the public, actually all in the public right-of-way, primarily ODOT and Caltrans right-of-ways. Zayo employs biologists, botanists, archaeologists, historians, and required monitors to ensure good stewardship of rights-of-way, resources, and culture. Here's a map that outlines the Klamath ceded lands with our path traversing it. And next to it is more of a blown up map here that shows our path starting at Umatilla and traversing to Reno with our ILA locations along it. These ILA locations, they're small shelters that house our regeneration equipment for the fiber optic cable. Construction duration is estimated to be 6 to 9 months based on a 6-day work week. Our construction methods will be driven by the final environmental process and will be a mix of plow, boring, and trenching. Based on the right-of-way authority, our depth will be 24 to 36 inches deep and potentially 48 inches deep in certain municipalities. Our waterway crossings will have some that we bore and others that will be hanging conduit on the bridges with handholds for access locations along the route. Because of the size of this project, we will require staging locations to place our materials. And as far as the materials, these reels here with 3 colors on them are about 2,500 feet of each color. There'll be somewhere around 1,500 of these reels, so they'll be staged along the path. And the fiber cable here is 30,000 foot reels, so there'll be around 120 of those reels of fiber that will be stored at the staging areas, and then the vaults that are every 3,000 feet. So this is an example of one of our vaults. These are 30 inches by 48 inches by 36 inches deep, and they're placed flush mount. They'll have a ZAO marker in the corners of them with a phone number in case anyone runs across it. Our construction methods. This is an example of plowing. So it's a rip plow that comes through and makes a 36-inch deep trench and then lays the conduit in the trench. This is an example of a shoulder plow where we're going down the road with the plow and trenching in fiber that's on a reel in front of the machine. Boring. So this is our directional drilling machine, and it comes with a couple support vehicles also. This here is a vac truck when we need to pothole other utilities so that we do not damage them during construction. And this machine here, this is the bore liquid, which lubricates the rod for boring. Here's an example of the bridge attachments. So we have our conduit that runs along the bridge tied with the hangers. And this is the construction method. So we have a truck on the overpass with a bucket with 2 workers in it attaching the conduit to the bridge. Sorry about that. This is an example of fiber placement. So we spool the cable off of the reel and we figure 8 it on the ground like that, and then it's fed into one of those access vaults and blown through the system to the next location. So we've had previous communications with Klamath. ZAO held a joint video meeting with representative of Klamath Forestry and BLM last April. We discussed our project detail, construction methods, environmental and cultural processes. In July, another meeting was held between ZAO, Les Anderson, Perry Chaktoot, and Mandy Robertson to introduce ZAO and present the information or the informational slide deck. And then another meeting was held in December between ZAO, BLM, ODOT, MGC, and Triage. It's our engineering company, where a field walk was performed at multiple locations. For this slide, I'm going to hand off to Sarah from Stantec.
Hello, can folks hear me okay?
Yes.
Thank you. So my name's Sarah Lindberg, and I'm leading the environmental permitting process on the ZAO team. And so what I have here on this slide is basically where this project, the permitting for this project is driven by 3 main types of permits. So the first one is this NEPA process, and the NEPA process is triggered through the project taking place on federal lands. So for this project, we have both U.S. Forest Service for the Deschutes and the Fremont-Wainema National Forests, as well as BLM lands. And as part of the NEPA process, as I'm sure many of you know, that process looks at environmental impacts to the natural and the human environment for a wide variety of resource types, including cultural and historic properties and tribal resources. So underneath NEPA, there's a Section 106 process, and that process is being led by BLM and under the NEPA umbrella, and that is required to comply with the National Historic Preservation Act. And so as part of that, there has been some coordination and ongoing coordination with you and other tribes and interested parties and agencies about the project. We're starting to hold more, but we've been holding about monthly coordination meetings with the various agencies. And there's 2 phases of cultural resource survey taking place. Right now, we're just wrapping up the inventory and evaluation phase. And we're about to get started on a site testing phase. And through the whole process, again, BLM is leading, Penny is the main point of contact. She's leading review, consultation, and outreach. And eventually there will be a determination of effect made by BLM for the project. And then we get into the state encroachment permitting process, and that process, of course, can't be completed until the NEPA and the Section 106 process are complete. And so ZAO will be seeking permits for both of the DOTs, both the Oregon and the California DOTs. And then to give you a brief overview on status of those processes, and we have Ross Smith on as well, who can give you more in-depth detail, both now and later during questions. So the NEPA process, we have 3 NEPA documents being developed. The BLM, the Deschutes, and the Fremont-Wainema are all completing their own NEPA documents, and we're expecting those to be completed about the end of this year. And then the Section 106 process, of course, as I mentioned, we're in the inventory phase now that we're just wrapping up, and we'll be starting site testing and evaluation phase this spring. And that phase will be permitted through the ARPA permit process, which the Klamath will have an opportunity to comment on and advise on. And then we'll get into the review and consultation portion, which again is BLM led. And right now we're estimating that BLM will make their determination of effect probably sometime late fall of this year. And then there's, of course, throughout all of this, I wanted to mention that we've got ZAO's implementing best management practices. Now, some of these are required as part of the permit process, various state, local, county, federal permits or laws that they need to comply with. And so there's going to be a lot of things that are incorporated into the design and construction methods for this project. And I've listed a few here, such as implementing stormwater controls to prevent erosion or sedimentation of ditch lines or water bodies, traffic controls. They'll be implementing fencing and flagging to exclude different environmentally sensitive areas like wildlife habitat or wetlands. And then there will be some timing windows placed on their work as well, again, to avoid impacts to sensitive species or bird nesting periods, things like that. And then, of course, throughout all of this, they'll be have a specific hazardous material control plan that will manage oils and things off their vehicles, and also any kind of bore, mud or other chemicals or materials they might need to actually construct the project. And before we move on from this slide, I wanted to give Ross an opportunity to introduce himself and add any detail to that Section 106 process component.
Thank you, Sarah. So my name is Ross Smith. I'm a senior archaeologist for Stantec, based out of Portland. And to build on what Sarah has said, you know, we've completed our field inventory of the project alignment, and we are working on finalizing that inventory report. We'll then be transitioning and applying for, Sarah mentioned, ARPA permits from the BLM and the Forest Service to conduct site testing on the federally managed portions of the alignment. We'll also be applying for State Historic Preservation Office archaeological excavation permits to conduct field investigations within the ODOT managed portion of the non-federal crossings. And in both of those, both the federal and the non-federal permitting, Klamath will be contacted by those agencies for their input. And we expect to be submitting those permit applications in February, and if all goes well, we should be starting the testing work a little bit later in the spring this year, and hoping to wrap up by midsummer. Thank you, Sarah.
Yeah, thanks, Ross. Back to you, Rob.
Great. Thank you, Sarah and Ross. So here is our schedule for California. Now, it's an estimated timeline subject to agency approval. But California, we expect to start construction around July 1st of 2022 with completion in December of 2022. Oregon, sorry, I forgot to put the dates at the top, so we just have to kind of match it up here. But Oregon, the non-federal lands, we can start, or we'd like to start around March 15th and with completion December 15th. And the U.S. forestry lands, March 15th, completing May 31st. And again, these dates would be subject to agency approval. And then Oregon continued for the BLM lands. We would be starting at April 15th, continuing through September 30th. So in summary, we want to partner with you and have a long-standing relationship, and we will work hard to respect you, the lands, and all parties with interest. Thank you, and I'd like to open the floor for questions at this time.
Great. Make sure I'm not muted here. Yeah, I'm using the combination of my phone and my computer. So, thank you for the presentation. I think we do have a number of questions. I see that our staff has been engaged for a period of time. That seems you're in a information collecting time and kind of a planning part of the process. And I see there's some NEPA to be completed. I just wanted to say, Todd, I saw your face. It's good to see you again. It's been quite a while since I've visited with you. It sounds like you have a pretty significant role in this through the BLM. I imagine you're going to be helping to coordinate the Forest Service Deschutes and Fremont Wyoming on kind of some of the federal matters. Is that correct?
Yeah, those agencies are kind of doing their own NEPA, but we will discuss and coordinate for sure.
Okay.
And Don, just so you're aware, even though I'm the district manager for the Lakeview district, I'm the authorized official for the entire length of the route. And so I'll be the one from BLM that signs the documents for everything from Reno to Prineville.
Okay, so as far as BLM involvement, not the Forest Service.
Correct, just the BLM.
Okay.
Yeah.
Okay. Because I remember your name was mentioned earlier as kind of like one of the had a significant place the way it was referred to. So I was just wondering. So let's move to consider within those other federal Forest Service, in this process when we. So is there a since we're dealing with multiple federal agencies, will there be a need to meet together, or we're gonna? I was just trying to figure out for a process, the most effective way to do that, or do we need to meet with them individually?
I think it depends. I think it depends on the significance of the questions. From the federal agency standpoint, BLM is a really big holder, especially in the Oregon area where we're talking about the Forest Service. The amount of ground that the Forest Service, the route crosses is relatively small. We're certainly not opposed to all meeting together if that's going to be more efficient for you guys to do that.
Yeah.
I'd be looking for some feedback from you, Don, on what you think about that.
So I think we probably have to talk about that internally. You know, we're implementing more of a complete interdisciplinary internal process to involve the right folks. We'll probably vet that with folks and see how that works. So yeah, there's I appreciate the information. Just for folks that are on, you know, I know you've worked with our Culture and Heritage Department. We've got several tribal council members on here with us also in the meeting, of course. I didn't know the full range of folks on that side. I see there's someone, Todd, I know you're from BLM, and others with the agency. Seemed like DOC, ODOT was identified, but do we have somebody from the Fremont, Wainema, and Deschutes on also?
Hey, Don, this is Penny Borgie. I work on the Deschutes National Forest as the Heritage Program Manager and Tribal Liaison, but I'm also under an interagency agreement now with the BLM to act as the lead Section 106 for the BLM and the Forest Service for this project. So I'm here as a Forest Service representative for this meeting today. But as Todd said, if we want to have a meeting with the Forest Service line officers, then we can surely do that. I do know that at the beginning of this project, we did have a meeting with Les and Perry, and the line officers were with the BLM and Forest Service. We're all at that meeting at that time, but we can surely get together with the council at another time.
Okay, yeah, I was just trying to, because I know if there's multiple jurisdictions, private lands, different feds. So it sounds like you're or the point, because I know that these type of projects have implications on cultural resource protection and those things. So you're like the point person for all of those agencies on 106 consultation matters?
Consultation matters with the tribes. We haven't delegated that responsibility out just to one office. So all of the offices are retaining their responsibility to consult with the tribes on this project, both with the BLM and the Forest Service. But I'm helping to lead up consultation efforts, at least in Oregon, and coordinate meetings in regards to the Section 106.
Okay. Yeah, I was just, you know, because it's a large project. I mean, it's going through a lot of our Aboriginal territories, and just I don't know how many thousand feet view that was of the planned route. Being familiar with quite a bit of our Aboriginal territory, I can see there would be significant concerns from our folks. And I know our Culture and Heritage Department has probably shared some of those concerns already. So I was just trying to wondering who's who and what the process is. You know, it seems to me that NEPA is pretty adventurous, you know, at this point, you know, given the level of concerns I anticipate that we have. Anyway, I think it's probably pretty clear that we have cultural resource concerns. There may be other concerns about environmental impacts. When I see like, I'm not sure if the lubricant for the pipes is toxic or whatever, but you know, there's a hazardous material kind of thrown in there too, like there's something there which could be a concern. But you know, it sounds like there's consideration of impacts to wildlife and other things and staggering timing of when the project is implemented. Some of those things are already in play. So, but anyway, I just know that we'll need to, after this meeting, have more internal communication with all of our folks that are part of our interdisciplinary team and come back with some recommendations. But I was just trying to find out the most effective way to communicate back. You know, I'm assuming that somebody's, the NEPA is being contracted out, is that correct? Is that going to be, that entity is going to, that's doing that is going to be coordinating with all the federal agencies, is that correct? So, I mean, in other words, there's one NEPA person that's coordinating with the different federal agencies?
I might be able to speak to that, Penny or Todd.
Go ahead.
So the BLM has contracted a third party firm to complete an EA for the project, but BLM, Tara McLean in particular, she is the NEPA contact for the project. And the Deschutes and the Fremont Wainema are doing their own outreach for their NEPA document. But both of those agencies have already completed a NEPA-related scoping effort that actually took place quite a few months ago. And I believe you should have been involved. I think the Klamath actually wrote a letter in response to that scoping comment, but I would have to go back and check. But yes, you would have, you would need to coordinate separately for any concerns you would have on Forest Service versus BLM lands, because they are running those two NEPA processes separately, as far as I know. But of course, they're coordinating with each other. So any comment you made to the BLM would be communicated to the Forest Service, that kind of thing.
So Dawn, just to kind of add that, the NEPA that the BLM is doing, we are considering the cumulative impacts of the entire length of the route. And so from that standpoint, you know, BLM's NEPA will touch some impacts along the entire length of the route, but if you have very site-specific impacts related to a particular forest, then those won't go through the BLM NEPA, they'll go through NEPA with the Forest Service. The way BLM is running their, you know, just to kind of add to what Penny said about her, she is the single point of contact for all things cultural resource related for the entire project with all the federal agencies. She and a core team of folks are working on the NEPA together. And so we kind of have that core team. You know, there's one biologist that kind of is working on everything. There's one botany person. There's one, but that core team works together, but they also have contacts in each of the individual districts for BLM that are kind of feeding them information about their own district, right? So you've got the people on the ground in the Eagle Lake field office and the Applegate field office. They're feeding information to this core team that's putting that NEPA together. So we do have a kind of a core group of folks that are kind of focused on the entire length of the project. But as far as consultation goes, we saw some value in the relationships that the tribes have already built with those respective offices. And so we saw some value in those, continuing those relationships. So rather than dealing with somebody new, you're dealing with the same folks you would normally deal with. You can always reach out to me if you have concerns on anything, and I can make sure that get us pointed in the right direction or share those concerns with anybody on the project.
On?
Yeah, go ahead.
Don, we have a file on our C drive, and it's a ZAO file. And as soon as we get another drive established through IT, you'll be able to access all of these documents through that file. But we already have accumulated a lot of this information on a separate file on our C drive. So, you know, as we talked about the interdisciplinary process, we identified a separate drive that was needed in order for council to be able to just click on it and read all the information. As soon as we get a copy of this PowerPoint, it'll also go in there.
Yeah, what I was interested in is trying to figure out how we can facilitate appropriate government-to-government consultation. You know, our staff has certain responsibilities, and it gets really complex when there's state lands, private lands that the state has some responsibility for. Then there's the different federal agencies, and then there's the project proponent, and then there's the NEPA person, and you know, it's nice to know that there is like a core team that's maybe a lead person on you know, soil impacts or environmental or wildlife impacts or something like that. So so I was just trying to get a feel for, you know, how we could really be engaged at the appropriate level to, our goal is to make sure our interests are protected and considered to the full extent possible. And there'd be basically no negative effects of the project if that's possible. We know that often mitigation is a part of things. And avoidance is typically where we won't go, avoiding sites, you know, so that leads to questions on even the surveys that have been done. You know, that's one of the questions I had, you know, were our folks consulted in the type of survey and the level of survey, and you know, so they have a certain confidence that things have been identified that would guide maybe avoidance, you know, things like that. So I'm kind of jumping around a little bit, but that's my interest in trying to facilitate, you know, appropriate consultation and be most effective. And so anything that would help me understand how we can do that most effectively is good. I think you're for sharing what you have, Todd.
So Don, I would be more than happy to kind of help facilitate that government to government consultation from the federal agency standpoint. And I'm not opposed to including the state agencies in there too. I guess I'd be looking for you for some guidance on, you know, when you're ready to have those conversations and who you'd like to see at the table, but I'd be happy to facilitate that for you.
Chairman, Les has his hand up.
Yeah, I'm sorry. Yeah, folks can feel free to interrupt me with audio, because when we're sharing the screen, I can't see everybody. So feel free to jump in. So go ahead, Les.
Thank you, Chairman. Yes, I believe we're at that phase now, which you just mentioned. We'll be starting to interact and engage more when as the permitting process moves forward, and putting in for those ARPA permits, having our cultural folks out on the ground during this testing phase and moving forward. So our engagement will become more and more from, I would say, from this point forward, if that helps.
That does help.
Also, this is Clay, I'd like to ask a question.
Yeah, go ahead, Clay. Yes.
Yeah, I was wondering what other tribes you're speaking with, knowing where the area is out there, and I hear you talking about Archaeological Resource Protection Act permits, and that's not a law that I see as really having been written in the interests of Native people. I understand that the 106 process could make up for some of those shortcomings. NAGPRA could get involved. It looks like there's going to be a lot of digging going on out there. But of course, all of that would require being able to know which other tribes are involved.
Penny or Ross might be able to speak to that.
Yeah, I can speak to that, Clay. Right now we have, I believe, and Bill can correct me if I'm wrong, for Lakeview, I think they had contacted and have worked with the Burns Paiute, Fort Bidwell Paiute, Klamath tribes. And I know that the Deschutes has contacted the Warm Springs and Burns Paiute, and then we're engaged with Klamath tribes. The Northern California offices have been working with the Pitt River tribes. And then we also have, I think there may be some Susanville Rancheria down by Eagle Lake and the Washoe tribes as well. And I think one of the Paiute tribes down there, and I'm not quite sure which. I'd have to go back and look at my notes. Did that answer your question?
Yeah,
it does. I think it's gonna probably complicate things a lot, and that's maybe something we have to talk about internally. But I'm really concerned about the amount of dirt getting turned and the potential for uncovering things that might not be covered by NAGPRA, and then trying to figure out among the various tribes how we're going to.
Yeah, that's important.
So Clay, somewhat for, to add to that answer, so we're going to be engaging and writing comments and giving comment to these reports and such, and be intricately involved in the inadvertent discovery plan. And we will move into, as in this phase, Stantec will facilitate for the monitoring portion, and as it moves in, as it proposes to move into construction, then we will enter into more of a monitoring agreement. So our involvement is from this point forward, and it has been, we'll be heavily involved to make sure our interests, the Klamath Tribe's interests, are adhered to on dealing with SHPO and those other federal agencies.
So let me just follow up on that real quick, Les, and then I'll be quiet and give others a chance. I saw, right, that these discussions have been going on since I think I saw at least April. So I can't believe there haven't been conversations already between the various folks here and our culture and heritage people about the fact that other tribes might want to be involved and what that might look like.
If on the slide for the Klamath Tribes communication and coordination, ZAO did do a presentation and vetted through the Culture and Heritage Committee on that April 24th date. And we probably, at this point, it's been a work in progress. So now that all the reports are coming to fruition, and as we're getting into this process, we as Chairman mentioned about the IDT team, I think getting more intricately involved with our committees and such will be we'll start doing that. Yes.
That was kind of, because I know we're just kind of initiating or moving forward with a more focused internal process here, and I it takes a while to in the midst of COVID, especially for committees to come together, and so I was just thinking about the NEPA deadlines, considering all that in our internal process, and so we can provide meaningful input along the way. And not only in the NEPA part of it, but actually in to make sure surveys are done appropriately, and of course, sounds like monitoring's being considered, and so that was just part of the reason why I said that seemed kind of adventurous for us, and I did want to talk. This is a large project. We have pretty limited staff, and our folks. These things keep getting imposed on us, and I don't know if it's too early to talk about that, but I really believe that there's, because of our treaty and the obligation that the federal government has to us, we need to have the resources to be able to, protect our interests, be involved at the level that's necessary. So we'll talk a little bit more about that need, because staff is managing so many things, and this is a large project. You can't have eyes everywhere, or maybe enough resources to look at everything that we're going to be concerned about. I imagine there's going to be a survey and some reports, and how is extensive is that? What are we going to do to review that and identify potential concerns, and make sure we're working with folks to protect those, if there's cultural sites identified or other sensitive areas where we think cultural resources may be. So I'm just wondering what can be done. We'll have an internal communication about that to really see what we can do and how effective we can be. But I was just letting folks know that we may want to come back with a proposal to make sure that we have the staff that's there that's going to help us to do the work that's necessary. I'm not sure who to propose that to. I mean, the project proponent, I think, maybe would have some resources that could be invested in that.
So Don, this is Todd. I was just trying to think of the timing. When do we have that conversation? And I guess, and Perry or Les, you guys weigh in here if you feel differently. Seems like the timing to have that conversation is when we get kind of some of those testing reports back, so we kind of know what that lift is going to look like for staff time. I don't know. Does anybody see that differently?
No, you're correct, Todd. We need to find out what's out there first, and we're going to be involved in the surveys out there. We need to know where the line's going to go through or around. In some cases, it's going to go right up on the roadside. In other cases, going to be on at the end of the right of way. And we have the ability to move that around and make sure we avoid cultural sites. But in some cases, there is going to be impacts to some of them sites out there. And through our monitoring agreement, like Les had mentioned, we want to have our cultural people out there with the other monitors and making sure that we take care of our inadvertent discoveries.
Yeah, maybe we're kind of addressing this somehow in real time without an internal community. I guess I was just concerned to make sure that we had enough staff to be involved in coordinating the surveys and reviewing the surveys. And since it's such an extensive area, that's why I thought it was, because I know you're gathering information and surveys are coming. I wanted, I guess, assurances that we feel like we can actually cover that and be engaged as we need to be. I thought that was why I brought that up. So I don't know if staff has any comments on that, but that was my interest in asking that question.
John, staff's very capable of reviewing the site forms and making field trips out there and making sure this gets through our territories correctly, and all of our bases are covered out there. We're going to have monitors, and so I imagine we would engage in a monitoring agreement. So the first step is going to make sure that we do the surveys, see how far down some of the sites go, see how extensive the sites go, look through the permitting process, and do our checks and balances there. Les, you got something to add to that?
Yeah, Perry, thanks. On one of the field visits that we participated in, we sat down and looked at the route, and when the agencies and ZAO folks and some of the engineering, Perry and I sat down, we looked at some of the sites that we knew of on the route, and different types of site types and different types of soil changes. And during that site visit that we went out with the ZAO folks and expressed our concerns based on those site types and that terrain, of what type of methodology that would need to be developed in the testing phase or through the construction phase, and with the agency folks. And it was a pretty productive meeting. And Dan may chime in, or Todd or any of the agency folks during that field trip. It really gave an insight to those sites that were on the ground, and how do we proceed forward with the testing methodology that will be employed in this phase coming through the ARPA permits, and how from that we can learn in the design of the route. We're not talking like this. We can change it miles, because it's basically going to stay within the ODOT right of way, and along with ODOT, some of the information that they'll be gathering and putting together for avoidance for some sites that we know that are very sensitive.
Well, I appreciate it. I did see the trenching along the roads. I see ODOT's here. So is part of the consideration, or significant part of it, is to go through existing road beds or disturbed areas. And sounds like that may be the case, which might alleviate some of the, well, I'm not sure. In other words, it might be less of a concern to do that than just going to virgin ground and disturbing soil. So, so there's a lot to consider here, and I'm not the expert on this. I just want to make sure we have enough information and we're kind of on track to do what's necessary to make sure our interests are protected.
Chairman, that's our ultimate goal on the design of this project, and working with the project proponent, is to try to take the path of least resistance of trying to find that thread the needle, basically through some of these areas. But unfortunately, there will be impacts, and that's what we'll at a later date when we get that information. We'll bring that back to you.
Chairman,
Yeah.
if I could ask
Yes.
one more question here or
Sure.
make a comment.
Yes.
Yeah. So, the chairman's talking about making sure our interests are looked out for, and you all are talking about this next phase, this inventory phase, and being out there with the potential to at least alter the route a little bit. And my concern, right, is that the Culture and Heritage Department is extremely shorthanded. Basically, in the field, mostly we have less. And the budget is also not strong. So I'm concerned about whether we've got the necessary resources to be engaged with multiple projects going on at the same time in these really critical phases. I mean, we know better than anybody, our own Culture and Heritage folks know better than anybody, when our interests are at stake when you're out there. And it makes me nervous to rely on others without our own folks right there on the ground.
No, thanks for sharing that. Yeah, that captures my concern. And even in the surveys, I don't know if there was discussion about, of course, some of this might be internal discussion, the surveys, or do we feel comfortable with the folks that are doing the surveys? Would it be, do we have some crew folks that we'd recommend hiring that we have trust in, or a consultant, or, I have a lot more questions than answers. So maybe some of these could be answered in just an internal meeting, but I wanted to make sure that we're pointing out what we need to at this point in the process. Don't want to come after the fact and raise something that maybe this is the appropriate time to raise it. So it feels a little bit awkward to me because not understanding more about the project and what's been done exactly. And so I'm hoping that we can, if there are other questions, that we think are important, I look to staff right now if there's something that they have recommendations or discussions about this point in the process, since you've been engaged and have a good understanding at this point of where we're at. So anything you folks, before we close here and get to our next agenda item, I'm hoping that you can weigh in there and then hear from the other council members any concerns or thoughts.
Well, Don, maybe we should put a working group together to sit down and go over what's happened so far and where we're at in this project. It probably wouldn't be too long. You could probably limit it to a half hour, hour of your time. Les and I could go through what we've been through the Forest Service, the BLM, and we can tell you where we're at and what we expect.
Yeah, what I'm thinking might be a part of the interdisciplinary process that we've been talking about, and you can invite available tribal council members to participate in that. So, but I was just wondering if there's anything in particular we need to share right now, recommendations or thoughts, concerns, of the staff. None?
One thing I might add, excuse me, Ross, I know we haven't seen the ARPA permits yet from, and you're going to submit them. So what would be the tentative date for boots on the ground? And that way that would kind of help us adjust and getting our internal process vetted and in place before you go back out.
Sure. So our deadline at Stantec to deliver all of the permit applications is, I believe, February 12th.
Okay.
And both the Forest Service and the state permit requirements state that there's a 30-day review period for all external reviewers, including the Klamath, to provide comments. And so we're anticipating field start date in mid to late March if everything goes well with that review.
Okay. So that again, okay. And for
Hey, Ross?
council, we will have comment, and you will probably see that show up in your matrix as we submit comment back to SHPO on those permits.
Hey, Ross, would it be possible to get a copy of your PowerPoint?
We have it.
We do it? Okay.
Yeah, I think we have it.
Yes.
Yeah, it's loaded on the C drive. Perry.
Okay.
This one, this updated one with the schedule.
Okay. So I want to make sure, is there any other concerns or comments from council members and others before we move on and look forward to having further discussion internally? And certainly it sounds like we're in a process to provide comments to meet expected or identified deadlines, to make sure we're engaged. So anything from
Chairman, I'd just ask that, real quickly, I'd just like to ask that council stay in the loop from this point on out, so that we're abreast of what's happening. And I would like to have that internal meeting when we get a chance.
Hey, I'll have Jennifer set us up a date and time.
Okay.
Sounds good. Thank you.
Anything else, folks?
Chairman, Kathy Stir just came on for the next agenda item, just to alert you.
Okay. All right. Well, thanks, folks, for joining, and look forward to further communication. I think we've got a fundamental or a foundational understanding of what's being proposed, and look forward to having more internal meetings and being involved and engaged as we kind of move through the process. So I thank you for that.
Yes,
and
thank
Todd,
you.
good
Thank
to
you,
see you
Chairman.
again. I hope things are
Thank
going
you,
well for
Chairman.
you.
Thank you, Chairman and Council, for your time.
Thank you all.
Thank you guys for having us.
Thank you.
Thank you.
All right. Thanks. Okay. So Aaron is joining us for the Spring Creek Conservation Project. I know, Ellsworth, you've been involved to a degree. Did you want to lead us through this, Ellsworth, before we turn it over to Aaron? Are you comfortable with that?
Yeah, Don, actually I am. I'll introduce everybody that's been invited. So we should have Aaron Rains, Kathy Storer, and Brad and Bob, and I don't see those guys on yet. Is there anyone else in the waiting room, Roberta?
I don't see anybody yet.
Okay, so I'll give a little bit of background, and council's aware of some of this. And I was hoping to get Dawn and council involved last week as well, but it was a real short lead time on a meeting that we actually had that took place at Spring Creek. Some of the history on this was the Chiloquin community builders and myself were talking about the large influx of tourism traffic all of a sudden after COVID-19 had hit, specifically in the Spring Creek area, the day use area, all the way up to the headwaters. And I think I shared pictures at that time and talked to council about abuse of those areas, not just at the headwaters, but also the large influx of boater craft, kayaks, arm floaties, inner tubes on Spring Creek. And then it sure seemed like there was a lot of abuse in the water and along the waterways. And I know Dawn and Gail were able to go to the property out there and view kind of the affected sites where the folks were actually at. And so what had actually happened was I had called and let Travel Oregon know that this was there was a problem. And so Travel Oregon invited me to a Zoom call and talked about things or ways to help mitigate the issues that were actually out there. and then it just kind of snowballed and more people got involved. And there's actually a small group that's trying to combat the large numbers and abuse of that tributary. So Aaron from State Parks, Collier Park, and I know there's he's got a title, and I'll introduce Aaron here shortly because he's got a small PowerPoint that he'll want to share. And I'm hoping that either Brad, Bob, or Kathy can share the intake application and explain what the group's ideas are to help mitigate and help control the abuse on the water, and as well as the cultural sensitive areas, which is the whole area at the headwaters. So I'm going to turn it over to Aaron. Aaron, I know you do have the PowerPoint that can kind of lay out some of the mitigation. And then if somebody else wants to take over the intake application and explain really what's going to come into play and where the tribes comes in. And then I know that the aquatics department isn't on, but Tribal Council may want to look at getting aquatics input because of that tributary, as well as the fish numbers up there that we've talked about in some of our meetings recently. So Aaron Rains, welcome, and glad you guys could get on the call today.
Yeah, thanks. I appreciate getting a chance to work with everybody on this possible project and some funding that might be coming this way and available. We have been looking at the use and the overuse of Spring Creek and some areas here, our facilities, maintenance, upkeep, and trying to do some mitigation effects on some restoration needs on the current launch site situations, and also try to roll in the safety hazards and concerns with the falls down below, trying to get some signage up, help with our information to the adjoining landowners who are up and down Spring Creek. And this is a great opportunity with everybody to help come together and help design and implement a project. I won't say from the ground up, but we're pretty close to that. Things and facilities and use was designed for this area before we kind of got before folks realized and found out that we were here and what a natural beauty Spring Creek is and the local area is. And so this is an opportunity to try and come together cooperatively and plan ahead and try to address some of these issues right up front before they have some defining impacts that it's going to take a long time to recover from. So with this opportunity and the conversation that Travel Oregon came up with this grant opportunity for us to apply for, it's not a given and a guarantee, but it would definitely go a long ways to help our direction and goals that we want to do and try to meet. And so I kind of have put together a little bit of a slide presentation just with the logistics of what kind of things and what type of things can we look at to get the information out there, keep a small footprint as we can, and yet still provide nice, new, good amenities for the users that are already coming, and develop something here that could be kind of a prototype and used at other locations. We have several other areas and launch sites throughout the county and areas that are in the same boat. And so if we can all cooperatively come together and come up with some ideas and solutions and programs that work, that we can track, that we can study and see how the impacts were affected, how did we, how well were we to implement this and manage and correct good behavior, good direction, and address our reuse. If we can roll that into our long-range planning, our next steps of implementation, and then especially for me with the parks, I would like to roll all of this information in with the maintenance and upgrades and planning for the park itself right here. So, so it comes in as a full picture. And I'm going to try and share my screen, and hopefully I can do this presentation. I apologize, our entire network has went down, so I am working off of Wi-Fi from my phone right now. So were you guys able to see my project Spring Creek grant proposal?
I don't see it yet.
Aaron, can I back up real quick?
Okay,
I just wanted to let Tribal Council know that this first came to this group last week on Tuesday. So this has been a really fast process, and that's why I wanted to get it in front of council as quick as possible. So this was the first opportunity. So I wanted to let council know that we haven't been working on this grant application for very long. Actually, I didn't really work on the application much at all. But there's going to be some tribal involvement that is, I think, on the application. I just saw it for the first time, I think, late yesterday. So go ahead, Aaron. I hope you can get that presentation.
Aaron, if you can't share
Yes,
it,
and
you could send it to Ellsworth or.
did it come through on yours?
I haven't seen it, no.
Okay. So I'm thinking that my Wi-Fi may not be allowing that.
Aaron, if you want to email that to me, I'll try to share my screen if you want to email it real quick to.
Okay.
Aaron?
I will do that.
You may have a different email address than. Just go ahead and email it. I'll get it up. I'll get it up as soon as possible.
Okay.
In the meantime, Brad and Bob are both from Travel Southern Oregon. And when I talked to Travel Oregon, I had let them know that the tribes had several concerns on the presentation that they had given in front of Tribal Council. And we were worried about a large influx that it may bring to our indigenous territories. And I really let them know that I thought this was kind of a microcosm of what could happen if we didn't get out in front of it correctly and make sure that this grant is actually called Destination Ready. Make sure that our area was destination ready if our area was marketed and we had a large influx of tourism.
Thanks. Appreciate you joining us. It's been a while, but did we actually meet with both of you when you came down?
Yeah, we did come down with Travel Oregon probably almost a year ago now and visited with you folks. So thank you for your time today. And I'll just run kind of over the overview of the program and answer any questions. And just as Ellsworth said a moment ago, this thing literally landed on our lap a week ago and we were told you have 2 weeks to turn it. So that's why we're jumping in here. Bob and I are with Travel Southern Oregon. We are the regional tourism office for Southern Oregon. We cover 5 counties. So over on the west side, we're in Douglas County, Josephine County, and Jackson. And then we hop over the mountains. We do Klamath and Lake as well. Bob and I have kind of full plates. We try to do projects. And I think people always kind of take tourism as we're trying to generate more people to come and overnight stays. And yes, that is a pretty traditional description of tourism. But on the same time, we also try to manage tourism. And we were made aware this last summer of just the absolute overuse of Spring Creek. And at the time when it was happening, there wasn't a whole lot of resources to fix it right then and there. We know Aaron was doing the best he could, but we did take this information, start pushing it up the ladder from the tourism side of things. So what rolled out to us just literally in the last couple of weeks is a project called Destination Ready. This is a new grant program, basically of $250,000. So we expect it to be a little higher than that, maybe 350, 400,000, going into play to basically make things COVID ready. We know people, there's a pent up demand to get outside and experience our great outdoors. And so there's some opportunities to build new resource, or there's opportunities to fix some of our resources. And so there's 6 categories. And one of them that we thought when we saw this was high use and destination critical outdoor planning. And knowing about this project already and really good collaboration between tribes, state parks, Chiloquin community builders, Discover Klamath, Fish and Wildlife, and tourism, we're like, you know, this is pretty a nice little package. So since it was already established, we approached Aaron and Kathy and just said, hey, this is what's on our plate. It's coming quick. Can you guys turn this around? And so we met last week at Collier State Park and got an understanding of the issues there. Bob's been drafting up the proposal this week, and we're just fine tuning it and submitting it. We're looking at, Aaron, I don't know if you're going to mention a budget. We're thinking somewhere in the $50,000 range is what this project will take. We're going to ask for $35,000 for the grant through the Travel Oregon program. Our local office will come in with $5,000. We're going to approach Discover Klamath and the Klamath County for additional funds, and potentially make an ask of you folks for some funds as well today too. So, so that's kind of an overview of the program. And Bob and I really, this is the Southern Oregon project that we're going to push through and make it happen, because we see a great need for it. And I can't think of a project that's come over our table, our desk in the last 5 years that's had such good collaboration and buy-in from the community. So I applaud the group that you guys already have started. It's great. So, oh, thank you. Someone
Real
sharing the
quick,
screen.
so I have the destination ready. Can you guys see that?
Yes.
Yeah.
Okay. So we, Tribal Council has an agenda, and we got about 15 minutes left. I see the next person's coming on at 2:30. So does somebody want to go over this application and to get all the information out as quickly as possible?
Sure.
And so,
Sure. I can do that, Ellsworth.
and I'll just scroll through.
Great. And as Ellsworth right at the beginning, and first of all, hello, everybody. Thank you for having me. I'm very pleased to be with the council, so I appreciate the time and the ability to come see you. This Destination Ready program, I think Ellsworth made a very good point. Like, let's think about what those words mean. Destination, ready. And I think the reason that this project came to the top of the mind is Ellsworth has been very clear with communicating up the ladder that, you know, these are some certain issues, and that when Travel Oregon, and to be clear, Brad and I did not come to the council to speak with, there were some people from Travel Oregon who came to talk about maybe some ideas they had for some campaigns or some relationship with the tribe. We are the contractor for Southern Oregon. So we work with Travel Oregon, but just to be clear, that wasn't us doing that. But part of having the destination be ready when tourism wants to start talking about driving destination to small rural areas, particularly with tribal lands involved, there's 2 parts of the readiness. And one is making sure that the boat launch is ready, that the land is being protected, that the resource is being protected. The other part is getting the people ready and for where they are. And I think that we all hear loud and clear, and we respect and we honor, and we want to work with the idea of part of getting people ready to come to Spring Creek and parts of Klamath County is also to help visitors and locals understand where they are and what land they're on, and to take the opportunity to increase their readiness to receive actually more with the experience that we're sharing with them. And so I just wanted to say we're taking the spirit of this Destination Ready pretty seriously. Like Brad said, it's the 10 to 50,000 in cash. If you go through it, Ellsworth, if you can go up, you know, they need to, an applicant, Travel Southern Oregon is probably going to be the fiscal who's doing the applying, just because it's very easy for us. We just work on invoices. And so we are a very easy pass through without taking any admin fee at all. If you, can you go down, Ellsworth? Yeah, and so you know, we're a nonprofit 501c6, and you just keep going down, and I'll keep up with you because I know time is short. They want a description, just sort of the destination description of where this is happening. Clearly up at Collier Memorial State Park, Spring Creek, and Klamath County. Upstream, private landholders. Downstream, more of Collier State Park, but all of it embedded in what is Klamath tribal land. And so there's a cultural, there's a sensitivity to sites all along the place that this is happening. That, and also talking about Chiloquin as a gateway to you know, to Crater Lake National Park, and Ellsworth sees that all the time at the casino and the hotel. I think we're going to change this. The destination needs, I think, initially came in as water recreation. I think we're going to change this to high use and destination critical outdoor rec. The more Brad and I are on the project, the more we just think this is really, this isn't about creating a boat ramp so people can do wonderful trips on the Willamette River. This is dealing with a high use situation. And so that's where we're going to go. And then the actual description of the project, if you keep going down, it's what Aaron said, you know, there's basically 7 parts of what we're proposing and we think the $50,000 can do this. It is the boat launch, the path, the fencing, the signage, and a few other key pieces in there to make this project work. Part of what Travel Oregon's mission, and they are embracing this, is how is this work going to impact, you know, other communities in Oregon, our non-traditional communities, for visitors and in the state. And so I know Aaron is talking a little about, because of State Park thinks about this, access into the water is an issue. And that's something that once we get down to the project design realm, there's ways that could work to make more access to the waterfront be stay within the look and feel of the area. And there's ways that might not. So that's a conversation we will certainly have with you all going forward. And of course, the other piece, as I said before, readiness in this situation has everything to do with the cultural heritage of the space that we're talking about, and creating readiness in locals and visitors to appreciate and respect the place where they are. And then again, the timeline, it has to happen by this summer. That's part of the deal with this funding. Travel Oregon's trying to get a real, it's almost like stimulus spending. Think of it as stimulus destination development projects. And so they're a high priority area. And this project, we came to you because you guys have done so much groundwork. We thought we could catalyze this to happen by this summer before the visitation comes. And so we will remain in contact. This is just a draft, getting feedback from everybody. And then certainly we'll deliver to Ellsworth a final version of that so that the council can certainly look at it. And I welcome any feedback that you all might have, but it has to come by next Monday because we got to turn it in on Tuesday.
So, Bob, I'm going to, I think there was a different version of the document we shared that was updated that I will share with Tribal Council. And I really wanted to let Tribal Council know that when I looked at this, I saw it as something the tribe needed to be involved in, and to get to one of our questions that's actually online as well, as to protect our treaty resources and that tributary, which that tributary is very, very important to the Klamath tribes. The water is pristine. It's as crystal clear as just about anywhere in our territorial boundaries. And the tribes is going to have a lot of input and is one of the key stakeholders on this. And one of the things that I kept asking and keep asking is, how do we limit the number of folks on the water for it to be safe? How do we keep the water as protected? And who is going to be able to do that? And Aaron, I didn't get your email, so I'm going to apologize to council. But Aaron, can you talk about how this is going to kind of be, for a lack of a better term, policed, and making sure that we don't get too many people out, they pack out what they pack in, and basically that they have to be good stewards to the community, and also talk about the actual policing agencies that are going to be frequenting Spring Creek to make sure that folks are abiding by the rules and guidelines up there.
Yeah, thanks. I'm apologizing. Just not able to send with that. I can share a screen and just turn it around and show if I need to. But yeah, we're, as the agency, we've got some enforcement options that are available to us. We have some near projects coming in the future of repaving the Spring Creek parking lot. And I've proposed a considerable amount of options and things to limit the number of parking spaces, which would then limit the amount of folks that could access at any one time. And so it would, in a sense, limit the open freedom for everybody to show up and access to just the folks that we could design our parking lot for. And so with that presentation option, I'm looking at the repavement portion of that to include ADA parking, no parking zone for unloading near the trail access area, trying to get a loop area in there, and maybe even installing some natural wastewater treatment. Think of like a green space in the middle as a turn around the median to take up a few of those spaces, put in some pull-through parking, and definitely add curbs and signage with those things. So with those upgrades that we're currently looking at doing in this next biennium coming up, we can definitely address a lot of the availability. And then with our ordinance and our fee structure, we can enforce the parking for designated sites, not outside the area, and those types of things. So, and then we're also looking at reassigning and actually placing host volunteers, which we often use in our campgrounds and our museum to help with what we have. And so we could task those folks to help get the message, the safety message, the cultural significance, the environmental impacts that we're having. The big one is with some kiosk signage that we're proposing and wanting to allow information on there so we can redirect folks and we can spread the use out. So if they come here and the parking lot's full and we have a specific amount of folks using it, they can use other facilities in the area with the park and the day use here. We can reroute and re-show them to other launch sites and areas so we can help spread that out so that when they come here, they can still be here, but yet it gives that opportunity for designing that area. So we've got a couple areas there. I've been able to talk with the Sheriff's Department and the Marine Board. They are definitely on board to be able to come here to Collier and Spring Creek to do safety inspections, sticker inspections for the invasive species. The Sheriff's Department is committed on being able to come up and help do enforcement on the water. As you know, for the park, our enforcement we can take care of in the park and on the land surrounding it, but not necessarily on the water. So they have been able to join in to help police that effort and and be a resource that's available to us also. So those are a couple of good things, and trying to specifically design our kiosk panels and information with our support for regulatory information, our mapping, our safety information for the water safety, our hazards that's there, the interpretive messages that we want to send about the cultural significance of the area and the past history, and everything that Spring Creek is known for, and all those special cultural sites and areas that we're saving. We don't want to relay what they are and where they are, but just come up with a message to relay that information. And our goal is to help package this so that we can help educate the public on what type of experience they're coming here for. And this is not a party experience. This is not a weekend booze cruise type of a thing. This is something where we want you to come in to enjoy the wildlife, enjoy the nature and the scenery, be respectful, and help educate that with our messaging, with our hosts in here and our signs, or not our signs, but our interpretive message that we can really work together cooperatively with everybody on that. So that's kind of a quick rundown, and our plans for there is designed specifically very small scale. And so portable, small scale, so that it's not that large scale launch ramp. They have some really great options out there for pathways and designs that we can come to specifically set aside where we would like people on the flow of traffic to be. I'm really looking at natural rock slab design implements for the stabilization of the bank, and developing a natural launch cycle that could be the main launch area, and then we could have a portable small launch that we could put in or take out, and it'd be very small, not obtrusive, just enough to get folks and have that availability. And so our goal as State Parks is we want to welcome all members and all abilities to be able to use the parks. And so all of our implements and designs, we want to make ADA accessible. We want to make accessible. We want to think about what the river and the water quality is like. We want to incorporate the restoration areas for the red band trout and help relay that information to the public. So I think this is a whole package that we could design everything to meet that. So did that help a little bit? There might be a couple of questions out there too, but kind of a quick rundown. So any infrastructure implements, looking at things that will match the environment and blend in, not be obtrusive, and defining. So we want to continue to keep that visual impact and that visual statement of what people are coming there for and what historically they've come there for, and then try to tie it in with the restoration of the site and the impacts so that we can mitigate as much of that use and really help design that to have a small scale flow in that area.
So Secretary Frost, and then I saw Vice Chair Hatcher having her hand up.
Just a couple of things. One of them is what would be the ask from the Klamath tribes? Letter of support, we can get to that, what that is. Also, and it kind of came from some stuff that Bob talked about this being a tribal land and acknowledging that. So I hear you're having signage there. It would be nice to have a land acknowledgement statement on some of that signage, so the people that are coming to visit actually know that's land, that's tribal land that they are on, not by ownership anymore, but it is our land.
And those are great points. And I think those are some things that our work group and we've talked about and those are the interpretive messagings. I would want to cooperatively work to get those messages out. So I don't feel that I could develop those myself and interpret that correctly. And so I think that if we can get the structures and things there, I think we can work together and get a really good message together that we want to relay. And this is a foundation to help us get that message out there, because we want to acknowledge and try to relay that information as best we can. And so I think that is that's a great point and a great way to do that.
Vice Chair Hatcher.
Berta asked part of the question that I was going to ask, so I have the answer on that. And then I just want a little more clarity. I was going to ask specifically because I did see it as he was scrolling through the document quickly, some of the things that these grant dollars were going to be used for. And then later I heard a long list of a lot of stuff, and I'm not sure if that's just things that want to be done or if that are items that are part of this grant.
Roberta, the actual state parks is going to do a large majority of the work that Aaron had talked about, specifically for Spring Creek, like the paving and the pathways and the fencing. That's all going to be funds from the state parks that Aaron alluded to in their biennium budget. And there's specifics that the grant would actually pay for, which is kind of some of the improvements that go towards. There's an area that they actually are sliding the kayaks in that's kind of eroding at the bank. That was a huge issue that was brought up of, restoring those riparian areas and making sure that they're preserved. So they want to put a kayak slide in, which is actually, it's slab rock. So it's really natural looking. And I wished we actually had the slide presentation so you could see that. And then some of the other signage that's going to help guide the guests into making sure that they preserve and protect the area. And then the policing and the camp host is going to also be provided by the state parks, hopefully with, well, actually, Aaron says with volunteers. Did I answer those most?
Okay, thanks, Ellsworth. Yes, you did.
There's also a question online from one of our listeners that wants to acknowledge that Crater Lake was used as toilets, basically, and the Fed cannot protect. How can we? Well, I just wanted to let the listeners know that believe it or not, these folks were not actually invited, so to speak. They just were reacting to COVID-19 and trying to get to a place that was outdoors. They just came. They just started using the area. So the group that we kind of put together is to mitigate these things, and these are measures that we're really trying to combat the abuse. We're trying to acknowledge that there was an overuse and provide more trash receptacles, a camp host that can actually keep an eye on how many people are on the water, and so on and so forth. So this is a really good mitigation measure from some funds that are not going to come from the Klamath tribes. And currently, Spring Creek and the state parks are the ones that are cleaning up the messes as of right now. That's not in the water itself. But there is a group, Chiloquin Community Builders, and Kathy Sturr is on the call as well, that I think a lot of the homeowners up in that area have been cleaning it up themselves. So I think I answered the question that had come up from one of our listeners, and I'm sure council has more questions.
Yeah, I just had a few. It sounds like the way to control the amount of folks out there is to reduce the parking lot size and do that. I am concerned about timing also, because certain times of the year there's significant red band trout spawning, and even tribal members exercising their treaty rights there. We want to avoid those conflicts. So well, they're basically, you'll be able to control folks' access to launch. See, I know there's some Forest Service property on there, there's private property on the upper end Forest Service, and then there's the state, but the access is primarily through the state park, right? So it seems like there's an opportunity for the state to pretty much either by limited size of the parking lot or posting the facilities closed during this sensitive season or whatever it is. I was just concerned about how you actually control folks and how that will be done. I'm not sure if folks are going clear up to the old Forest Service campground and putting it up there and coming down, but it seems like they're mostly coming through the park there. And I'm not sure if there's folks accessing through other privately owned pieces up there, but I just wanted to see if my understanding is correct, that it's mainly reducing the parking lot size, and then you can somehow implement seasonal closures, somehow that way. Okay.
Yeah, I think that's good. And a part of the component, and we are doing here at the park, is we've purchased some traffic counters for so that we can have access to the local areas installing that. And then also part of this proposal is to have a gate installed at the parking lot, which that would be our means to help closure. I've talked with Fish and Wildlife, and they've got some seasons and time for the spawning. So for example, we've already committed to doing the closure during the winter spawning sections. And so that would be to the general public for the duration, the gate closed. And then we have other areas and other parks. Specifically, I think of Smith Rock area, where we close a whole bivouac section and park area during the eagle nesting period. And so there are means and ways that we can look at the spawning cycles when they come through. And when I actually talked with Fish and Wildlife yesterday, and some of those cycles come through in May, which is early part of the season. And so those are some things that we are kind of looking at as being able to help control those. And one thing that I failed to mention that we were writing into this is part of this whole proposal is to develop a management plan to help look at those specific ideas of what are we going to work towards on these options, so that we can help manage the fish and wildlife population, the access, and all those things together. And so rolling a new management plan in, which we've kind of committed to cooperatively work together to take input on that, so we can help identify some of those great questions, Don, that you brought up. So thank you. So hopefully that helps as a good portion. So we're having those conversations, and I think we can help include those things. And a couple other things that we're doing in the park here is working with ODF&W for natural habitat and spawning. And I had a slide, we just had got some habitat into Spring Creek this last week from some of the fire damage hazard trees that we were doing. We were able to get into the water, and so I had proposed some options of some of these spawning beds that we've created or they're using. Maybe we can define those with some natural habitat that we can take from the park that we already have to mitigate for hazards, and we can utilize those to strategically screen and separate those use areas to help with those spawning efforts and things. So so we're having some conversations on a wider scale to help do that. And so I think we're just entering into those ideas and some of this plans that we do. If we can incorporate those ideas and plans with any development, repairs, or infrastructure, I think it's a good time to do that. So thank you. Hopefully that helps answer some questions.
Sure. Well, I'm going to try to bring this to a conclusion for the day so we can move on. I see that Joe Dupree's on to meet with us. And I know we've talked about a lot of things that aren't necessarily wrapped into this proposal, right? Or some other things that need to be addressed into the future. And I guess the ask support letter, or you mentioned even the contribution to the Klamath tribes. I'm not sure if we're prepared to make a decision on that today. We'd have to explore what funds are available. But what is the ask so we can figure out how to move forward?
I think the ask would be contribution and planning. And then we know that a couple of folks were kicking in $5,000 kind of match to help go through it here. Those have been a few things coming up if there's a monetary option, but at a minimum support for the project and continued planning and cooperative work towards the direction of this would be great. And so the support would be big, and maybe Brad or Ellsworth or Kathy, if you have anything else to add there.
Well, this is Bob. I do think just in terms of the application, the council, just the willingness to be listed as a partner on the project it has nothing to do with financial contribution, but just to be a partner on this project and be available for the messaging and the stuff that no one else can do, that we need you to help us with. So it's the nuts and bolts are just the willingness to be a partner. We don't even need letters of support. This is so down and dirty that they're not even doing letters of support. There's just a partner sheet. And we certainly would love to list the tribe as a partner. Right now we have Ellsworth as a contact. If that should be someone else, if you're willing to do it, just let us know.
Yeah, I think we can entertain a motion to agree to be a partner on this project, and we'll involve Ellsworth. It's fine, him being the point of contact. I anticipate too that we're going to be running this through our culture and heritage folks and committees, and for some of the language and what's going to be posted out there, and maybe working on the land acknowledgement, but also just making sure that any other natural resource concerns we have. So we can coordinate that internally. And I think that's really the responsibility of those departments anyway. So I don't think we're overcommitting them to anything. So, so I think you can list as a partner, and we'll be engaged at least as much as we have now, and even more.
Thank you so much. And we very much look forward to it.
So would somebody like to pose that motion to be a partner, to be listed as a partner?
Chairman?
Yes.
Chairman?
Yes.
I'm going to abstain. It's not because I'm opposed to what's happening here, but I just feel like there's an internal conversation that needs to happen before I'm ready to formally be part.
Okay. Well, I mean, maybe that's what we can do. If we were to try to pull that off, and this is moving kind of fast. That was just my concern. I'm not sure how to have that internal conversation in. I don't know what are the wishes.
I'm fine actually with that. I will and the tribes doesn't have to be involved. That's why it's in front of the tribes. But if it doesn't get approved, my thinking is, because it's a Travel Oregon thing, is it's probably it's going to be like an all or nothing, and that's not an ultimatum. It's not here nor there, but I think then the tribes is going to have to pull together and really talk to all the governmental agencies on how to police this and who's going to fund it, because the people are already coming, unfortunately, and that's the key piece that I wanted to get involved, because of the areas that I brought pictures to council with the areas that actually had toilet paper and human waste and feces and all those areas, and the garbage that's actually in the waterways. So if it doesn't happen here, I think we need to at least get back together and come up with a way to protect that tributary, because currently it's kind of being done from some of the homeowners, And where it's not on their land and it's in the public lands, the Forest Service isn't doing it. The state park is doing it down below, but up above where the headwaters are, it's not being done whatsoever. And that's the biggest, one of the biggest issues.
Yeah. Member Cockta, then back to Clay there. I saw that you wanted to talk, Clay.
Yeah, Don, I would make a motion to approve being listed as a partner for this project, and any conversation about what our partnership looks like could be taken internally.
Great. So we can entertain a second and still have further conversation, you know, yeah, Clay.
I was just going to say I'm not against the partnership. It's just I think the whole conversation makes me uncomfortable because, you know, we're talking about lots and lots of people, overuse, police. I just, you know, the whole thing makes me feel bad. And I'd like us to be able to talk about how we might have an even more significant role in this whole predicament that we're in. The thought of our members out there exercising treaty rights and coming into conflict with, you know, crowds of people, and then having to depend on law enforcement or non-tribal camp hosts to intervene. It feels like it's all come really fast, and we haven't had a chance to really even have any conversation about it. I'm not against it. I'm grateful for everybody that's gotten it this far, particularly to you, Ellsworth. But I just think I need a little more time to talk it through with the other council members before I'll be ready to say yes.
So just I wanted to add, it seems like this is kind of limited in scope. You know, it doesn't preclude addressing some of those bigger issues that you're talking about when we talk about enforcement and so forth. In other words, the plan hasn't even been developed that we could be a significant part of and contribute to. That's my thinking that makes, because I see those concerns too. I have those very concerns. I even had concerns about putting in too many down trees in the water, because that impacts, I mean, how much that improves habitat for fisheries, I don't know, but tribal members do fish there. It's pretty hard to fish there when you've got a bunch of trees in the water. So, I mean, there's a whole host of issues that I'm hoping that we're going to work through in a planning process. So I'm just looking at I guess the limited scope of what this proposal is about, and don't think it's comprehensive. Yes, Secretary.
I was just going to second the motion.
Okay. So we have a motion and a second to be partners in the project. Any further discussion? Okay, yes, Vice Chair.
Just quickly want to say that I'm going to support this motion, but I understand and I hear where Clay's coming from, and I think that well, I know I am one that is really torn, because I am proud of our area. I'm proud of all of our sources, our cultural sources that are out there, and I'm not a big fan of tourists. I don't. I'm just really torn with that. I know that I can't stop people from coming in, but if there's somebody out there that's willing to try to come up with things that will make things better because they are there, then I'm supportive of that. And I just want to be sure that whatever happens with this grant funding, that the tribes is a big part of it. I don't want us to be left behind. I don't think that this group of people will do that, because we are such a big part, but this one's really tough for me. I just wanted to say that before we voted.
Yeah. Member Powell?
Chairman, I just want to say I pretty much agree with exactly what the Vice Chairwoman had just stated, and I feel like you know, we have to do what we can to protect this land, and I appreciate the work that's being done for the conservation efforts. This land's already available for recreation, and that's part of the problem, is that it's a, you know, already developed area. So if we can do whatever we can to help mitigate some of the overcrowding, and I know all of us were witness to it this last summer, the, you know, extreme amount of tourists that weren't very friendly to the waterways and the land surrounding it. So I want to do what we can and make sure that we are inclusive of our other departments that need to weigh on, and because I think aquatics probably has some input. So I agree with Councilmember Dumont that we need to have an internal discussion. So I'm not sure if we can make a friendly amendment to the motion, how that would, if we can mitigate that for here, or we just need to have the internal conversation. But I will support the motion.
Chairman, before this comes to an end, I want to say that I'm an avid user, especially during spawning season, to gather fish every year traditionally, and that's one of the reasons. And I talked to council about where are the fish, why are the numbers so low, and usually they're up in there by mid-November to the third week in November, and they weren't this year, and they weren't even in there the middle part of December, and they're in there now. But the reason I bring this up is, as a user, treaty rights user of that specific area during the winter spawning season, I really liked and Aaron actually got out in front of this to close that during spawning season and leaving a small parking area for tribal members to actually get in there and access the waters. The last thing that I want to do is get in there and have to get into a confrontation with somebody that's non-tribal while I'm exercising my treaty rights. And I have no problems getting into those real tough conversations while I'm exercising my treaty rights, whether it's with with anybody. So I had those concerns, especially for the tribal members that are using and exercising their treaty rights while they're up there. So I just wanted to add that.
Okay. Secretary, did you have anything in addition?
No, I don't. I'm looking at the clock, so.
Yeah, I am too. So, Aaron, I don't know if you had a brief statement, but we have a motion and a second and in discussion. Yeah, Secretary, if you could conduct the vote, I'd really appreciate that. Thank you.
Gail Hatcher,
Yee.
Clay Dumont,
Abstain.
Willa Palace,
I vote yes.
Ellsworth Lang,
I vote yes.
Jeannie McNair,
Yes.
Jesse Hikata,
Yes.
and I vote yes. Chairman, with your abstention, it'll be 602.
Okay, great. So yeah, 2 abstentions. Yes. Okay, motion carries. Thanks, folks. We look forward to further communication. You know, as you can hear, there's a number of issues we want to bring forward in the process as a partner. So thank you very much.
And thank you for letting us hear the concerns. Thank you.
Thank you, guys.
Yeah, thank you for all your support, and I look forward to continuing working through these other issues, and thank you guys for all that you're doing so far. Thanks.
Great. Thank you, Aaron. Thanks for joining, Kathy. Okay, well, Joe, we're really late. I apologize for that, Joe. Thanks for listening in. I know this is probably one of your concerns too, you know, I mean, you're concerned about all of our tribal issues. So, but thanks for being patient with us. Good to see your face. Look forward to getting an update here. So he's going to give us an update on the research that he's been doing. And Dr. Dupree, I'll turn it over to you.
Yeah, I will share my screen then. Okay, can everyone see everything? Okay.
Yes. Thank you.
So brief introduction. Waklisa Casas is Joseph Dupree. I recently graduated with the PhD in anthropology and linguistics from the University of Arizona. Prior to that, I was working on my master's in Native American linguistics and languages, also at Arizona. So this project's come a long ways, and we've had several pilot projects that have led to this specific series of workshops in 2018, 2019. I'd like to acknowledge Klamath Tribes, American Indian Language Development Institute, Endangered Language Fund, and Fortune Casinos for funding support and also administering those funds, and also additional support from Where Your Keys LLC. And I'll talk a little bit more about them in a moment. So a brief outline of the presentation that will be given today is talking about the research questions, the objectives of the project that had to happen to answer those questions, the research team that was involved in the preparation that went into setting up these workshops, talking about Where Your Keys and the techniques that we tested for portability to our tribal communities, the survey instrument that we used to collect data during the workshop series, the findings from participants' answers in those workshop series, and then next steps suggested by workshop participants. So the questions of this researcher: which tribal community members are interested in participating in tribal language research? We know that lots of people talk about their interest in language. However, being engaged in different parts of language may be different, because participating in language research is different from attending a weekly class, is different from doing the community potlucks that were happening. Then what are tribal community members' language attitudes? So lots of questions that were put in the survey. Is it important for our community to know Mukluk shells? Is it difficult to learn? Should we teach people to speak it that don't know it? And would people be willing to assist in different things like documentation, archiving, or classes? And then Where Your Keys techniques are sets of portable methods, not unlike Robert's Rules of Order, but for language revitalization. And they help kind of keep pace, and they help people stay in immersion longer. And a big part of this workshop series was testing to see if those techniques were something that our community members appreciated when learning language. So to accomplish this, we had to come up with a survey. We had to have the workshops ready to be recorded so that we could go back and look at them. We had to be able to develop the language immersion curricula for 3 days of immersion. We used lots of materials that were both from the 1989 materials that were developed with Noah Rood and the Klamath Tribes, as well as more recently identified sources such as L.T. Hadley, a missionary who elicited language from Modoc prisoners in Oklahoma. So gathering on all those information to help this language immersion, I worked with 5 tribal community members, as well as 2 tribal high school students to work with me and community members to spread out the load of language revitalization. And during the workshop series, each workshop was connected with a specific time of homecoming. For example, the first workshop was held in December 2018 between Christmas and New Year's, because lots of people are home during the winters, and then there's also the New Year's ground dance. There was another one in March near Chwam ceremony, and the last one was during near Restoration Weekend. Tried not to overlap too much, but accidentally landed on Turney, so won't do that again. And each time we had a workshop, we had different people able to speak with the participants. For example, since winter stories are a good time for learning our histories and our traditions, it was a good time to have one of our elders, Betty Blackwell, speak, and also Councilmember Dumont talk about our tribe's history working with NAGPRA and returning our bodies and getting our bodies back from museums such as the Phoebe Hearst. During Chwam ceremony time, we had Mark Buettner and Perry Choctute talk about traditional, historical, and scientific knowledges that we have about Chwam and the health of our water systems. And then during August, we had restoration. And so my mom, Kathy Hill, talked about restoration efforts and how a lot of that happened getting to where we are and where we would like to go. So Where Your Keys is, I mentioned before, a set of methods that I learned as an intern working with them for the Aleutian Pribilof Island Association on Unangam Tunu, or Aleut, and I was assigned to the Eastern Aleut dialect. This was interesting because we were in the city away from the islands where the Aleut's from, focusing on both Eastern and Western dialects, not unlike how we will need to focus on Northern and Southern for Klamath Modoc, as well as understanding Northern Paiute and our distinction from neighboring tribes' language. I thought this was a really useful model for conducting language revitalization research because it's situated to the community that they're in at the time. It's developed with those communities' representatives, and it's action oriented, so you're doing, and the focus is on limiting your meetings and continuing your action. One of the things I thought was really impressive was the time I was working with Warrior Keys is the Aleutian Pribilof Island Association is a corporate entity that works with 13 Aleut tribes. And so some of the villages had sent their own interns to come work on this. And it was a multi-corporation collaboration. And so it was very cool to be a part of, and it was cool to see how tribal representation and authority was in language revitalization in a really effective way. The research team that assisting with this project include Natalie Ball, Douglas Worley, Hannah Schroeder, Aishan Wilson, Lafani Tanya Acer, Redon Weiser, and Paul Wilson. Without everyone's assistance, this could not have been possible. Working with Aisha and Hannah at the high school, and working with the others outside in the community, if it might be in someone's kitchen, it might just be outside of the park. But we were constantly practicing and testing out these immersion curricula that we had developed together. For example, with Aisha and Hannah, we had an independent study at Chiloquin High School, and we decided to keep track of our time as we used these Warrior Keys techniques in immersion to see how long can we stay in immersion. And a big part of that was not necessarily what can we say, but how long can we go without switching languages. And so you can see at first it was a little difficult, a little tricky. We didn't get very much time. But once you get the hang of it and you learn to kind of continue your conversations in circles and pass it around to each other like a conversation does when you visit someone, you can see that the percentage of time in immersion was steadily increasing, and it's a really high rate. Like, it's not very often you see anything more than 50% immersion. And so that was really a good sign that these were working, and we had an opportunity to develop the immersion lessons. In developing both the lessons and the structure, we looked at the American Council on Teaching Foreign Languages oral proficiency interview guidelines. And so the novice low is focused on greeting your peers, introducing yourself to someone, and responding to simple questions. And using the immersion curricula, we have several cards that go with each of these lessons. You see numbered 1 through 10. This is half of what we went through at the workshops. And this number 1 short intro / speed date, this is our milestone. After the 20 lessons, this is the conversation that someone was able to have, or that we can lead towards. And we got to practice these with the team members at tribal gatherings such as the Tribal Youth Summit, I believe that was in 2018, and then the Gamocha Sidewalks Elders Knowledge Gathering held at Chiloquin Junior Senior High School. The surveys that we implemented in the workshops, we had a pre and a post survey. They were both quantitative and qualitative. The quantitative questions focused on demographics, language proficiency, and attitudes using a 1 to 5 scale. That way, in the second set of surveys, we could use the identical questions and see if there was any significant difference between the two. And then at the end of it, there's also space for evaluating the workshop format to see if workshops were even the right way to do it, and also ask for guidance on next steps so that this isn't just off on a tangent before anyone knows what's happening. What we found with the demographics is that we had 42 people come and 37 people completed the second survey. Some people left due to weather, some people had prior commitments, and some people had to simply be home before it could be there for 3 days over the weekend. You can see here, everyone was enrolled tribal member, identified as Indigenous, a majority of 45 or older. I don't know how that correlates with the rest of our communities, but I thought that was interesting. And it's a really cool way for our community to have that intergenerational interaction, especially because we had volunteer instructors such as the high school students, and anyone who was youth could volunteer, but they couldn't be part of the research sample. So another thing to note is that we had diverse education of our participants. 100% of our participants had a high school level education or greater. And that's not something you see very often in Indian community surveys. Generally, this can be a positive experience. Some of the qualitative answers said that nothing should be changed in the style or the method that we're using to teach language. In terms of the time frame, some people have advocated for anywhere from 3 days to 7-day workshops, or all the days, and that's a quote. Something that was fun was the handouts that were described as good, although I did not make any handouts because I was using the immersion method, and volunteers made resource lists to give out to participants. And so those were really cool handouts that weren't at all of the workshops, and that would account for that number. When it comes to language attitudes, there are certain things that were agreed upon, or there was consensus on strongly or somewhat agree, including that it's important for our community to know mukluk shells. It's vital to our identity as people. It's worth saving. It's important for use in governmental and home activities, and it improves our community's well-being. Most people agree that we should work hard to teach the community should work hard to teach mukluk shells to those who don't know it. We should encourage it in workplaces and public gatherings. And many people are willing to assist in classes, archiving, and other programs. The least agreed, less than 60%, is it doesn't matter how it was written. That means about 40 or more people disagree with that. So we're gonna have to have a tough conversation on our writing system and how we want to move forward with that and across our different education venues. A potential contradiction that we have at our current capacity is that not as many people agree that that mukluk shells should be taught in public schools compared with those who believe that language class should be provided for families. However, the recent funding from ANA for the ECDC helps to work with this, and the shift to Zoom also works with this. So that is something that's very fortunate. And as we look to increase our community capacity, we can expand those areas. So brief summary of everything else is that we have a lot of people interested in going. We don't have a lot of non-tribal people coming when we say that it's targeting tribal community members. Literacy is going to be a future research venue. Reading and writing is still very difficult. The immersion method was chosen because it's much easier to experience something that like hisses, scratches, or like something at you before you see letters like CAT in a row. It's a little different when you're able to experience something versus when you're having to try it, pick it up out of a book. And then the where your keys techniques were found to be really valuable. No one reported any negative outcomes from using them. And the null hypothesis of no differences can be rejected because there was a significant interest. The feedback from workshop participants included many areas that I've tried to put into these themes. And I've given examples that have been from the surveys included on the right. And so these are very different areas that we're going to have to think hard about how we expand. And this suggests that we need to work with each of our tribal communities on what their interests are in moving forward with our tribal languages. And just a reminder that this is focused on mukluk shell specifically. And as we move forward, we're going to have to think about how we're going to represent Nima Yadawa as well, because it's important that our communities have access to both. And it's a matter of access. It seems to be the issue right now. So this is a brief summary of what we've been doing, what's been going on, and I'm open for any questions that y'all have.
Don, we can't hear you.
Gail has her hand up.
I was trying to recognize her. I forgot I muted my phone while I was eating. So go ahead, Vice Chair.
Oh, okay. Sorry. I just wanted to say that I was Dr. Dupree's project here, and I really enjoyed it. I felt I really learned a lot from the setup. And even today, even though we haven't been together doing this, I have a lot of what I had learned from him going through my head. And I do that with my own kids now and my grandkids. And it's actually been helping out a lot because of the technique, that technique versus what Ron is doing actually now is really, it's kind of pulling together for me, and it makes a lot of sense. One of the really great things about going through this project with Dr. Dupree is that when we did come together, there was a whole atmosphere within that room. People were there enjoying themselves. They were laughing and really feeling comfortable with each other. You know, I think sometimes there's this we're afraid to try things, and we're afraid to even speak our own language because we're afraid somebody's going to make fun of us or say we're doing it wrong or some kind of criticism. And I never ever felt that during that time. And I can't say enough good things about what I experienced. So I just wanted to put that out there.
Yes, Member Dumont?
Yeah, I also was a regular participant in the workshops, and I want to echo what the vice chair had to say. It might be one of the single best experiences with tribal community I've ever had. I never heard a cross word the whole time. The smiles were everywhere. The way it was set up, the curriculum was set up to provide success in fairly short order. And just to see the pride and the joy on folks' faces when they were able to have, you know, conversations as small and rudimentary as they were was so rewarding. And I just really hope that your future will involve bringing more of that home. And maybe that's a question. I know you have big plans and you want to be an academic and you're going to go off and do amazing things, but what about the future? And how might we add on to the wonderful work that you've already done?
As mentioned in the presentation, everyone's interest in doing a lot of different things for language is part of a challenge because we have had a limited program for a long time, as long as I've been alive. I'm a culture camp kid. Like, I'm a product of learning from Bobby David and Neva Eggsman. And being able to do these things, I think we're gonna have to approach different communities of ours and ask specifically, like, what kind of things they see and align that with our tribe's mission. And so I'm looking at several fellowships to do exactly that, to work with people in Klamath Falls, Eugene, and Portland. And I would like to work with them to develop community vision statements of how they envision language in 10, 25, 30 years. And I think being able to do that would help us start to revamp as a tribe how we want to approach our relations with language. Because we have Klamath, Modoc, and Yahuskin. And with Mukluk Shells alone, that's our tribe, Modoc tribe, and potentially Coors Valley Rancheria if they have Modocs and Klamath there, as well as all the Paiute neighbors that we have. And so part of this, I'm looking at the Ford Foundation Fellowship under mentorship with Scott Delancey. And I've also recently gotten in contact with Tim Thornes, who worked with Mr. Weezer on Paiute. So that's the next step, I believe, and I think it's going to be a lot of asking community members of what they want to see, and when we provide something, ask what was liked and what wasn't, so that we can change it until everything's appreciated. I see a question: is there plans for a language app? I think that there's potential for that down the road. I think that's part of developing our writing system and making it consistent, that we're able to have a platform where we can say search things and have it consistent with a set of words it's associated with. There's several programs that I've looked at that could also support our own, like with our own intellectual property, as in without giving away our stuff to different companies. And one example of that is Miramar. Miramar is a language archiving program developed by Darren McKinney and out at Australia. And they've had really good support in providing free licensing to Indigenous communities to archive and develop their own languages, and have recently developed apps for, I believe, Pomo in California, I believe. And I can send all the information as well. And yeah, so that's my knowledge about apps right now. And I think that we could just be a few years away. I think it's a matter of capacity and putting people in spaces where they can learn and work at the same time.
That's great. Well, any other comments, questions? Yeah, Member Palace?
I guess I'm not really sure like where we're going from here, you know, and I know council, I mean, I don't know anybody that doesn't support reclaiming our languages. I think it's at the point to where it's a state of emergency where we are with the loss of all three of our languages, that we don't have them. And I'm 100% of support for immersion. And I like that last slide you showed about the different, the suggested next steps. And I'm not sure exactly what those mean, but I do see that tribal government's on there. And something that I've talked about, or that, you know, as a council we've talked about, is, you know, having more culture and tradition brought into our governance. And that means like opening our meetings with a traditional prayer in our languages, and, you know, speaking more, answering our phones in our traditional greetings, things like that. Having children's books for the kids with, you know, the basic languages that they need to learn, or the, you know, the colors and numbers, stuff like that. But those could be like children's books. And then having signage. I know we've talked about it a lot today in our meetings today, like just having signage throughout the community. You know, we're kind of hidden in our own community. You drive through this town and you barely see the signage that says this is the tribe, and it's all in English. And, you know, it'd be nice to have big giant signs that have our traditional village names outside of housing and outside of admin. And so I think we're in full support. I'm not sure like where we go from here. I know we're looking at working with Culture and Heritage Committee on the other issues we're dealing with as far as our language department that we're trying to develop. But I don't really know what, I guess I have the same question that Clay asked you, when are you coming home? So, but it's nice to see you, Dr. Dupree, and we're, congratulations on your doctorate.
Thank you. Mosakecha.
Well, my thinking too, I mean, this has been identified in our strategic plans and to culture and heritage and to the tribes. And, you know, we need to put some flesh on the bones or meat and move forward with that and really make it happen. And the tribal council certainly has a significant role in moving that along. I really appreciate the presentation, Joe, and the work that you're doing. And I was glad I was able to stop by the one time, and, you know, I had a good time, and kind of broke the ice for me too. You know, I was participated in some of the past language programs and lost a lot of what I learned, and because I haven't been practicing it very much. But it was really fun, and kind of broke the ice. I was a little bit uncomfortable at first, but, you know, it just feels like we're all in this together, and there was so much support and so much fun and joy around it. It's really just a positive environment. So I really appreciated the limited time I was there. It was just great to see everybody and be a part of that. But thank you for the report, and you know, we will need to follow through with our plans to try to flesh this out, because we know it's important. We got to do something about it. So thank you, Joe. Okay.
Thank you, Joe.
All right. Take care. So Laurel, thanks for being patient with us, Laurel. We have some other business to do here. we're addressing the child care SOP revisions, and I think that's been out for folks to take a look at. Did you want to lead us through that? Are you there, Laurel? It looks like you're muted. There you are.
I am.
So do we need to share the screen, or, I mean, I was just trying to figure out how to, okay. Great, thank you.
Yeah, I was just getting it too. There's some minor changes, not a lot. They were what council had mentioned. The first change, this has already been approved in the past. This is just updates. The very first thing on here is a recommendation from Dr. Larrabee, just some grammar that he wanted changed. The second one is just some grammar, and just the intent is to allow employees to continue working, and just to be a little bit more clear on the intent. The next section is to change the date that you've extended it to. And you wanted us to put a reminder that staff needs to plan for alternate sources because it's a temporary program. So that's in there. The next step is that we were told that it must not be a parent of the children. So that was added. In step 4, we're asking for a copy of the current pay stub, not the timesheet, but the actual pay stub that shows the work hours, because timesheets can be changed, but pay stubs do have accurate information. So that way we can verify that their work hours. One of the changes was that it has to be hours worked at site, not from home. So that'll be important to be able to see that on the timesheet and pay stub. So I'm not sure which way to get this information because that was new, but we do need to be able to know which hours were worked in the office. So if you're working remote, you cannot claim these childcare hours any longer. And then HR still submits to council, to finance, but that was always in there. It's just moved. And then there was a request for an addition that if you're receiving payment, like you're on admin leave, like when the casino was shut down, you can't also be getting paid to watch children because then you're getting paid twice by the tribe. And then false claims will be reported to the general managers.
Okay. With office hours, time at home, that's basically going to be the responsibility of the supervisor to make sure that's documented, or is there a form for that, or any suggestions on how to document that?
Well, the timesheets have been changed, so they will show that. I'm not sure how they're going to record it in finance. But if you're working from home, you're supposed to have a telework schedule. And so we should have that, but not everybody's turning them into HR. So that's one questionable place that I'm not sure how to monitor across the board, whether they're in the office.
Mm-hmm.
That's a kind of a trust thing again.
So,
yeah. Yes, Secretary.
And I know it works different for each of our entities, but here at administration, you're like in the verification process, and you don't necessarily verify if it's a member of the household or anything, as long as it's not the parent, then we would pay that to the employee.
Yes, in the past, I wasn't verifying any of that, but I was asked to put not a parent.
Okay, So the other entities would be, we're not gonna say, well, you're letting so-and-so utilize, I don't know, maybe a older sibling or something like that. All they have to do right now is verify that it's not a parent. We're not gonna hold them. We're trusting the employee to give us the information, and we're giving the okay for whoever is verifying it. You know, we're not gonna hold them accountable if they're not doing a search, I guess, is what I'm trying to get across.
Yeah, we don't have the manpower to go police this. The most we can really police is whether they've actually worked those hours.
No.
It's kind of a trust factor with our staff, and that they're not using other employees, you know, they're on leave and then getting paid by the tribe twice. We can't have that.
Can we cross-check that, Laurel? I mean, do we have any way that we could cross-check that? By we're paying for this person, can we send that name to the other entities to make sure that they're not one of the employees that are off of work, that we're paying for to be off of work? Or is that just too much of a lift?
I'm not sure how to get all that information. We're winding down on this. I'd like to be able to trust our employees to follow the rules, but I did have to deny a couple.
Okay.
But most are following the rules, I have to say.
Okay, thank you.
So this.
Jesse has her hand up.
I can say the edits seem to capture what we talked about, the council, and then some. Are folks comfortable with accepting the changes and moving on, or is there a need for clarification or additional edit?
Jesse had her hand.
Well, yeah, go ahead, Jesse.
This is Jesse, and you know, as I'm reading through this document, I appreciate some of the changes that have been made and wish that this was something that had been done before. And I have the same concerns that Roberta just voiced, and if this program continued any longer, you know, it isn't going to be utilized much longer. But if it were to, I'd certainly want to find a way to cross-reference. I think it's really important. This was one of the questions that I had when it was presented to us in the very beginning about how we were going to hold employees accountable. And, you know, people are going to take advantage of programs in any way that they can, find ways around red tape, which is unfortunate because this is meant to help. But I'm also thinking that now that this particularly was put into place, if I recall, because schools, there was a lot of really ambiguous about whether they were going to be open, how long they were going to be closed. Some of our employees weren't able to come to work because they had children at home that were doing online learning, and then also our own preschool or daycare center was also closed, which was creating a conflict with our tribal health employees and the wellness staff. So I'm thinking that we can expect, with the schools now being open, for this program to be less utilized as it was before, as well as with some of these new disclaimers of, if you're an employee of the tribes and you're getting paid to work remotely, or you're getting paid for some sort of leave, you will not also additionally be getting paid to be a child care provider from the tribes. So I think it's great. I love the additions, and I still have some of the concerns that Roberta had mentioned, but since it's something that is temporary and may not go any further than the 31st of March or the end of March, and I guess I can hold all of my concerns for if we were to extend it.
Admin hasn't paid any since December. We stayed within our budget. We haven't paid any. the casino being closed, they have limited use. The truck stop and has less employees, so they've used a little, and some of their concerns were added to this. Health has about twice as much being spent as we do. I believe they're checking the same way. I know the casino checks their time clocks. I don't really have a good way to check other than good faith on whether they were actually in the office at this time, though.
I don't know how strong we want to get, hearing some of the concerns. I don't know if there's a statement that could be made. I see down at the bottom, it says false claims will be denied and reported to the general manager. So what does the general manager do with that? Would it be, though we're trusting folks, but if somebody does blatantly abuse this and it's found out about, wouldn't they be subjected to appropriate disciplinary action according to policy or something like that?
The receipt
I don't
says,
know if-
the receipt does say that. If they turn in a receipt, they can be subject to disciplinary action. However, I can't do disciplinary action on anybody but Sarah, so I don't have much say over that.
So,
Chairman,
that's what I'm asking. Yes. Go ahead, Mr. Lopez.
my apologies. Absolutely. I mean, I understand Laurel supervises Sarah, but under my supervision, I would expect that if anybody is following, I mean, there's a kind of a line there, Chairman. I mean, if it's what I would consider nefarious behavior where they're really trying to, I mean, call it a spade, steal from the tribes, they'd be subject to termination, in my opinion. That's not happening. I mean, I think what we've experienced, Laurel may correct me, is people that may have a little bit of confusion of how to submit the paperwork, or confusion of how it applies, or confusion of who's eligible. But I've not experienced, or at least I've not been made aware over this time of the program of someone actually behaving in a nefarious behavior or in a nefarious way where they're actually have a criminal intent to steal. That's not happened, but I am confident that Laurel would notify me if that were the case, and that would obviously be a very serious infraction personnel-wise.
So the statement as it is okay. We report it to you, and then of course you'd really consider, how if it's nefarious and subject to policy discipline, right? So in other words, that last statement is okay the way that it is.
I believe so. I believe so, Chairman. Thank you.
Chairman?
Okay. Yes.
So prior to the establishment of this program, a survey had went out to the staff assessing their childcare needs. And I think that's how we developed this program, was because the need was so strong. Would it be possible to send out a secondary survey to see where that need is now, and has it decreased since school's gone back in session and people are adapting to the pandemic lifestyle, I guess we'd say? I mean, I just would like to see if the need is as high as it was back then.
I think that'd be valuable in us determining how far to extend the program and how long, perhaps. I was just reading that. So
I would recommend it. I wouldn't extend this past March, because by then the schools should be full-time, or else you have figured out how to do it by then. We do also provide the extra money to our employees for childcare to pay on their own if they choose to use those funds that way. So I think we're through the worst of it. We've had the chance to get shots for our employees. They can be protected. I think it's, should be winding down on these support programs.
Chairman, I agree with Laurel on that. I'm not in any way advocating to extend the program, but I do think it would be interesting to see where the childcare numbers are, because as in the chat box, Mr. Lopez put that childcare is an issue, and that's something we all know is that, especially here in Chiloquin, there's very few childcare providers, and so that's something we could consider in our long-term planning on, you know, if we're gonna, I guess, you know, look at other childcare options in the long term, not necessarily an emergency program like what we have now, but like increasing like childcare facilities, things like that in the long-term strategy. That's why I was asking about the survey.
Okay. Member Akaka?
Yeah, I think that's a good idea to just look at our numbers. And now in March, since we'll be about a year into the response to the pandemic, and since announcing our kind of state of emergency, it would be nice to see where we're at within a year. And just as Willis stated and George had noted, that individuals may be struggling even outside of a pandemic. But just to add a comment to that about long-term, at Tribal Health, with there are some additional funds, and you can decide where to put that. Some put it into their cafeteria accounts to help pay for some additional medical expenses, or others have used it for childcare. So I don't know if that's the same for administration or any of the other entities, but I know that is an option to help people who work for Tribal Health, at least.
Health and administration and GRC have that. The truck stop and the casino do not.
Chairman?
Yes.
Yeah, you know, I think the survey that the staff had done throughout all the entities really showed the need and was helping define some of the issues. And I think this has been, for the most part, a successful program. And as I'm reading through some of the comments, there's folks that are stating that they're very grateful. And I guess I didn't, appreciative, excuse me. They're very appreciative of a lot of the programs that we were able to utilize with the staff members that are out there. So with that said, I do think that we need to make sure that all the entities are looking at this the same. When I say this, I don't know that everyone has been as equitable as administration, or maybe treated the same, the staff members treated the same at the casino and or health or the travel center. And you know, there's a lot of chatter out there, and you gotta listen to all of it, whether you want to or not. And some of the entities staff is stating that they weren't getting paid, or they had to stay home because, you know, they weren't getting some of the same benefits. And I just think that we need to be aware of that. Equitable behavior from all of our properties and our agencies, our businesses need to be looked at. And it's unfortunate that some people aren't as forthright, honest than others are, and it kind of ruins the thought on some of the programs. And looking at some of the comments on social media, as well as what people are talking about from one business to the next, or from health to admin, is unfortunate. But it sure looks like a lot of the comments have been positive from the last meeting that we had with the live feed and this one. So I think we've done a pretty good job. There's always going to be those that abuse it, and that's unfortunate. And that's why there's revisions to programs like this. And I want to thank Laurel for taking the notes and instituting them here. I think all of the changes that we talked about are instituted here. So great job, Laurel.
What I would like to do is, when we wind down from this, because of course we're paying for this with CARES money, is what Will has said, find a way to have some child care in the community that doesn't just benefit our employees, but employees that work everywhere. Tribal people need care even if they're not working for us. So I think we should look at, you know, we have the little school, but we might need to find an actual daycare way to help with daycare more. That's affects our people a lot. And we have people that can't work because they don't have a place to put their kids that want to work for us and can't. But we have to remember these CARES funds are going away, and we need to come up with a plan for taking care of not just our employees, but all tribal members.
Mhm. So I hear two issues.
Chairman?
One is the policies that we want to move forward with, and then there certainly is interested in looking at childcare overall and doing an assessment, and maybe that'll culminate in a childcare facility and or project or whatever. So to bring us back, I'd like to get through this, and then we can make a decision on whether to move forward with the survey and address something specific on the childcare. Are folks comfortable with the edits that we're looking at here? It seems like it's captured everything that we brought forth from the council level. Any recommended changes or needed edits that aren't here? And if folks are comfortable
Chairman,
with this,
I don't know if you can see us or not.
I can't
I don't
see
know if you can
everybody.
see us or not. I want to thank Laurel. I'd like to thank Laurel and call the question. I'd like to make a motion to accept the changes as presented.
Great, thank you. So motion by Member Dumont. Is there a second? And I can't see everybody. So, okay,
Chairman,
Member
this
Lang, I
Ellsworth,
see you.
I'll second that motion.
Okay. So does anybody else have a comment or anything? If not, Secretary, please conduct the vote.
Gail Hatcher,
E.
Clay Dumont,
E.
Willa Powlis,
I vote yes.
Ellsworth Lang,
Yes.
Jeannie McNair,
Yes.
Jesse Hikokta,
Yes.
I vote E. Chairman, with your abstention, the count is 701.
Okay, great. The motion carries. Now, as far as the child care and the survey, I mean, I think it's good to do the survey and get the information. We could direct our general managers to conduct that. Or, I mean, how did we do it actually last time?
Chairman?
Yes.
I believe our emergency manager, Zach, was the one who conducted the original survey. So we'd have to talk to Mr. Lopez, and I don't know that Zach would have to conduct it because I imagine he's pretty busy, but at least get the information that he had.
So GM Lopez, could you take a note, and we'll follow up on this, you know, either through email or do you have a recommendation on how to conduct the survey so we can just handle it now?
Chairman, what I would ask for is clarity on exactly what information we're seeking, because I can tell you there's a need for childcare. Survey or no,
Yeah.
100% there's a need
Yeah.
for childcare in Chiloquin. So my concern is doing a survey, well, not the survey. I don't want to put hope in employees thinking that what we're doing is setting up a child care center and we're ready to go. So I would like a little bit of more of a conversation, maybe not right now, and we can do it via email or in a supervision or work session. But exactly what are we trying to get at? Are we trying to get at, you know, because I can tell you there's a need.
Yeah.
I don't need a survey for that, but if you want a survey, I'd like more detail on what we're trying to gather.
Chairman, I think Laurel captured it in her last comment, is that it's not just employees, you know, but our tribal community and the community at large. There's a lack of childcare in the Chiloquin area, but there's also a lack of affordable childcare for tribal members. So, I mean, I would propose, you know, that we look at, if we're going to look at a long-term strategy, that we do a survey that's open to more people than just employees. And we would have to indicate that this does not mean we're providing childcare. We're trying to assess the needs. We can have a documented need, because you have to have a documented need if you're going to start seeking funding or start looking at answers to that, how we can fix that issue.
Okay, so your suggestion, I think, either a supervision or upcoming work session will probably a work session would be a little bit more effective. Of course, I know we have a number of meetings, but it'll be a while before we have another one with you. So a work session would probably be better.
if
Yes.
I may, Chairman, I would appreciate that, and I would like, and maybe, I would like to bring staff, not just me, but maybe Laurel and maybe some other folks that might have some expert views on the need, maybe some parents that work for us. What is the need and what would help the most? Because I think it would be fabulous if we were able to develop a child care center for the community, as Councilmember Powell says. And if it is a community survey, I don't want to lean that on Zach so much, because that's a little bit more of a heavy lift than an employee survey. An employee survey we can do via email. A community survey takes a little bit more work.
Yeah. And I'm not sure if we need to involve our other GMs, in this too. It seems like that's a logical thing to do if we're talking about comprehensive approach to this. Connecting with the other GMs, I think to invite them to be a part of this too would be a help. Okay. All right. Well, thank you, Laurel. Really appreciate that, General Manager Lopez. So let's move on. I think next we have the reports from Kathy on the CARES and George.
Is Kathy in the waiting room as secretary? You're on mute.
Haven't seen her.
Okay, let me give her a quick ring, okay?
Yeah. Remember the email communication this morning that we want to address, but I haven't been able to go back to the emails and look at it again, so I'll have to have some clarity on what we need to address there. And some of it was with Joseph, right? He was included in the emails, or is that a different topic? Okay.
Chairman, just needs a minute. I need to send her the Zoom link and she'll be right on.
Okay, great. Thanks very much.
And Ms. Secretary, I sent that report, I want to say yesterday or this morning. I can't even remember when I sent the report, but I'm hoping that council had a chance to at least, or maybe we could share the screen and look at that. But the COVID, what we're talking about is the COVID emergency assistance statistical report. And that was sent out, I believe last night or maybe early this morning.
Yeah. I saw it and saved it on my desktop, but I didn't get a chance to look at it. So it will be best to share it on the screen and walk through a little bit, because I'm not sure if others are like me and couldn't get to the email to. Yeah, and then the folks, I really, when we screen share, I can't see everybody, so feel free to localize your interest in being recognized. So thank you.
So Chairman, were you talking about the other employee programs?
Yes, that string of email communication.
Okay.
So we're just waiting for Kathy to come on, right?
Yeah.
I don't know what happened at lunch. I clicked on, tried to actually get on a couple times. It kept saying the host will let me in, and nothing happened.
Chairman, while we have a sort of a pause.
Yes.
Unfortunately, there's an email that was sent out by Misty acknowledging another tribal member that passed away. And,
Oh gosh.
not by name, you know, not releasing anything, but wanted us to get out ahead of the county releasing that information. And I think they may have already released that, the county, as far as this person's passing. Of course, they don't identify them as well. But she wanted to know if the council wanted to release the statement. It came out from her just around 2:57.
Okay, I'll look for that really quick here. Gosh. Okay.
She should be coming in the waiting room anytime, the secretary.
Okay.
I can talk to her.
Okay. We could talk about this during my report, but she wanted it to get out soon. Is that what the
Well,
concern
just
was?
so we take an action today, I guess.
Mhm. Okay, if maybe since we're online with this, under my report, let's add this to my report.
Okay.
If folks are comfortable. Thank you.
Jesse, what email do you want me to send that to? Is it still not coming through on your other email?
Oh, you can send it to my jessie.hikokta@healthyklamath.org.
Well, thanks for joining, Kathy. I think you're on here, correct? Well, I don't see her yet.
Jared's in the waiting room. That might be her with the phone number.
Is that you on the phone, the 1070, Kathy?
And *6 to unmute. If you.
Hello there.
Yep.
Hi, Kathy. How are you today?
Can you hear me?
Yes, we can.
Okay. I didn't know I was on the agenda. Oh, my apologies.
Okay. Oh, sorry about that. Okay, so if you could lead us through this, that would be great. We wanted to, consider all the
So
information.
is it for the progress reports?
Yes.
Okay. So we'll go through COVID-19 Emergency Assistance Program progress report for the period of January 8th through the 22nd. And that is the first program, and it should have a green border.
Yes.
Okay.
We're looking at it.
We have a total of 3,146 applications received. That's been an increase of 5 since the last report. 10 are pending due to not being enrolled at this time with the Klamath Tribes. Total applications processed, 3,142. 90 of those households were with COVID-19, had the impacts of COVID-19. Klamath County, there's a total of 1,399 applications received. A total of 1,747 applications received for those tribal members living outside of Klamath County. total award amount is $5,542,649.89, which is an increase of $10,500 from the last report. The request for assistance is the same as the last report. There's been no change, with the percentages being 23% the need for food, 23% for personal hygiene, 23% for cleaning products and supplies, 11% have a need for rent or housing assistance, 10% for utilities or heating assistance, 7% remote learning, 3% medication. And still at this time, as applications are received, and then once they're verified for eligibility, then they're processed that same day. Tribal members who have been assisted so far, the total, we have 5,645 tribal members. 4,200 have been served this first program, which is 74%. Adults, 3,254, minors, 946. Now in this first program, these totals are gathered manually. We had to go back, so it's still manually. We could be off a few, but again, it's manually counted. Incarcerated tribal members, we have a total in our progeny database of 110. We have processed a total of 107 in the first program. Any questions on the first program?
I don't see any. Thank you.
Okay, and let me close out of that one, and we will pull second program. Second program has a purple heading. It's titled COVID-19 General Welfare Emergency Assistance Program, second program. The progress report is for the period of January 8th through the 22nd of 2021. Total applications received is 3,500, which is an increase of 20 from the last report. We have 12 applications pending due to those applicants not being enrolled with the Klamath Tribes at this time.
Kathy,
Total application.
would those include the 10 from the last?
Yes.
I mean, are they duplicate? Okay.
So yes, the first and second program, there are some that are, there's 2 applications sitting there.
Okay.
Is that what you meant?
Yeah.
Yes. They've applied for both programs.
Okay.
Total applications processed, 3,500. That's an increase of 20. With those applications coming from Klamath County in the total of 1,492. 2008 are applications received from our tribal members living outside of Klamath County. The total award amount is $6,006,500. That's an increase of $64,000 from the last report. We break this down into the areas of enrolled adults is $5,202,000. Enrolled minors is $448,000. Enrolled minors in care is $146,500. COVID-19 awards, $207,000, and job loss, $3,000. And associated charts are in that matrix for the second program, which is attached. Requests for assistance also remained the same from the last reporting, with the associated percentages to those areas of need of our tribal members and how they've been impacted by COVID. Do you want me to read those percentages? Or are you good with that?
I think we're okay. We could skip
Okay.
over there. Thank you.
Tribal members who have been assisted, again, we have a total of 5,645 tribal members. We have served 4,590 out of this program, which is 81%. Adults, we have 3,565, and minors, 1,025. Incarcerated tribal members, we have again identified in our progeny database 110, and we have processed 97 applications, which you'll see a large increase from the last reporting. And what we've done is I had the caseworkers go back and identify from the list from progeny to their names on our matrix system. And what we found was that there was different addresses used rather than going through the central trust office, DOC office. They were using family addresses for different reasons.
Yeah.
So what we did was we cross-reference, identified those, added those into our matrix, and we are retaining that information. And as we still move through the program, we will be tracking those that have been released and then providing that information back to member benefits so that they can reach out to those tribal members, confirm the release, and then make changes to their database.
Okay.
Along with the incarcerated, I'm sorry, my emails keep going off. The 7 that are remaining that we have not processed, individual applications have been mailed to them.
Kathy, and this is George, Chairman. I'm sorry to interrupt the meeting. I wanted to make sure that the council was aware that Kathy worked very closely with our social services department, and they made sure that every foster child that's a tribal member had an opportunity to get this funding as well. So I'm really excited about that.
Mm-hmm. Yeah, so our case managers, they cross-referenced a list provided to us from the Social Services Department, and then we provided the information whether or not the child had been claimed on any application or not, and then we returned that information back to Social Services so that they could provide outreach.
Oh, that's great.
We just have an awesome staff. I just cannot say enough about them. So.
Yeah, that's wonderful. Great job. You know, I do, every time I see that we haven't served all of our members, you know, I wonder why. Do we have a feel for folks that just feel they don't need the service, or do you think there's they don't understand if the opportunity's there? And I'm kind of relating on. It seems like if everybody applied, we, you know, I'm just trying to consider that in the context of the remaining funds that we have. But do you expect an increase? Do you know why folks, not all the folks have applied, or do you expect any kind of increase in applications?
I'm not sure, but I know that upon your legal review that you've obtained regarding taxation, that possibly once you send your notice out to the tribal membership, that might help with, I know that, I don't know the exact numbers, but I do know that we've received questions regarding concerns for having to count this as income, this amount. And so I believe if we get notice out to tribal members, that might help. I'm not sure about that was one of my questions I was going to ask, was the Social Security. That was on top of counting that as income. There was questions regarding those that receive Social Security income, and there's a certain amount that they can't go over. So I don't know if that's a different office, that if once that notice goes out, if that applies to Social Security also, because I had heard that they applied one time, the first one out of one of the programs, because they were just really concerned about going over that threshold.
Chairman, if I may.
Yeah.
Yeah, I do know somebody that had received some money into their account and it affected them very heavily. There was, and with no slight exaggeration, it was SSI disability and they were audited.
Mhm.
Much money on their account, and now that they are forced to pay back a bunch of money and their benefits were cut down to just a few $100s a month. And if that's the case, I would bet you that they would be very, very gun shy. I mean, this is it's actually absurd. It's unbelievable.
Yeah, it is. And we did. I know I personally received a handful of concerns, and they were having to make a difficult decision on if they were going to even apply or not, or if they were only going to apply for one of the programs because they were going to calculate that amount that they couldn't go over. So I don't know if that's an additional legal question for our legal team, or if there's anything that can even be done about that with the Social Security office.
Kathy, I think legal would just need to clarify it because the general welfare exclusion applies to anything. So it's not considered income for any program, but I would just need, we would just need the tax attorneys to verify that and clarify that for us. But that should be, it's clearly written into the GWE. And anybody
And with that,
should understand that.
okay.
Like if they have an accountant or a tax person helping them with their taxes, they should be able to have that. And I think if we provided that letter, that would be considered documentation.
Yes, and we can also, I think would be beneficial is we'll make available our policy for them, and both policies, the general welfare policy and then also the program policy, and then that letter. And I think that there might be more people that would apply if they felt more comfortable that they weren't going to have to count that as income.
Yeah. Member Acosta?
Yeah, I just, what a terrible oversight for us as we were putting this together, because it is really unfortunate that this has happened to individuals and that there is this concern. We made some additional efforts to forego, getting child support taken out so that individuals could have this assistance, and of course thinking about it as far as not having taxes, and those who are in the who are tucked away, say in the prison system right now, are, we work to try and get them the full benefits, and this was just one of those oversights. And if there's anything that we can do, even though these funds aren't around for that much longer, to help mitigate this and ease some of these concerns, and I don't know that any wrongs could be righted at this point in time, but I think that we need to look into it.
Well, what we could do also is our COVID case managers will be sending out masks to our tribal elders. And what we could do is send the policy and the letter, the support letter from the council, with those. And so they should be getting those within 2 weeks once we start mailing those out. And that still gives them a couple months to get, make a decision on whether they would want to apply or not for our programs.
And we do have the policy in place. I know the recommendation is to have that in an ordinance instead, because the ordinance is stronger, but that would have to go through general counsel. So that's why we adopted the policy. But the policy is just as good because it's still considered tribal law. And that was the attorneys speaking, not me. So I think we're okay. I just think it's a matter of easing our tribal members' concerns and then having that documentation for whoever's questioning it. But if they have a program they're on, or somebody is questioning that, they probably need to call, and talk to somebody here, because it might not, if the letter doesn't help, I mean, there's probably someone they could call here to verify what the tribal member is stating. I think it's mostly, I think the concern is going to be with our self-employed tribal members that have to show their income and revenue through their banks. And if they deposited that money into their checking account, they're going to have to account for where that money came from. So those are the people that I've heard from that had concerns. So, but as long as their accountant or their whoever's preparing their taxes for them has that documentation, I'm thinking it would be okay.
Yeah, I mean, there's a concern about the taxation, but then there's also the concern about the benefits, you know. I mean, I thought the our general welfare exclusion, it's supposed to cover that, right? Because there's no 1099 income. It's not considered income. So if there's a need to rectify a problem, first of all, I want to make sure that we need some clarity from our attorneys on that, you know, because the letter does say something. I mean, I signed it today. But I'm just wondering if it really covers that part of it, you know, as far as additional income for various programs. I don't know how far that extends. It's not taxable income, but I mean, so I mean, do we have clarity on that? Do we understand how that works?
I think it would be good to get a statement from legal that it wouldn't affect like Social Security or disability benefits.
Yeah. So we should, we'll engage with Ed, I guess, you know, and go to him and get some clarity on that. And Ellsworth, you know, I am troubled. I mean, you're aware of somebody who had a pretty negative impact. You know, we want to see what we can do to help. I'm not sure what we can, you know, do, but you know, if it's wants to get some clarification on this, we could work with get them the information, and I guess the process, if it's Social Security, they'd have to go back to SSI and make a complaint and say, hey, this isn't appropriate, give me my money back, and provide all the service benefits.
I actually read the letter because it sounded, you know, like somebody just didn't understand it quickly. So I read the letter pretty thoroughly, and it's pretty unbelievable that what they can actually do to you. Almost cut them off completely on their benefits, and it was crazy. It's actually really sad for this person because they are tribal and they're very stuck in their ways, and you can't tell tribal women anything, can you, Berta? I said that because you said that earlier, so I just kind of
Be careful there,
basically what I'm talking about, because we've all dealt with elders and trying to be as respectful as possible, and you just gotta cut that tie and don't try to say no, we should do this or that. You just try to help massage the situation. And George, I did see your comment.
Yeah. Okay. Well, thanks so much for this report. It's good, helpful information for us to.
My financial professional reviewed the shield level and
considering down the road here. So I do. Excuse me.
I was going to check too. Do you guys want us to mail out the policies, both the program policy and the general welfare policy, and then that statement with those face masks?
I think that's a great idea. General Manager Lopez.
Chairman, I would suggest, I just sent a quick chat to Ellsworth, but I would really like to be able to really drill down on the Social Security question. And it might be helpful to do that before sending out the letter, to include that information, because that's the most vulnerable of your tribal members.
Yes.
To me, it's extremely important that we get accurate information. And Kathy, we may be able to also reach out to our Social Security liaison, who is someone we've worked with for at least 3 years. And I'm sure she would be helpful in trying to figure out what Social Security would say. Because my concern is that one thing is what the attorney says, another thing is what Social Security says. So I would like to kind of do both and gather that information, Chairman, and send a letter with all the information that we can gather to benefit the tribal members.
That's great. I signed the letter today, so if we need to tweak it or modify it to provide additional clarity, we can. I'm not sure if it's going to move it out.
Well, that was on taxes, and this is a little bit different question.
Yes.
So
Yeah, it is. I didn't know if you were talking about, George, sending a letter that was with all of that, or just an additional letter.
Well, either way, Chairman, I just think that it should be inclusive of all the information we can gather, you know, on taxes, on Social Security. Does it impact any kind of benefits for SNAP? We've not talked about SNAP. We've not talked about TANF, but I really think we need to really figure out how it's going to impact your tribal members, because it could be a negative impact as Ellsworth. I'm really sad to hear that that happened to a tribal elder. It would be really nice, Ellsworth, I don't need the name, but at least get a copy of the letter they received so that we can use that as kind of a, you know, evidence of what Social Security is actually saying.
Yeah, I dropped you a chat, and it's unfortunate I didn't take a picture of it. And now if I ask to see it again, it's going to be very suspicious. And I will tell you, I've been almost picked up by my ear from some tribal elders, and I'm too big to be picking up by my ear nowadays.
Well, and then I just want to stand on the record. I don't agree with Ellsworth's comment on Klamath women. I'm just saying.
Yeah.
I don't think
Way
I
to
said
cover
Klamath.
it.
Maybe I did say Klamath.
Chairman?
Member Palace?
Yes, I
Yeah.
just have one more recommendation. If we're going to send that out, I was thinking maybe we could just do like a one-page FAQ, because sometimes the policy is a little, you know, unless you know exactly what you're looking for, you can have the specific questions like, is this going to affect my Social Security or disability? Is this going to affect my eligibility for SNAP or commodities? And then you can answer that question like in a paragraph saying, no, it doesn't, because the Tribal General Welfare Exclusion Act, you know, excludes this as income. So you know what I'm saying? Like we can just do a quick little FAQ and include that with the mail out, and I can help draft that if needed.
Nice. And then maybe on the bottom of that, the only reason I said that was because there was some wanting a copy of it so that they could provide it to the agency and their tax preparer.
I think that would be good. And then the FAQ would be more to help, you know, for especially elders to, you know, if they have those specific questions that they're going to ask.
Yes. Yeah. And then we could put on the bottom, you know, if they want a full copy or need a full copy, then they can request it.
Great.
Sounds good.
Awesome. Okay. Sounds good.
Thank you, Kathy, for the help on that. Really appreciate that. And an awesome job, of course, you folks have been doing. Appreciate it.
Okay. Yes. And so what we'll do is we'll hold off on mailing those face masks out until we get some documents to put in there. Okay.
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 Thank you.
Any other questions?
I don't see any others, so thank you.
Okay. And I thank my staff. I've mentioned them over and over, the COVID-19 staff, the member benefits staff, finance. They just do an awesome job. So, and thank you, Tribal Council.
Yeah. Okay, I'm looking at the agenda. I know we can move that other item that we talked about, the email communication, the other programs. Let's do that since we've got some folks on. We've got staff, Michelle here, and some folks here online. I see Nicole's on, I'm assuming, for the last item on the agenda there, the tribal attendance practices. So let's move forward with those things and bump those other items down, that other item down. So Michelle, if you'd like to lead us through. Thanks for joining us today.
Hi, guys.
Hello.
I'm just trying. I think that Jared's going to take over first.
Oh, yeah.
Okay.
I know just enough to be dangerous with this this program right now at this point, but the only thing is it's a new funding agreement, state funding agreement, and it's the STIF, which is, I do know it's called the Statewide Transportation Improvement Fund, and it was passed with House Bill 2017, and apparently we're a qualified entity as a tribe to receive funding for this. So I had no work in this doing the plan, so I'm going to turn it over to Michelle to walk you guys through it.
Thank you, Jared. I just spaced the changes there. So I thought you were just looking in on us. No, thank you.
Okay, I'm just gonna go ahead and read the kind of a description of it, and then we can go through each project. Is that gonna be okay with you guys?
I think that'll work.
Okay. Okay, so the STIF formula funding is a new grant to the Klamath Tribes Transit Program. The STIF funds are appropriated to finance investments in public transportation services, and priority will be given to plans that improve or expand services. STIF may be used for public transportation purposes to support the effective planning, deployment, operations, and administration of public transportation programs, including but not limited to the following. Creation of new systems and services with origins, destination, I actually spelled stuff wrong, or stops in Oregon, maintenance or continuations assistance systems and services in certain circumstances, and planning for the development of a local plan or future STIF plan to improve public transportation service. With the STIF funds, we will have 5 projects that are lined out in the plan itself. 4 out of the 5 projects are to improve Klamath Tribes Transit Program. The 5th project is for capital and matching funds for future ODOT grants. This project will be going from July 1st, 2021 to June 30th, 2023. These have been funds that have been kind of building up since I think it was 2000 and I want to say 18. Correct me if I'm wrong, but I think it was 2018, which brings that all those funds, because they were kind of adding up each year. And so we finally got to get on board since we got our, how would you put it, Transit Advisory Committee finally put together. We were able to put this through. And so now the total funds for this funding year is going to be a total of $450,000. After the 2 years are up, then it will go down to 200,000. We will get 100,000 per year. Most of the grants now, since the COVID went through, we can actually do anything that can maintain our services under this grant, because they know that the transit community took a pretty good hit with funding and stuff. Even though they've thrown funds our way, we've also had an increase of supplies and everything that we've had to purchase. So that's kind of where we're at, is we will be getting, it's a $450,000. These funds are not billed down, they're actual direct dollars that come straight to us, and I think they do them quarterly. So each quarter we'll get a certain amount of money. Of course, I'll have to report on them on my the APRs, which are they're kind of like a quarterly report to the ODOT. There are no match requirements, and the full indirect can be applied to this funding. Okay, so project 1, I don't know if you guys have the stuff to go with me. If you have any questions, just holler at me and we'll stop, because it kind of gets confusing if we bounce around this big full thing of 28 pages. So the first project that I have is for a total of $95,000. It is to increase our transit staff wages, to increase that. And if we have any kind of funding left after that 95,000, we would also be trying to do a little bit of like a kind of what we did here at the tribe with the COVID funding. We would be able to push these wages up just a tad bit, since these drivers are out in the public with people constantly. And so we'd be able to do like a, how would you put, hazard pay. I don't think we can put that, since we're tribal. I think it probably has to be line itemed out a little bit differently. So those are the 2 things that we would be looking at. With this funding, we are going to, not under this project, but in a different project, we are going to cover, get a full-time driver. And then, but we still can't hire temps to be like full-time. The funding isn't there for later years. And I don't want to hire a bunch of temps as a full-time driver or even part-time drivers, because if we do that, then I'm setting my program up to fail because the money won't be there to be able to do the benefits and the wages. Then there's project 2, and this is the one where we're going to be doing the full-time driver, and this would be it's considered a pilot program. And the only reason why we've considered it as a pilot program is if for any reason this program doesn't work for us, or something glitches, or we're not able to fund it in the following years, we're not guaranteed that we have to do this, and we're not having to backtrack with ODOT or do anything like that. And they're not going to look at it poorly if we aren't able to continue this project after the funding years are up. I'm almost positive this will go through, and it will be great for our program, having a full-time driver other than our bus drivers. I know there was a couple of things that I need to hit on. Let me go through my notes real quick. Let me backtrack. We were gonna, the project name in the plan itself, it is transit. I'm gonna change it to transit staff wage increase, or if there's any other ideas, throw them at me. Because the way I had it reading it was just too confusing. Okay, so we got number. Okay, so the number 2 project, of course, hiring that full-time driver as a pilot program. The number 3, this is my project it's been on the back of my mind forever. We've tried different things didn't work, and I'm hoping this one will. It's also considered a pilot program. It's going to be elders transportation. Knowing, since I've worked with the elders for 8 years before I took this job position, I know that the elders prefer in a lot of ways not to have to ride on the buses. It's a little bit harder when they get a little older. They're not as mobile. And I just thought that we can try to do something with this elders transportation pilot. With the committee, we have the Transit Advisory Committee, which sits underneath the elders committee. They were able to give me quite a few little ideas of how to do this, and I can still meet with them even after we get done with the actual plan. I can still meet with them to they can throw me some good ideas of what we can maybe start it up with. This is pretty much, I'm hoping, going to be a startup program where we can start it up. We'll have to write some kind of like, not policies, but at least some instructions of how they can get to this transportation and how they can access it, and then kind of rules and regulations and what we expect of the elder. Is there any questions on that one?
Any questions, folks? Yeah, Secretary.
Not on that one in particular, but I know that we've asked a number of times when we're expanding services, like for instance, the court is out there by the community center. And it's our understanding that there's not you're not able to add stops. Now, is funding like this something that would provide for that?
That's the biggest issue. I've tried to do it. I can push again, but under the ODOT standards, what we're into is kind of like a commuter bus. And so if you add any more stops to that, it sticks us into more of a demand response, where we'd have to, our quail would have to somehow be able to do within so many, it can be miles, it can be feet, but we'd have to allow anybody to ride, and we'd have to go get them. We don't have the staff to be able to accommodate that at this time. I don't know how long it would be that we would even have the staff to be able to do that. But I really want to look into getting that, and maybe it's something I can throw into in an afterthought, and maybe if it's allowable, maybe it would be something we can put in this plan, and I can get it to you guys within the next couple days as soon as I find out.
Thank you.
Okay. And then project 4 is just to sustain operations that we already have. This would be operations is anything from maintenance to fuel to any of that kind of stuff, and also driver wages is underneath operations. Of course, the wages right now, I have to get those increased because of minimum wage guidelines. I believe July 1st, we will be under the amount that will be per hour. So I got to get a handle on this and actually get it going sooner than this plan even goes into effect. I'm hoping to get it done very quickly. I already have a bunch of different, how would you put it? Different transit agencies on this side of the mountain that what they're paying their drivers and stuff like that, so that I can increase it accordingly, so they're making appropriate wages for what they have to do, because they're on call, they're temporary, they're not getting benefits, and I'm hoping to get their wages up a little bit more that we have paid them in the past, because I've got to be able to retain these drivers. It's getting too expensive to start training everybody and then they leave. And so if I can get those wages up and be more competitive, maybe people might stay a little bit longer. I know that temporary employee is kind of a bad situation all the way around because of no benefits, you know, sick, vacation, that kind of stuff. But at this point, I got to start with getting their hourly wage increased by quite a bit. With that too, we're gonna, of course, I'm sure the gas prices are gonna start going up. I keep looking at the headlines, you know, and looking at the gas prices already going up. So this will help us be able to fuel the vehicles, because it's anywhere between $20,000 and $30,000 a year just for fuel itself. So I'm hoping that this last year isn't going to be as much, obviously, because we were off work for three months, and then the first few that we were having a hard time staffing anything because I was so shorthanded, because I had drivers that weren't wanting to work in the situation with COVID. So but other than that, with the operations, we'll be able to sustain a lot of things, and maybe even with that operations, I can maybe kind of put something in there where it's not new, but it's something that everybody's going, well, why can't we do that? For instance, what Roberta was talking about, I think that's a great idea too. I'd love to be able to stop at more stops, so I can keep hammering on that, and maybe one day they'll say, oh yes, we can do that now. Because that's what I've been doing with my FTA grant. Hey, why can't we claim more than 10% on the indirect? And finally this last year they said, oh, but you can claim all indirect. I was like, oh my gosh. So maybe one of these years I'll be able to get that answer the same. And then for project 5, it's a capital reserve. What I can do with this grant, which is really actually kind of nice, is this capital reserve can be spent out like for indirect. And this is money that can be carried on to the following year, or the fund year, which is 23 to 25. And so this little bit amount of money could help for any of that matching funds that I will come up with in the following years. And then also too, it will be there for me if I decide to purchase another vehicle. Right now, I don't know what I want to do with the vehicles, because we do not drive any vehicle that doesn't have a back seat that's way back there. We're only doing our vans right now for the transports, for medical transport. So I don't really want to look at a vehicle at this point right now, because it just doesn't make sense. I might have to do a little bit of maneuvering a little bit different and buy a different type of vehicle if I'm going to go that route. And I think that's it. Does anybody I'm sure you guys have questions. So, holler. Yes, George.
Michelle, I just thank you for the presentation. Good job. I just have a quick question, and I'm hoping that maybe Jared, with his ability to influence here, I'm concerned about I'm concerned about the fact that, I'm sorry. I'm concerned about the fact that the court is now going out to the community center area. The court is a critical component of the Klamath tribes, critical. Is there a way that you could identify how we being the chairman, not me, the chairman and tribal leadership could provide political pressure, other kinds of pressure? I mean, who's making the decision that we can't add or change stops? My concern is that we're spending a lot of time, energy, and money on the new court. And I can guarantee you that one of the first issues is going to be transportation to the new court. So what can we do? Can we eliminate a stop and add a stop? Or can we have the chairman call President Biden and say we need a new stop? I mean, how far do we need to go to make this happen? And other than, you know, you trying to give pressure and 5 years down the line, maybe.
President Biden's not my buddy yet, but maybe sometime. Do you have thoughts on that, Jared? What might be most effective? I mean, I suggested maybe, but I'm not sure who to send it to or what other pressure to put.
Isn't that Pete Buttigieg?
Yeah, I mean, obviously, Michelle could probably explain a little bit better, but Michelle, would this be a state issue or the Federal Transit Administration grant that you operate under issue? Or what guidelines are you following that kind of eliminates us from this? Because I know I've been asked about other locations too, like Tribal Health and the new I-Corps site. They've asked me about getting stops up there as well. And so I guess this is a pretty key decision to make so we can meet all the needs of all our different services.
The only thing I think I can do, it's actually state with this grant that we have, but what runs the program is the feds. They're the ones that have those big rules and regulations, and all I can do is I can just ask, but I would really like to see the same, because when I was putting this together, it was also in the midst of you guys doing the move for the tribal court. So I'm going, okay, so do I put that in? Can I do it? And I don't know if I can. And so I threw this together. The really good thing with these projects is like my operations. If I just wanted to add a stop and I'm allowed to, it could go into the project that is fully just for operations. From what I've been told and what I understand is that this plan is very easily kind of not manipulated, but it's easy to put different tasks in different places because they kind of all mesh together. And so if I needed to, I could use a little bit out of this one project to go ahead and, you know, with operations, that would be an operation to be able to make a stop out at court. Do you know when it would be starting? Anybody?
The court will be starting. I would assume it's going to be. I mean, the staff is already there.
Oh, okay.
So they're setting up, but within a couple months they'll be, you know, holding court there.
Okay, so
develop from there.
So I still have a couple, probably a couple times that I can, at least a couple months to play with this stop. And then even, I have more money coming for, what is it? I have another bit of money that's coming, another pot of money from COVID dollars that was just released at the beginning of the year. And so I haven't quite yet been able to look at that because I'm so busy trying to get this done. And so my next step is to step into that, just at least look and see what we have. The apportionments are out, so I'll be sending that to Jared, and then Jared can forward it on to everybody, because that is going to be extra money, and that could be used. They only want to see that one used as operations, is from what I'm understanding. But I'm just looking at my other grants, like my 5311 grant. That's really opened up to pretty much anything I want to do too. And I'm writing those grants. I should have been writing them this week, but I've been doing all kinds of other stuff, trying to get used to not having staff at this point. And I have to work on those grants next week, and I will talk to our ODOT rep to see if there's anywhere I could put that stop into that grant. That would be great. And I've been asking forever. I'm like, why can't we stop at Tribal Health? And they said, well, because I was told because they can walk over there. I'm like, no, if someone is not feeling good, they're not going to want to walk over to Tribal Health. And, you know, there's times that we've even sent drivers, can you go pick this person up just to take them to to go to the clinic? And so we've done that several times. But that's an inconvenience for them. And I think it'd be great if we could just stop there and be able to drop someone off and be able to pick them up, you know, whatever, an hour later. If they feel like walking to wherever the next stop is, they can do that too. So that would be my idea, since I'm going to be doing those grants probably tomorrow and Friday and next week. I'll be working on those grants, and maybe I can throw some stuff and maybe I can word it differently, and maybe Jared can help me design it a little bit differently than what I have in the past.
It sounds like a plan. There's definitely interest in increasing the stops, you know, for there. So let us know what we need to do at the council level. You know, if there's something that we need to do to put pressure or to make a request or whatever is possible.
I think probably Go ahead.
So I was going to say, or change the policy, the state
Okay.
policy somehow.
Yeah, I think the only thing that probably would be is a request that I may have to have, and just to show how much of a need we have, that we actually are requiring in our community. I think that would be where we're at. Right now, we're only making minimal stops in Klamath, and that's just to get our community members to Klamath Falls. And so we only have 2 stops that we meet up with BTS. And that's all we can do in Klamath Falls. That we're very limited on where we can stop there.
Chairman, yeah. If I may, I would like to offline, not right now, but I really want to have a conversation with Jared and Michelle, because I think that there's a cross between transportation and transit. There's a cross between the roads that are on the inventory of the Klamath tribes and transit. Every other place I've worked at a tribe, those come together, so that if you own, quote unquote, have that road on your inventory, that should give you some leverage on providing transit through that road. So there's a combination here, Jared, that I would like to have you and Wilton talk offline, but with his mind to research how those legislations, those legalities cross, because there is a combination there. And so I would just like the opportunity to let you know that I will update the council later, but I would like a conversation with Jared and Michelle offline about how, because this is, to me, this is super important. Really, you can't take tribal members to the clinic. Really, you can't take tribal members to the court. It doesn't make any sense to me, but I would really like to focus on this.
Okay, all right, that sounds like a plan. I'm trying to get us, are there any concerns or comments or questions about the STIF plan? And if not, I'd like to entertain a motion to move forward with approval.
I'll make that motion.
Okay, it looks like second by member Hakakta. Okay, any further discussion? Okay, if not, secretary, please conduct the vote.
Gail Hatcher. E. Clay Dumont.
E.
Willa Palace.
I vote yes.
Ellsworth Lang.
Yes.
Jeannie McNair.
Yes.
Jesse Hikota.
Yes.
I vote E. Chairman, with your abstention, the count is 701.
Okay, great. Motion carries. Well, thank you, Michelle. Jared, appreciate it.
Oh, it's all Michelle. She did all the work.
Thank you so much for your guys' time.
Well, thank you, Michelle.
Thank you, Michelle.
Okay, I see we have Tanea and Nicole on for this next matter, the tribal attendance promising practices. So how are you ladies today?
Hi, I'm good.
All right. So
I just forgot how cold it is in Joaquin. You have to wear a coat everywhere.
It's cool right now for some reason. Got cold around here. Yeah. So I guess we'll turn it over to you to lead us through. Mom.
Okay, so just a quick introduction. My name's Tanea Parrish. I work for the Tribal Attendance Promising Practice grant that we have here at Chiloquin Elementary and Chiloquin High School. I was just gonna go through a quick few little things, not take up too much of your guys' time. As you can see, the report's pretty large. This year has been a very tough year for our students, not only our students, but our families as well. We track attendance a little bit differently. With the Zoom, you know, students could come in and just call, and that, I don't know how to explain it. Like, they could call in and their attendance is tracked that way instead of, is your screen recording? Let me take this off. Okay. The state doesn't really track attendance how they used to, is basically what I'm trying to say. And for me to do my position, it's a little bit more difficult than it was in the past. I don't have direct reports. I can't go off of eSchool, our system that we use to track our attendance. Basically, what I do from a day-to-day basis is see what our students need. You know, are they having family problems at home? Is that why they're not logging into their school? Are they not able to turn in attendance or turn in their schoolwork because they don't have hotspots, or they're out in the middle, you know, in Sprague, where they, even with the hotspot, they still have issues with their internet. So I tried to provide different ways for our students to turn in their homework. Do I need to go out there, pick up their homework? Do we need to have, you know, set up meeting times with their families to have the students turn in their homework? We also want to let our families that know that we are here for them. You know, we provided gas cards for them to start bringing in their students to school when we started up. And it was kind of tough for Rita and Scott, I feel, because the school district was like, oh, we're starting this week. Oh, we're not starting this week. We're, you know, and it was tough for them to let their families know. And that makes it hard on the families to be able to set up daycare if, you know, the school district decides, hey, we're shutting down next week, you can't come into school. Which also makes it hard on our teachers as well. As you scroll, we could scroll down and kind of see a little bit of what we did. Basically, we try to recognize good attendance for our students is we got little like gift cards for them, you know, hey, if your attendance is good this week, your name gets put in a hat and we're going to draw it out, and you're going to get like a $5 gift card to like Walmart or the Dollar General or Dutch Bros, Human Bean, whatever, you know, the teacher chooses to decide. We created flu kits for each and every single one of our families. We've done that twice now. We did it in the spring during the fall, during the, when the families come and meet with the teachers. And then we did it again during, right before Christmas break. We had a holiday drive. I believe you guys all got that flyer that we put together real quick within 2 weeks. I went out and picked out a present for every single one of our students. They all got gingerbread houses for their families. We had 14 days of food for them for the whole 14 days that they wouldn't be attending school and that they wouldn't be getting provided food. That's when we did their second round of flu kits. In the flu kits, there was like laundry detergent, shampoo, conditioner, hand sanitizer, and pretty much anything you could think of. They're really heavy bags. And I was trying to give them like more than one, and a lot of the families were like, no, we just need one. We just need one. I was like, are you sure? Like, this is free stuff, you know, that we think that everyone needs. What else did we do? And it was just another way for our students to like see their teachers again. You know, a lot of the students miss their teachers. They see them through the computer every day, and that's hard for them. I can't imagine being a little, you know, little kindergartner and not getting to experience my first year of school at school. It's on a computer. So I feel like that is tough for them. So I really wanted to like kind of bring them together, but just a quick like, oh, there's your teacher, say hi. My teacher gave me a present. You know, the school's providing all this awesome things. What else do we do? We have a weekly attendance meeting where we sit down and we try to discuss as best as we can what students are having attendance problems. And it's hard for us to go through that because, like I said, a student could call in and say, I don't feel good today, and they could be lying, but because they called in, they're counted as present. So that's tough. So we try to base off of academics, see, are they failing grades? Are they, have their grades slipped? Have they went down? And we try to target those students as well. The attendance team is myself, our vice principal, our attendance secretary, and our counselor. We just got a new counselor, so now they're at the high school and they take part in our meeting. And from there, we'll just decide who's gonna make these phone calls to each student, who has a better relationships with what student. I had to obviously build relationships this year because I'm new to the program and I'm new to like these students in the school, not really the community. So there's a few people who know me. And sometimes I have to go out and do home visits with our cop, Perry, or is it Perry? I believe his name was Perry. I'm sorry. I get nervous when I'm around him, so I always try to be professional. He's pretty intimidating. I've had a lot of success going out and doing home visits with him because when we start going back to school, and there was when we could start kind of tracking our attendance good, you know, again, like going off of, oh, they're here, like visually, like we could see them on campus. And I go out to their house with a cop. The parents' reaction is, what did they do? Are they okay? We're like, no, they're not in trouble, but they will be if, you know, they don't start attending school. And the next day, you know, those students are right at school. They'll be consistent and consistent. And I actually haven't had to go back to any houses. So I think that's good. And I always have something out there too, or I bring a letter out there to let their parents know. Cause you know, our parents don't really know what's going on. They don't know if their students are going to school, you know, if they have to do Zoom, because the students only go to school 2 days a week now. Those other 3 days, the students are home by themselves and the parents may not know. We do try to make contact through phone calls with the parents, but a lot of the times the kid answers and, you know, they may not communicate with their parents or whoever is their caretaker.
Tanea?
Yeah.
Is this issue more with the older kids, or is this younger kids, or what are we saying when, you know, there's not a parent there?
Yeah, it's with the older kids. You know, I feel like the parents really like, you're old enough, you should figure out how to go to school. You need to figure out these things yourself. And you know, you don't think that happens, but it does. It happens. And I've actually spoken with a few I would say caregivers, because some of them don't even live with their parents, you know, they're homeless. They live with other people. And one of the conversations, I'm not going to say names or anything, but they're like, I talked with them and they said that they didn't want to go to school. So the caretaker's response was, well, then you're going to work, you're going to do things around here. And then that student changed his mind and was like, I want to go to school. When I showed up with the cop, you know, like to go talk to the student. I think it scares them, but once they see me at school, you know, they're like, oh, hi, Miss Parrish. You know, they know who I am now, and it makes me happy. So hopefully I don't have to return to any houses. I haven't had to go in the last 2 weeks. So that's good, I feel. I would have liked to have numbers for you guys, but we don't really have any like percentage numbers due to the fact that the state doesn't really look at attendance numbers anymore because it's hard to track. really hard to track. Things that we're gonna do in the future, supposed to start this month, but things got held back. We're gonna do cultural kits sort of as an incentive to, you know, show the kids that if you come to school every day and you participate, not just attend school, but participate, turn in your homework on the days that you're not at school, we're gonna have these cultural kits together. For example, dream catchers. I ordered a bunch of dream catchers for them. I partnered with Perry Talk To from Culture and Heritage, and I got a lot of information about these kits that I purchased, and the kids are really excited. I made a bulletin board and they keep asking, hey, what's that? Are we going to be able to do that? So hopefully they'll really enjoy that. What else? We have to do another round of flu kits for our families as well. And I also, with the flu kits, I don't just give them out every time that I have to. I try to recognize when families need it. You know, when I go to like a home visit and, you know, I kind of see like, oh, they may need like a home kit as well. Or sometimes I think it's appropriate to bring like something like that with me, like, oh, here, like I introduce myself, let them know that I'm there for them and their student and their family, and like provide them with a flu kit. I don't say flu kit, but here's a care package for you guys, you know. That's basically everything that I've done so far. It's kind of hard to keep up with going back to school and not going back to school. Do you guys have any questions for me in my position, or Nicole from ODE?
Secretary?
I know that Councilmember Dumont got invited to go on a walkthrough with the superintendent, but wasn't able to do it. So I don't know if Vice Chair Hatcher has gone over, but I know I haven't. So I'm interested to hear how the classroom instruction is going and what's available over at the elementary school, because I haven't seen an update.
I think it's going good. I think they figured it out. The construction is kind of annoying. You're banging a lot, but it's safe for the students to walk through. I believe most of the teachers are actually back in their original classrooms right now. I want to say they're working on one classroom and that's it. That's, I think, and then being able to bring back all the kindergarten, was it 4 days a week, every day? I think that shows that the construction's moving along pretty fast. If you guys want to schedule an appointment, maybe I could ask Rita, or you guys can shoot her an email to, you know, do a walkthrough again.
Vice Chair?
Yeah, Tanae, I know you kind of went through a lot of the difficulties in just trying to carry out the duties of your position with the TAP program. Have you had any issues with being able to purchase what you need? Have those processes been going pretty well? I'll just start right there. Do you,
I want to say that I haven't been told no for anything that I wanted to do. But I do get a delayed response. So like for example, my cultural kits that I had planned out for our students, like to not only get incentives, but cultural incentives to, you know, learn about our culture. And that's kind of delayed because I wanted to do one every month so that they had something every month for the rest of the year to look forward to. I can't start that this month because of the delay. The delay started because Scott and Rita asked for the budget so that we could plan from the budget, and I think it said we had around 88,000 And then, so then I did my requisition and everything that I planned out for the rest of the year to utilize that money for our students. And then a week later, they're like, well, that's not the right budget. So they sent me a different one with half the amount on it of what they had. And I was like, what is this? Like, my one event is going to take up the whole amount. So I was a little bit frustrated. I had to go back in, make some cuts, do, you know, some organization, and I'm making it work, but it was a little bit frustrating. And then the fact that it took probably about a week or two for it to get signed, when sometimes, I don't know, it takes a while for things to happen. And I had to ask quite a few times to actually receive the budget as a whole. So that was a little bit frustrating. And I think the first time I asked for it was the last time I was on a meeting with you guys, and it took me about 2 months to actually get it.
Okay. Are there any limits on your spending? Are they keeping you to any type of limits or anything like that other than budgetary?
No, I haven't been told no with like this flu kit or the culture kit's about $6,000, and they haven't said anything. The only thing that I would really like is maybe, because it's not the principals. The principals are like, yeah, I'll sign it right now. Oh wait, I can't sign it because it's too much money. So I have to wait for Jeff to do that. And then it's a little bit frustrating because it could be done in one day and I could start with my, you know, ordering process that day. So maybe if the principals were allowed to sign off on a little bit more money, then I think maybe 1,000 is what they're allowed.
Oh, okay. So you have to have approval for every time you purchase something. That's what you're saying?
Yes.
Oh, okay. So
at least that's what I was told from Jeff.
Okay.
If that's not the case, then I don't know.
Okay, that I would say too that they I would think that they'd set a limit for you, and like you just said, $1,000, that seems reasonable to me. I don't know why you would have to go ask permission every time you wanted to purchase something.
Yeah, I feel like something else is maybe the TAP program should have their own credit card, since that's what we use. We do a requisition and then we go use a credit card. And like maybe that day I think a student is doing really well and I created like, hey, at the end of the week, if you keep doing good, I want to go buy you this, you know.
Yeah.
I think I should be able to do that, but I do not have that power to do that.
Nicole, I saw your hand.
Hi. So for those of you that don't know me, my name's Nicole, and I'm brand new intern at ODE in the Office of Indian Ed, and I've been on for like a week. So I'm just here supporting Tanea. We were just reviewing the report earlier today. And I did see in the report that they wrote that it's $100 limit. So buildings can spend up to $100 without getting district approval. And I was talking to some other sites recently, and all sites do it differently. So it's not TAP saying that you have to do it like this. And so I think that there is room if you guys want to do like $1,000 limit or a $5,000 limit. I do know that just for regular purchases, it is that much. So if Frida wanted to buy something, she doesn't need district approval unless, I can't remember if it's 1,000 or 5,000.
So oh yes, Member Dumont, I was going to ask how we follow through on this to make sure this moves forward.
Go ahead, Chairman, I can wait.
Maybe just bring it up with Jeff. Maybe I could bring it up with Jeff, or I could sit down with Scott and Rita and discuss it how we want to go about it. Because I know that they would be like, yeah, it would be so much faster if we just did it that way. And then bring it up with Jeff, and then if he needs to talk to you guys about it, he can.
Okay,
I don't
that sounds
know.
like a good. Yeah, that sounds great. I think that works. Member Dumont?
Yeah, well, first of all, I just wanted to say I'm glad that you're on the job, and that even with things as difficult as they are, you know, all the kids at home, and I'm glad you're there, and I'm glad the school district made the pick that they did. And So that's all good news. I have gotten comments and questions about the culture kits, specifically about the contents of them. And I just want to make sure I heard correctly. I thought I heard you say dream catchers. And
Yeah,
I just was wondering if there was an effort to do, you know, tribally specific cultural things. And, you know, I don't know. Maybe
no, that's
somebody
a
knows
great
something I
question.
don't, but
That's a
I
great
wasn't aware
question.
that wasn't
I
aware that
was
part of
I
our
was
culture.
wanting to do something more with our culture. I did discuss that with our principals, but with the budget, that those weren't as expensive if we wanted to do it in bulk. It wasn't just dream catchers though. There was drums. What else did we discuss? There's drums, medicine bags, medicine bags, dream catchers, rattles, and then with every single one of these items that I purchased, I got like kind of the significance behind them with Perry. Like that's what how I communicated with Perry is like, what should I teach our students about the medicine bags? Like how did our people utilize them with every single one of these? So I did try to relate it to the Klamath people, Klamath Modoc and Houston people. Yeah.
Vice Chair?
I don't know if this is too early to ask today, but can you tell just by what you've done so far, as far as the budget, do you have sort of a feel as to whether we're going to end up with leftover dollars, or are we looking at it pretty much spent out?
It's probably going to be spent out with this, the cultural event, and then I'm trying to look for other incentives to, you know, some kids aren't into cultural things. So I'm trying to look for other ways like to get snacks and stuff like that for our students as well. So it's probably going to be all gone by the end of this year, which I believe it has to be because it's the end of the grant.
Well, for myself, I don't know what everybody else thinks, but I'm kind of curious to take a look at the budget. I'm wondering why you would be given one and then it pulled back in another one. Maybe that's just me just being overly suspicious. I have a tendency to do that, but I would like to see what it is that they started out with. And I honestly can't remember whether we saw a budget or not. So
I believe you guys asked for the budget too, so I'm not positive if you guys even received that. At the same time I had asked for it during that meeting, I think it was back in October. I don't know if you guys received one yet.
All right, I don't remember, but it's possible. So I guess I can double check and see if I've seen anything. I just don't remember, but I'm old, so.
Does George have his hand up?
Yeah, are you there, George?
Or is that just permanent?
That was an old hand, sorry.
An old hand? Well, today I really appreciate the report, and it sounds like you're doing some good work. Just glad you're there, and it's obvious you're committed to this and seem like the right person for the position. So it's great to see you there, and thanks for the report.
Yeah. Oh, sorry. I was gonna ask if you guys would like me to do anything else. Do you guys have any ideas that I could do for our students?
Councilmember Dumont just remarked on the graduation rate from last year. And I know you weren't on, you know, we.
I don't know what that was.
It's not good. So I'm wondering if you're able to track the juniors and seniors this year. Because I know that's a pretty big concern. We're, you know, trying to to make sure that our students graduate.
Okay. I will get a hold of those numbers and see what they look like and compare them to last year's and see how our students are. I know that there's a lot that are struggling, but I also know, like from my attendance meetings, that there's a lot of students that are in the Ed's class, his credit retrieval class, that have actually finished their courses and stuff. So I'll have to take a look at that and see what that is, see what the numbers are.
Tanea, this is Ellsworth. I just wanted to tell you thank you for coming up with some pretty innovative ideas to incentivize the kids and get them excited and build those relationships where they bond and trust. I know in high school, when I was in school, a lot of years ago, before you were born, it was neat to form those relationships with anyone that's part of the faculty or somebody that could be looked up to. So thank you for that. There was a suggestion of some clapper sticks from some of our listeners on YouTube, and then also the basket weaving starter kits that may be very culturally appropriate. So I just wanted to pass that on as well. So thank you, and keep up the good work. You're doing an excellent job, in my opinion, of course. And this is the first time I've heard you present, and great job.
You guys make me nervous.
You make us nervous.
You're doing wonderful.
Yeah, appreciate it. Yes, Nicole?
Can I ask what the best way for Tanea to communicate with you all would be if she needs to ask a question or anything?
Well, I would just funnel it through Secretary Frost. She's pretty available, through either email or even a phone call. Would that work, folks?
Yeah, I was gonna say besides the texts I get.
She might be a little biased. We don't know.
I know.
But I think she could contact any of us or send the council email address. And likely Dr. Dumont would probably reply.
Yeah, if you want to loop Clay in, that would leave out the bias.
Okay.
I'm still willing to help anyone.
Yeah, I forgot about that.
Just go underscore council. Underscore council at Klamath Tribes.
Yeah, that works great. Well, thank you very much. I guess good to see you ladies, and have a good rest of your day.
Thank you for listening.
Thanks for joining us.
Hi, thank you for your time.
Thank you, ladies.
So I see I skipped Mark on the agenda. I don't know what the deal was, but Mark Butner had a joint funding agreement, and I just tried to text him to see if he's available. I saw him on earlier. Maybe I could give him a quick call or let him respond to the text.
Yeah, I don't recall letting him in, but I may have let him in and not even noticed, or else I would have let you know. I didn't see him on when we went down to Michelle.
Yeah, I did see him on sometime today, but I can't remember when. Does the folks need to take a short break? Maybe I could just give them a call real quick. Are we okay to just move on? Okay, well, let's see. Let's see if he responds to the text. So let's respond to the, let's see if he responds to the text, and let's move on.
I don't mind taking a break, but I was gonna mention that we do have some staff on still.
Yeah.
I'm not sure whether it's the addition of the employee programs that they're on for. Not that it can't be on.
Yes, ma'am. Yes. Yeah. So maybe we can address that. I mean, and I really apologize. I had so many things going on and saw some of the email communication, but you know, I know that there's some questions about the employee programs, and so if somebody could help me here with it, I'd appreciate it.
The two programs that we didn't make a decision on when we talked about childcare were the mitigation pay and the emergency leave, or FFCRA, as the casino utilizes it. So those were the two programs that were still, there's the housing, the stuff for the housing program, but they're not quite ready for that yet. But just as far as employee programs, it's a mitigation pay and the emergency leave.
Okay. And that's Laurel's comment about essential worker. Is it essential worker mitigation pay? Or I'm not sure what she chimed in on that.
Chairman,
okay.
I believe it was when Michelle Carson was talking, and she talked about that, and that's when Laurel said essential worker.
Well, okay, so it's not related to this. Okay,
I don't
well,
want to speak for her, but I don't believe so. It was when Michelle was talking.
okay. For those two items, Secretary, folks, is there any concern in moving forward with those, making a decision on that? And if so, what, how long would you spend?
So we don't have anybody from HR on right now. So that may, because it wasn't on the agenda and we didn't alert anybody, I just had sent it out to council, so I don't know. The only question with that though is, what are we gonna do? I mean, when is it ending? I don't know that they need to be on for us to decide when it's ending. You know, I leave that up to council.
Didn't we extend some of the others for a quarter?
Yeah.
Up to March 31st?
Yeah.
So
I guess that
would be
wanted
my
to-
suggestion. That way we'll be,
Yeah.
I'm just gonna say by then we should have a sense of where we are with vaccinations and all of that.
Okay, General Manager Lopez.
I'm sorry, Chairman and Tribal Council, thank you for this time. I think staff was a little confused because I thought that the projects were going to be on the agenda. And when the agenda came out, the CARES projects, I did not see them on the agenda. So I did not request any subject matter expert staff to be here. I would suggest, Chairman, with all due respect, is that we postpone that conversation and get staff ready.
Okay.
Roberta Sexton, I would like her here. I would like the other program directors that are dealing with the project
George?
to be here to discuss.
We're just talking about employee programs, not projects. So
And I would like Laurel to be part of that as well.
Laurel actually wants to know if she's needed back on the chat. So yes or no? Chairman, I can't hear you. You want to nod your head?
Yeah, I think if we can move forward with her, and Dr. Larrabee is still on here. I know we're short on HR folks.
I'm trying to, my other computer that I use to monitor is locked up, so she'll hear it shortly. I can't do anything here, so she should be on shortly.
Okay. Yeah, that's what, okay, yeah, I was, what Clay was suggesting, I wanted to see if the folks would support moving forward and extending
Yeah.
that to.
And I'm not sure
program.
why we would need discussion if we're going to extend it. I think it's just if we're going to end it that causes the issue.
Yeah.
And that's more of an issue with finance than with human resource.
Mhm. We have Lana on here.
Chairman, it's 5:20.
Yeah, I know. So it'd be nice to just move forward and make a decision, but I know George felt that it was helpful to make sure Laurel was wrapped in here, so it's not happening. So what's the wish of the council? What would you like to do?
I think I'd second Clay's motion.
Okay, so we have a motion
He
by.
didn't make a motion, but
Oh, yeah. Oh, yeah.
What?
Yeah.
Can you restate the motion, actually?
Then Neil named the
So
program.
I'd move
and I don't
to,
have it.
I'd
Go ahead,
move to
Clay.
extend the 2 employee programs through March 31st.
Okay. Motion by Member Dumont and Secretary, you still want to second that?
You're muted, Berta.
said unless somebody else wants to, I'm just trying to move things along because it's getting late.
Mhm. Yeah. I'm kind of getting burned a little bit. So, okay, so second by Secretary Frost. Any further discussion? Okay, if not, oh, yeah, Member
Yeah,
Lane?
I have a question.
Okay.
Somebody's talking.
This is Laurel.
Yes.
It's my understanding that we were gonna keep the,
Somebody's TV's on.
second. It's my understanding we were going to make that, the public health leave continue, and there was something about you couldn't get the mitigation pay unless you were in the office.
Yeah.
And that would be for this next quarter, starting on the, for us, that was pay period 4, but I think the effective date was February 2nd.
Also, as a side note, so the casinos just started pay period 2, and we're way off on pay periods from the tribes, it sounds like. I don't know if that's important to anybody, but I just wanted to, that's a side note.
So I think we just need to give it a date instead of a pay period.
I agree.
Yeah, that's something.
Yeah, because we're not on the same pay periods. And so to our staff, it's pay period 4 is February 1st. And so that's when we would tell people they couldn't get the 25% if they weren't working on site.
So yes, Dr. Reverie?
Yeah, Chairman, sir, for us in tribal health, we do not pay those who are not working in the offices from the very beginning. So that's directive that didn't really affect us because we've been keeping that regulations from the very beginning. So we only pay those who work in the offices during the month or during the week period.
Chairman, this conversation seems to be beyond what is we're trying to accomplish. We've already given a directive about the mitigation pay not applying unless you're in the office, and also with childcare. So all we're doing here is trying to extend the programs with the new restrictions that we've put in place. So it's the mitigation pay if you're in the office and the emergency leave policy.
Yeah.
And this is 1 quarter, correct?
Till March 31st.
Yeah. And that's the motion. So I think we've got it covered. We have a motion and a second. If there's any further discussion, Secretary, could you conduct the vote for us?
Gail Hatcher. E. Clay Dumont.
I vote E.
Willa Palace.
I vote yes.
Ellsworth Lang.
I'm going to abstain because I'm not certain that it will or will not affect me.
Jeannie McNair.
Oh, I see.
Abstain.
Jesse Hikokta.
Abstain.
And I'll abstain also, even though I seconded it, just to move it along. So it would be, with the chairman's abstention, it would be 3-0-5.
Okay. No, it sounds strange, but the motion actually carries. So, okay, well, thanks, folks. I haven't heard back from Mark. I feel so bad that I forgot about that. I can't call him because I'm using my phone for the meeting here, since I had such bad audio earlier today. Maybe somebody could give him a call, secretary perhaps, if you've got his number, and see if we can bring him on, and then we'll move down the agenda from there. So the first step, Deb Holland, there's a support letter. Willa, did you want to address that issue and move forward? I think we would be willing to move forward with that.
Sure. Thank you, Chairman. And I don't necessarily think that we need an action item for this. I just wanted to make aware to the rest of the council that I was going to recommend we send a letter of support for her confirmation to Senators Wyden and Merkley. There's going to be some GOP opposition. NCAI is expecting her confirmation hearing to be mid-February. So she's going to be one of the I think there were some other confirmations that they were trying to get done first, and I think they were expecting hers to have some opposition, especially because of some of the recent moves by the Biden administration on gas and oil extraction. So I think that might be where it's going to be held up. But there's a lot of NCI has a sample letter, and then there was some tribes. All the tribes in Oklahoma sent a letter too. So I have those samples that we can look at. And I did start a draft, but I really wanted it to be more unique to the Klamath tribe and the struggles we've dealt with the interior. And I thought maybe council could kind of go back and forth. So I just wanted to introduce the ideal. And since her confirmation's not up yet, we could probably send it out next week. So we don't have to take action. I just wanted to introduce the subject.
Okay. That's great. I know we can do that. You know, we'll just need to figure out who's going to help. Since you started on a draft, Willa, would you mind working a little bit more on that and forwarding it around for input?
Yeah, I can send that out.
Okay. Yeah, great. I appreciate that. Yes, Secretary.
I was just going to say, do we need to do anything with that notice that I see has been going back and forth? Or can we just send that out, Willa, that you've I've seen some communication from you and Clay on it.
I think it already went out.
Okay.
So yeah, it was a short statement and they just changed the headline. So.
Okay.
Yeah, it already went out.
Good.
Yeah, thanks for following through on that. But yeah, appreciate that. Okay. Let's see. The other thing, I did get a hold of Tim Trainer at the Nickel about that ad. You know, about the tribes not allowing water for livestock or whatever. And he's actually going to check into it. He said, you know, if it's in the regular print section of the Herald News, it's a little bit different than, you know, being a paid ad. And he's going to connect with their folks down in the advertising department. There can be a disclaimer or a note put down there that this statement may or may not be factual or something like that. So he's going to follow up and just see what can actually be done there. You know, because people can almost purchase space and say what they want to say. You know, but they can actually allow put some provisions in there that might clarify that this may or may not be accurate or whatever the text is. But so he was responsive to that, and usually when folks, you know, have issues, you know, he kind of directs them to either put a letter to the editor together, or you know, even if they have work with them on an editorial piece or something like that. But anyway, that's what he's going to check into that and get back. So I just want to let folks know that I did follow through with that, and. And I also think that the paper seems to feel a little bit more balanced than it used to. I noticed even some of the cartoons that are in there are a little bit more moderate, you know, put it that way. Not saying there's significant changes, but there is a little bit of a difference of tone in the paper. Of course, they're losing their readership, I think, too. But so, oh, and also we had, in our water meeting, we did get a statement out to our members about the Bureau of Reclamation visit in the direction that they've been provided, that's going to guide the biological opinion that's going to be coming out. And we put that statement out. I did get a text from Alex Schwartz, and I haven't called him back, and I don't see that he texted me back, but he's interested in putting together an article. And when he talked to me about this earlier, I said, well, we're going to figure out what we're going to do, and we just decided to notice our own individual members and get it out that way. I didn't even tell him that. I didn't respond after Monday. I totally spaced until he texted me. But I don't know what folks think about. I mean, it's probably out there already about forwarding that to them. I don't feel necessarily comfortable talking to them and providing a statement or anything additional, but I don't know, what do folks think about how to respond to Alex? He's wants to be helpful, and I think he's done a good job with us on other matters, but so just wonder what folks think about that.
Chairman?
Yes.
It's Clay. We actually had that discussion with our attorneys, and my recollection is they thought it would be better to wait and see what we were able to accomplish with the new administration, and then support that publicly.
Okay, that's right.
I think that there's some other things that Alex has asked us for, and he has been good to us, and we might follow up with some of those things that we've kind of let slip that we might talk about another time that we could help him put together.
Sure. Okay. Well, I'll let him know, and then in fact, I think he even mentioned those again when I talked to him last. That he wants to pick up the ball. Not so much time sensitive, but so I'll give him a call back and let him know what we decided to do, and I'm sure he'll understand.
I would just communicate that this was a message to our membership and not necessarily something that we're ready to make a public statement on. That's it.
Yeah. And I believe, he hasn't tried to get back to me, so after the text, so I'll just communicate that to him. I'll give him a call and share that with him. So, okay.
I support that. I just think, we've kind of gotten, over the years in the habit of expecting outside media to tell our story for us, and we see how that doesn't work. I highly appreciate Alex and how he's tried to be more thoughtful of how he writes about the tribe. But again, that's still not us telling our story. So I'm a huge advocate for we need to be telling our own stories. So I support what Secretary and Councilmember Dumont just said.
Okay, great. All right, well, that's pretty much what I had on here. Unfortunately, I haven't heard anything back from Mark yet, but let's move on down. We've got at-large members report, Senate Bill 13 Ad Hoc Committee invitation. I kind of had to leave the meeting a little bit early yesterday, so Clay, go ahead and lead us through what the developments are.
Sure, Chairman. This was based on our conversation yesterday, the meeting that we had regarding SB 13 with the general manager and some of the advisory committee members. And I left with the impression that you'd be willing to appoint an ad hoc committee to oversee Klamath Tribe's work, or to be advisory on the Klamath Tribe's work on the SB 13 curriculum project. And based on that understanding, I actually sent an email to the 8 folks that I know have expressed an interest, the 8 tribal members, in working on that. And if you are willing to do that, I've gotten an answer from 6 of them, 4 that would like to be part of it, 1 that wants to but can't until March 20th, 1 declined, and there's 2 that I haven't heard back from yet.
Okay. So you asked them to be a part of the actual ad hoc committee, and you would like me to follow through with and appoint those individuals? Okay. So
I explained that, yes, I thought.
Go ahead, Clay.
So if you wanted to formally appoint an ad hoc advisory committee for the Klamath Tribes implementation of Senate Bill 13.
Mhm.
Is that something you're
Okay.
willing to do today?
Yeah, what I think I'd like to do is work with you and get the names and put that together and make that appointment. It's I mean, I have the liberty to do that, you know, without like formal tribal council action according to the tribal council bylaws. So to get it right, if I can get the names from you, and we can work on that and get that out as soon as possible and send out notice to that effect.
Okay. Names and the status of their responses tomorrow morning.
Okay, that sounds great. Look forward to that. I think that pretty much covers it. You know, I know we had Mark on briefly and things went long, and so somehow I missed him on the agenda. I don't know why, but anyway, maybe we could at least review that project, the joint funding agreement for the Klamath Marsh, and prepare to go out for, I guess, a poll vote to take care of it, rather than trying to bring back Mark in on a meeting. And I know he's always open for phone calls if folks have any questions or comments too, you know. But do you think that would work, folks? Comfortable with that? Yes.
Chairman, if we're going to have a poll vote, there is one issue that I was worried about there. You know, it's a wonderful, important project. We really need to understand better what's happening with the marsh and groundwater and surface water connections and what's happening with the irrigation up there. But in the agreement, the Klamath Tribes are actually putting up the majority of the funds. And the other is the U.S. Department of the Interior Geological Survey. And in the agreement, number 8, concerned there the control of the data. You know, we just came from an administration that was really, really bad about letting politics get into the data, and they would simply squash whatever they didn't want to see in the public domain. And it concerns me, and I'd like some reassurance that that wouldn't happen if, you know, at some point in the future, given the language that's in number 8, there was a hostile administration, that they could keep us from putting this data that's so important to the protection of our environment.
Well, that's a good point. We probably need to get some clarification about that from Mark. I'm thinking if it's federal funds, you know, that there should be data that's available to everyone. But I do know USGS is one of the entities too that basically they're kind of slow and you know, releasing data and summaries and information. So we probably need to talk with verify that with Mark, and before we make a decision.
Yeah, I did email him and then resent the invitation, but I still don't see him up.
Okay.
Okay.
So
yeah, it may be fine, Chairman. I don't know. I have some concerns about one specific sentence.
Yeah, no reason not to be gun shy, because we've been treated pretty ugly by some of these agencies. So I'm gonna follow through email with Mark and ask that question tomorrow. I got a note to do, probably do that first thing in the morning to do also. So then get that a response to that, and then move forward with the poll vote after that, if that works.
Chairman, if you are so inclined to CC me on the email, I can point out exactly what sentence it is, if that.
Okay, that's great. Okay. All right. Well, thanks very much. I'll try giving him a call on the way home on his cell phone too. That might start things off too. Well, thanks folks for the long meeting. You know, I know we addressed a lot of things with kind of a lot of information to process today. So thanks everybody. So I'd entertain a motion to adjourn.
So move.
Okay. Second.
Second.
Okay, well, I saw Jesse's hand first. Ladies first. So, okay, we have a motion and a second. All those in favor say aye.
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 Okay, those opposed the same? No opposition. I see thumbs up from Jeannie, so.
Jeannie wants to stay here.
So I have 5:41. Thanks for the long day, folks.
Jana's on.
Oh, Jana, were you on about the agreement for Mark?
So I
Maybe
don't.
she-
No, I was actually on for Michelle and I thought I logged off.
Oh.
But I was also on for Mark too. I thought I
Go
logged
Yeah.
home.
All
So
right.
we'll follow through if we have a question. in a minute.
Did Mark
So
come on?
thank you.
No.
No, we
No.
couldn't get him back on, but we do have more of a question about the data use, and we want to have some assurance that that's not problematic, a particular statement in there controlling the data that we're going to work on jointly. So we'll clarify that with Mark before we move forward with the decision.
Okay. All right. Thank you. Good night.
Bye. Good night.
And thanks, Joe Hood, for being with us and streaming things for us today. Thanks,
All right.
everybody, for joining.
It was
Thank
Donna.
our 15 watchers. We just had 19 until you said adjourn. Wow, good for them.
Wow, they put in a long day with it.
Um,
Thanks,
one thing-
everybody.
One thing before